Hello and welcome to World Cancer Day on February the 4th, 2022. Another day to celebrate progress that we've seen in cancer control around the world. Thank you very much for joining this live broadcast, which will go on all day, based out of these wonderful offices that have been converted into a studio in Geneva, Switzerland. So on February the 4th every day we celebrate progress in cancer control, but more importantly we bring the community together and we highlight the advances that each country and organisations have made around the world. And in this broadcast we will bring you individuals who have experienced cancer themselves or through their family, but also have made a difference to cancer control in their own country or their own city or the region. We'll talk to some global players who've made a difference globally, and we'll introduce you to people who really hopefully will inspire change around the world. This year the theme is Close the Care Gap, to address inequities around the world. Inequities will exist anyway and we see them on a day-to-day basis, but they impact the chances of someone developing cancer in their lifetime and also someone surviving cancer. So we will highlight that over the next 3 years through a campaign called Close the Care Gap. And I ask you to go to worldcancerday.org to read about it, to understand the inequities that drive cancer survival rates around the world. And it will be the theme of this broadcast as we go through the day. Today's live program will be on worldcancerday.org, on YouTube and other social media channels. So please go to worldcancerday.org and see where you can watch all these tremendous interviews. We're not just doing interviews, we've got music, we've got yoga and lots of other things to talk about the different aspects of health and how important they are if you are to reduce your chances of developing cancer in your lifetime. We also have music. We'll have some new music that no one's heard before to celebrate the day, so thank you very much. When you see that later, I'm sure you'll be impressed. And no doubt there'll be announcements from governments around the world committing to improve cancer within their own countries. And I know of a couple which we'll hear about later when the press releases come out. So it's not just a day of celebration, it's a day of action, making things happen. Let's see if we can address cancer in the next 10 years so we can measure progress and continue to see the progress we've seen over the last 10 years while I've been involved in World Cancer Day. Now there's lots of things going on around the world. It started last night in Geneva, in New Zealand and Australia. It's now moving across Asia. It'll be in Africa and Europe by lunchtime. And then we'll see what's happening in Latin America and also in North America. So every part of the world is engaged in World Cancer Day, and we hope, as usual, that we will be trending on Twitter. But let's start with New Zealand. New Zealand, who've already had their day of World Cancer Day, and let's talk to a wonderful person called Michelle Mako, who's the Equity Director at Te Aho, or Te Kaho, I hope I got that right, Michelle, which is the New Zealand Cancer Control Agency. And New Zealand, we know, has a track record of recognising inequities and also addressing those inequities and sort of a flagship of what can be achieved when it comes to cancer control. So Michelle, thank you very much for joining us from New Zealand. I hope it's not too late for you. But anyway, tell us about your organisation and what you do.
Oh, kia ora, Carrie. Thank you for the invitation and for the welcome. Nei rā te mihi ki a koutou mai Aotearoa nei. I send my greetings to you all. So yeah, Te Aho Te Kahu, we are a new agency, roughly 2 years old, and we've been established to provide leadership and oversight for cancer control. So we've been working with policymakers, funders, clinical services, clinicians, researchers, and community leaders to look at what are the solutions and opportunities for improving cancer outcomes, and as you say, to close that equity gap.
So what are the equity gaps that you're focused on in New Zealand, and what are the peculiarities of the country? I mean, I recently saw that you've made great announcements about tobacco control, but what else are you actually doing? And perhaps you can inspire other countries to show us what you're doing to address those equity gaps, and we can share that around the world.
Well, kia ora. Well, like many other nations, our cancer survival rates are improving, but we're actually falling behind a lot of other OECD nations. And so, and the improvement in cancer outcomes are not shared equally. So the inequities here in Aotearoa exist particularly for Māori, our Indigenous people here in Aotearoa, and Pacific people. So here in New Zealand, Māori are more likely to, 20% more likely to get cancer and twice as likely to die from it. So it's pretty stark, and it's a very key focus for us. But like other nations, our gaps are driven by a whole range of factors, including differential exposure to risk factors like smoking, alcohol, poor nutrition, poor physical activity, sun exposure, and infectious illnesses. So those are some of the big things that are driving our incidence rates. But we also have lower screening rates for breast, bowel, and cervical for Māori and for Pacific. We have poorer access and lower utilisation of primary care. And we also having, like many other nations, seen late detection of cancers in emergency departments. And we're also seeing higher cancers, rates of cancer with lower survival, like lung, stomach, and cancer, liver cancer.
That's a story that I hear from many countries, but obviously your agency has been established to address some of those issues. So are there any key programs which you're particularly proud of, which you think could have a major impact on cancer survival by addressing some of those inequities?
So even the establishment of the agency in 2019 was one of those things that we took to really put the highlight on cancer and also on the equity issues, and to address how we fix those, how we identify the challenges and the solutions. We've been really driven with a very explicit focus on equity. So as you introduced me, Kerry, I have a role as Equity Director, and so that's again an explicit decision to make equity part of what we do. It's built into our organisational structure. So we have Māori leaders at all levels of our organisation, from our governance through to our management and into our delivery as well. But we're also building equity into our processes. So, when we develop new projects, when we're thinking about new areas of work, we actually undertake robust equity analysis to try and understand where are the gaps and what are the levers that we need to use to make a difference. So also, I know that a focus for you next year is going to be around engagement. We've already kind of started on that process. We completed 13 regional Māori cancer hui in New Zealand this year, where we spoke to around 2,800 Māori with lived experience of cancer and their families. We talked to providers and communities because we wanted to understand what our community saw as the challenges, so that we could also talk to them about what might be the solutions.
I think your role as Equity Director, I think you're about the only person I've met in my journey around, talking to many governments around the world, where that title actually exists, and I may be wrong, but I haven't heard it. I mean, it's quite unique, and clearly you have a fundamental role in improving cancer outcomes through addressing inequities. What would be the advice to other governments around the world about having an equity director? Do you think that there's real value in that specific role within, like, the health department of a government?
I'd say yes, but you need to be really careful that it's not token, right? So yes, I have the role of Equity Director, but actually I'm not the only person in the agency with equity in my title. So I have a team of 3 who work with me. We have clinical equity leads, and we have 4 regional officers. And in each of our offices, we have a role specifically called equity, and its role is to work across the work program and identify the equity issues. And I guess that the other key part for us is not just about doing the equity stuff for the organisation. We're also working very hard to build the capability of the entire organisation. So through the establishment of standardised templates and tools to drive equity, and also making sure that people are supported as they're doing that work.
Well, that's tremendous. The fact you've got a team around you, that makes life a little bit easier, but also the challenge must be enormous if you've got a team. What do you look forward to in the next few years in New Zealand? What do you think will be the major breakthroughs? What things are going to change the direction of travel for cancer in the country?
Well, we've got some exciting things happening in New Zealand. So we're currently going through a series of health reforms, which are going to lead to 2 new agencies. One is Health New Zealand, which is going to be a new agency for commissioning. But we're also, for the first time, we're going to have a dedicated Māori Health Authority, which is going to have the responsibility to plan and commission health services with a view to addressing equity outcomes for health. We've also been doing a lot of work around cancer services planning, so to think a bit differently about how we design and deliver cancer services towards equity. And today we're really excited. We marked World Cancer Day with the launch of our cancer prevention report. So we really want to drive a focus on the gaps and priorities in preventative care, and ensuring that prevention is a really important part of the cancer work that we do here in New Zealand.
I think the whole community would agree with you that prevention is so important, and yet very little funding tends to go into the prevention challenge for cancer control. A lot of funding goes into treatment and care. And in fact, we've been talking around Europe with our European colleagues about how we could change that balance, because it's a good investment preventing cancer in the first place. What are your own personal hopes for the future? We know that when I talk to people in various organisations, it's actually not the organisation that drives hope and drives change, it's the people within those organisations, and often it's about the imagination they have and what could be achieved in the longer term. So, I mean, clearly you're totally committed to what you're doing. What are your personal hopes? What would you like to see in 10 years' time?
Well, I guess I'd like to hope that pretty soon, and maybe not 10 years, maybe more closer than that, I'd like to think that equity stops being a vague promise to do better or a fancy job title. I really hope that delivering equity just becomes standard practice, a part of our normal cancer care in the future, and that we do that in a way that's really engaging with our whānau and our communities, our families, and making sure that we're delivering what's needed when it's needed to get the outcomes that are required.
Michelle, that is a great way to finish our very first interview for the broadcast. I think you've summarised it correctly, that everyone should be addressing inequity. It cannot be left to a single team or a single individual. And from a UIC perspective, the middle part of our purpose statement says about addressing inequity around the world, and that's why this is so important to us. And I know for many of our members around the world, in 173 countries, I think it is, I hope that they're going to take the next 3 years to really make a difference on addressing inequities. So Michelle, thank you very much for inspiring us at the beginning of our day and at the end of your day. I hope you've had a tremendous time, and good luck with that prevention report. Please send it to us and we'll circulate it around the world to others so they can be inspired. But thank you very much for joining us today, Michelle.
Thank you.
Young and old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and none, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.
Hello to everyone tuning in from around the world, wherever you are. My name's Eric Grant and I'm the Communications and Media Manager at UICC. Welcome back to the World Cancer Day live broadcast program. I'm joined now by Dr. Mohammed Asim Yusuf, CEO of the Shaukat Khanum Memorial Cancer Hospital and Research Center in Pakistan. Dr. Yusuf, how are you doing today on World Cancer Day?
Fine, thank you. How are you, Eric?
I'm great. Thank you so much for joining us today. My first question, obviously, concerning equity, which is our campaign theme. I know that your hospital is doing amazing work in reaching out to underserved populations. Perhaps you can give us a brief overview of the hospital's work, its, how it got started, its mission, and how you see its future.
Yes, thank you. Well, thanks for having us on this program today. Very important day, World Cancer Day. So the Shaukat Khanum Cancer Hospital, Memorial Cancer Hospital and Research Center in Lahore was founded in 1994. But the story really dates back to the mid-1980s. There was a very famous cricket player in Pakistan, now known internationally, called Imran Khan. He was the captain of our national cricket team. His mother developed advanced colorectal cancer in the mid-80s. And it was his struggles in trying to get his mother treated within Pakistan. He eventually had to take her overseas, which was one of the main driving forces behind his desire to establish this hospital. The other being the hundreds or perhaps thousands of poor suffering cancer patients that he saw as he progressed with his mother through her cancer journey in Pakistan, who did not have the advantages that he had, who could not take their loved ones overseas for treatment. And he realized that there was a great shortage of good cancer treatment facilities in Pakistan. So these two things together led him to start a national and then worldwide campaign to raise funds for a tertiary care cancer hospital to be built in Lahore in Pakistan, with a mission to provide world-class cancer care, both palliative as well as curative, to cancer patients in Pakistan without distinguishing between those who could pay for their care and those who could not. And that is the model that we've followed ever since this hospital opened in Lahore in 1994. That once patients are accepted into the system for treatment, physicians and nurses are blinded to the patient's financial status, and patients get whatever treatment they need, regardless of whether they're paying for their care for themselves or someone else has paid for them. Because of the huge number of cancer patients that we have in Pakistan, and because up to 30% of our patients in Lahore came from the northern parts of Pakistan, the Khyber Pakhtunkhwa province, and 5% of our patients actually came from Afghanistan. We established a second hospital in the northwest of the country in Peshawar in 2015. And again, because of the increasing burden of cancer and the paucity of facilities, we're now building our third and Pakistan's biggest tertiary care cancer hospital in the south of the country in Karachi, which is our largest city.
Yeah, thank you so much. And yes, indeed, the issue of displaced persons in cancer care is something we've looked at UICC, and they face certain challenges in addition to access to resources, emotional trauma, physical trauma. And I know that your hospital welcomes people from outside Pakistan, from Afghanistan, Tajikistan. Perhaps you can explain some of the challenges you face in providing care to displaced persons.
Yeah, so even within patients from within Pakistan come to us from, sometimes thousands of miles away. But of course, patients who are not from within Pakistan face additional challenges in terms of actually travel to the hospital, in terms of getting to the hospitals in Lahore and in Peshawar, and then in staying in that city for the duration of their treatment. As you know, cancer treatment is prolonged, multi-stage, involves coming and going to hospitals for chemotherapy, radiation treatments, for surgery. And so what we've done is, first of all, we've increased the number of hospitals that we have. And secondly, we provide facilities for accommodation for patients and their relatives when they come to the hospital. So when they don't need admission, we have what we call musafir khanas, or hostels nearby, which are run by other charities for our institution, where patients and their relatives can stay often for months at a time during the course of their treatment. In these facilities, we provide free meals and lodging facilities. And obviously within the hospital itself, all care is provided completely free to those who cannot pay. This includes meals for the patients, for example, but also a relatively new initiative is that we also now provide meals for the parents of accompanying children with cancer. 11% of our patients are children with cancer. And we also provide accommodation and food facilities for the parents of such patients. So the refugee population in particular is often a population that has had limited access to care in their own countries. And so they'll often present at a late stage when curative treatment is not possible. But we are fortunate to have one of only two palliative care units in the country, and the only one recognized for postgraduate training in palliative medicine. So we are also able to provide palliative treatment when active treatment is no longer possible. So we do try and provide the full spectrum of disease from diagnosis through treatment to palliation and symptomatic and supportive care.
Oh, yeah, thank you so much. You raised two great points, and I think it's really interesting, the geographical location and the what that entails in terms of transportation, accommodation, and that kind of support is as important sometimes as treatment, because otherwise patients drop off, don't pursue treatment. So those are excellent initiatives. Thank you so much. The other one you raised is about the late stage diagnosis. Obviously, the earlier we catch a cancer, the easier it is to treat successfully. And for many cancers now, where we can screen, the survival rates are quite high, but that does require the resources. What kind of technology and innovations in cancer care are you able to provide to your patients in Pakistan?
Yeah, another great question. So, it's part of our mission statement that we aim to provide world-class treatment. We do that obviously because that's a right of patients, that they should get the best possible treatment that they can, but also because we aim to act as a model institution. We understand that one institution or two or even three cancer hospitals now cannot cure the close to 200,000 new cancer patients that are seen in Pakistan each year. But what we do want to do is to try and combat the nihilism, if you like, that has existed, that, excellence is a Western or an alien concept, something that can only be achieved in the West. We aim to show that it is possible to achieve excellence in Pakistan, and that there are alternative models of funding. We don't need to wait for governments necessarily to provide all medical care. So as part of that promise of providing world-class treatment, we aim to stay at the cutting edge of technology as far as possible. We invest heavily in diagnostic equipment, for instance, the usual CT scanners and MRIs and so on. But we were also the first institution in the country to install a PET-CT and a cyclotron system back in 2009. We now have 3 such scanners, 2 in Lahore and 1 in Peshawar. Similarly, in terms of treatment, we have the latest in radiation treatment equipment. We have the largest radiation capacity in the country, 5 linear accelerators in Lahore, 2 in Peshawar, and 10 planned for the new hospital in Karachi. And these are really cutting-edge, state-of-the-art equipment with stereotactic radiation capability on treatment imaging and so on. And again, it's not just so that we can provide optimal treatment, that's the main thing, but we also recruit our consultant staff from the Pakistani diaspora overseas. These are highly trained individuals who then need to be provided the equipment and the tools with which they can practice the skills that they've acquired and can provide optimal treatment for all our patients. Turning to chemotherapy, we try as far as possible to provide the latest in treatment in terms of chemotherapy drugs, targeted therapy, and so on. But we do always wait for the data to firm up. We don't necessarily go out and start using the latest drug that's been shown to be effective at ASCO or a similar meeting. We do wait for the dust to settle, for the data to firm up and show that those benefits are sustained. And then we try and invest in providing that kind of treatment too.
Oh, this is certainly very inspiring. You did mention what can be done without necessarily waiting for government action. However, what would you see, what would you like to see perhaps in terms of national cancer control policies developed that could close the care gap in Pakistan?
Yeah, so the commonest cancer that we see in Pakistan is breast cancer in females. As you know, that's an entirely curable disease if it's picked up early. And unfortunately, although our stage-by-stage survival at our hospitals is similar to that in the West, the preponderance of patients that we see tend to come at an advanced stage when cure is often impossible. So at a national level, obviously, we need to create more awareness of conditions like breast cancer, which if picked up early can be entirely cured. We need to try and eliminate the stigma associated with some of these diseases and the inherent cultural issues which often prevent young females from seeking help at an early stage. We need to increase the number of facilities where such conditions can be diagnosed and treated, obviously. But there are other conditions too in Pakistan that can be eliminated or certainly greatly reduced by public health efforts and so on. So one of the commonest cancers we see is primary liver cancer or hepatocellular cancer, which in Pakistan is largely due to hepatitis B and hepatitis C. Vaccine for hepatitis B exists, and if we can increase uptake of that vaccine, that would certainly help to reduce the burden of hep B associated HCC. And of course, hepatitis C is now completely curable. So if we could increase access to curative treatments for hepatitis C, that would help reduce that quite significantly. Lastly, and perhaps most importantly, from a public health point of view, tobacco and other ingested substances that are used in our country. So tobacco in all its forms, and also the use of betel nut, which lead to lung cancer, cancers of the oral cavity, and so on. These are entirely preventable, and if we had more legislation, perhaps more taxation on these products, that would help to reduce the incidence of these tumors too. So I think from a national public health point of view, obviously in investing in cancer infrastructure, in technology, and in facilities, in providing funding for treatment is obviously important, but these are other things that we can also do to try and reduce the cancer burden over the next 2 or 3 decades.
Yeah, that's very true. I mean, they say up to half of all cancers are preventable through lifestyle changes, healthier lifestyle, tobacco control, and physical activity, and then of course detecting screening for cancers early. In terms of innovation and prevention, what sometimes there is a cost access issue, but what kind of innovations are you seeing that could be very helpful in limited resource settings, perhaps mobile screening units or other diagnostics tools that could really help transform the way cancer may be prevented and addressed in low resource settings?
Yeah, so I think screening is obviously the elephant in the room. There are well-established screening programs and plenty of evidence, for example, for colorectal cancer screening and so forth. But unfortunately, we don't have any national programs for either breast cancer screening or for colon cancer screening or any other cancers, in fact. And that's really a problem at the national level. I mean, that's not something that increasing the number of cancer hospitals per se will necessarily deal with or will tackle. The way we see the future for our own institution and the way we are developing our cancer treatment network is that we aim to establish a series of hub and spoke hospitals. So our hospitals in Lahore, Peshawar, Karachi in the future, and perhaps Quetta and Balochistan will act as our main tertiary care cancer centers. And then we hope to establish a number of smaller diagnostic and treatment facilities in a kind of hub and spoke model around each of these centers, where the diagnostic facilities will be available and what we call euphemistically the simpler treatments, day case chemotherapy, perhaps day case surgery, the simpler radiation treatments will be carried out in those centers, because it's very important that we devolve care closer to where people live, because travel and accommodation and so forth are huge issues in Pakistan for patients. So we do hope that, in the next 20, 30 years, this is a model that will be fully established. And we look forward to a day when all the cancer patients in Pakistan can be treated at one of our facilities across the country. We are already represented in over 65 cities and towns across the country in terms of laboratory collection centers and so forth. So this is the natural way that we see this mission progressing.
Well, thank you so much for sharing that with us and giving your time today. Perhaps just to end up, if Close the Care Gap is the World Cancer Day campaign theme, could you perhaps tell us what Close the Gap means for you?
Yeah. So closing the gap really is all about recognizing the inequities in cancer care around the world. We understand that these are geographical barriers, which we've talked about, the technology barrier, that equipment that you need to diagnose and to treat cancer can often be very expensive. Funding and the resources needed to actually run these hospitals, chemotherapy, drugs are also very important. But we've tended to use generic drugs where we can get chemical and other equivalencies done. So, there are ways around these things. If we try and help ourselves, there is plenty we can do. There are barriers around language and paucity of cancer treatment facilities, but we're a proud member of the UICC, and we understand that it will take a united global effort to build alliances that are necessary to eliminate the scourge of cancer over the next 2 or 3 decades. And as we say in our part of the world, inshallah, with the will of God, that can be done.
Well, thank you so much, and we have a great rest of the day for World Cancer Day. Thank you very much, Dr. Yusuf.
Hi, and welcome back to the World Cancer Day live program. I'm really thrilled to welcome on today's session Paula Radcliffe. She is a marathon world record holder. She ran the New York Marathon. She won the New York Marathon 3 times. She won the London Marathon 3 times, and she won the Chicago Marathon 1 time. And she runs the marathon in a little over 2 hours and 15 minutes. So this is incredible to have her part of the World Cancer Day live program. So thrilled to have you, Paula. Welcome.
Thank you. Thank you for having me. It's a little bit of a step into the unknown for me. Cycling is not anything that I'm particularly good at, but I'm really behind the Solidarity Challenge and to do something on World Cancer Day to try and close that care gap and to do what we can to help people to fight this disease.
I see you're all set to take part in the World Cancer Day Solidarity Challenge. For those of you who don't know, it's the challenge where thousands of cyclists and runners are, and some of the biggest names in sports like Paula Radcliffe are joining forces with UICC to raise awareness for World Cancer Day. So this is the second time that you're taking part in this Solidarity Challenge. Can you tell us why World Cancer Day and just raising awareness around cancer is important to you?
It's extremely important to me. My mom went through breast cancer around the time that I won my second and third New York City marathons. And then through the pandemic in 2020, my daughter Isla was diagnosed with a malignant germ tumor, which was on her ovary, so a teenage ovarian cancer. We were very fortunate in that it was picked up very quickly and dealt with and treated very quickly despite the pandemic. So very grateful to the staff at the L'Arche Hospital in Nice, and then when she had the surgery at Lanval, for the speed that it was dealt with, the way that we were supported, and the fact that now we've celebrated 1 year all clear and we're into the second year. But really opened my eyes to what families go through, what parents go through when a child is diagnosed with cancer, and extremely proud of how strong and how courageous she was throughout that. And then this past Christmas, we went out to Kenya to take part in the Equator Relay there, which was trying to break ground on the first ever children's pediatric cancer hospital in sub-Saharan Africa. There isn't one to this point. So they started construction on Christmas Eve there and really highlighted the difference, because the survival odds for a child facing cancer in Africa are just 1 in 10 as opposed to 9 in 10 here or in the US.
Thank you very much for sharing your personal story with our viewers. I know that cannot always be very easy. I was wondering, you know, how was it to be the caregiver to your daughter, and who was taking care of you while you were helping her?
I think it's really important that, I mean, as the primary caregiver, that I had the support of family and friends around me. It's vital. You go through a lot of feelings of helplessness, wanting to be able to do it for them, but you can't. Questions of guilt. Is it something that I've fed them? Is it something to do with where we live? And that's where it's really important. I think that the medical staff were excellent from the beginning in reassuring me and explaining how this happens, how well it can be treated, and what we can do. And I think for me in particular, that helped to have a plan. From a sporting background, the fact that I could have a plan, we could see the plan was working through the chemotherapy, understand how it worked, and just to take it day by day, much as you do when you're preparing for a big event. You take the training and the preparation day by day and just focus on what you can do and try not to worry or stress about what you can't. So that mentality really helped me to be as strong as I could for her. And I think, yeah, just having that support crew around me, someone I could talk to when I needed to, someone I could cry with when I needed to, someone who could come in and sit with her and support her while I went out to go for a run or to do something to refresh my energy and clear my head and enable me to be stronger for her when I was with her.
Yeah, you mentioned that you went on runs to gather strength. Can you talk a little bit more about the role of physical activity in staying resilient, both mentally and physically, when you go through something difficult like this?
Absolutely. I mean, it's something that I was aware of, I guess, a long time ago. A huge idol of mine, Greta Weitz, went through a very well-documented battle with cancer. She was 5 times world cross-country champion. She was 9 times New York City Marathon champion, and she lost her battle with cancer, I think it was around about 2010, and hugely inspirational in the fact that all the way through the treatment, however debilitating the treatment was, she tried to keep exercise as a part of her day, not to stay fit, but to enable her to stay stronger and more motivated and in a more positive mindset. And I think it's vital throughout the treatment that cancer patients can have access to that for those reasons, not to stay fit and not to focus on training per se, but just to keep themselves as healthy and as mentally strong as possible. And I absolutely think that helps too for the caregivers and for the family and friends around that. It just helps to have a little bit of refreshing, resetting, rebalancing, re-energizing in the day, and also to keep something constant and to keep yourself healthy, because it's extremely important that as the caregiver we stay as strong as possible and don't allow our immune systems to break down under the strain.
Yes, thank you very much for sharing. What would you say would be the life lesson that you drew from this experience?
I think it resets a lot of our perspectives. I would have said beforehand I had a fairly strong perspective on what was important in life, but seeing your child go through something like that and seeing the effect on your family around you, I think really restores that sense of perspective and underlines what is important in life. So I think that was the biggest life lesson, and to not be afraid to lean on your support staff, your support crew around you, and to focus each day on what you can do, not on worrying about what you can't control.
Do you have any words of encouragement to someone who is going through cancer, or to someone who's taking care of someone who has cancer?
Yeah, I think again it would be to focus on what you can do, to ask all the questions, to make sure that you understand what's going on, what the treatment does as much as possible, and to try and stick to that plan, while also accepting that things like white cell counts, there's nothing that you can do to control that. I know it was something that really affected me because there's nothing you can do but wait in that situation for the body to get back on top of things and to be strong enough to face the next stage. So yeah, take in all the information, listen and trust the process and the experts. That would be my big advice, and just keep visualizing the end goal, stay positive throughout and stay focused on coming through this.
So, you know, this is the first year of the Close the Care Gap campaign, which is all about recognizing the inequities in cancer care around the world. Now, you've mentioned in the beginning of our talk your experience in Kenya. Can you tell us why you want to close the care gap?
I think that experience for me in Kenya really brought home to myself, to my family, particularly to Isla. She saw the difference in the chance for the children there, and primarily just because the care is not there, so the cancer is not picked up quickly enough, and when it is, the access to treatment is not available there. So there's a huge gap, and it's a gap that really, I think, in today's modern world and society, it's not acceptable. It's not acceptable that children, just because of where they're born and where they live, face such inverted odds in their survival chances, and I think that we need to do as much as we can to try and close that care gap. That's why I'm really behind this campaign. As I said at the beginning, we were so lucky that we lived in an area where the care was so good and the cancer was treated so quickly and so efficiently. And I want every child to have that chance, every person fighting cancer to have the same chance of beating it, and that together we move everyone's chances forward and keep fighting cancer.
We couldn't agree with you more, Paula, and thank you so much for your support on World Cancer Day and every day for this really important cause. And I just wanted to wish you good luck on the ride. And
Thank you,
we'll
and
see
good
you
luck to
there.
everybody else who's hopefully joining us. I'll be on the ride at 11 a.m. CET, so that's right too. Not really sure what I'm doing, and I'm still learning how to do the chat function, but I'm looking forward to meeting everyone on there, and good luck to everyone, and thanks for supporting.
Thank you.
Hello, my name is Carey Adams and I'm the CEO of the Union for International Cancer Control based here in Geneva, Switzerland. And if you're watching this on February the 4th, it is of course World Cancer Day. A special day for the UIC team and cancer organisations around the world as we celebrate the challenge of addressing inequity through our new theme, Close the Care Gap. It's a new 3-year campaign in which we want to highlight the inequities around the world which prevent individuals getting to the right treatment and care at the right time. Over the last couple of years, we've seen the COVID-19 pandemic reveal those inequities, and of course they continue even as we progress out of the pandemic itself. I'd love you to go to the World Cancer Day website and look at the wealth of information that's available and draw down information that you need in order to learn about inequity. Take the quiz, try a 21-day challenge, but more importantly, if you are doing something today, put it on the map of events so we can see what you're doing around the world. We saw great things happening this morning in New Zealand and Australia, and it's going through the whole planet around to Hawaii. And I'll be following it as it progresses and we see more events put on the map and the social media takes off as well. If you are doing social media, then use the hashtags World Cancer Day and also hashtag Close the Care Gap. It's an important day for the cancer community to announce that we are committed to addressing inequities around the world. And there's so much that you can do as well as working with the rest of the community. So if you are doing anything, follow us on Facebook, follow us on Twitter, follow us on Instagram, post as much as you can so we can raise the temperature about an issue which is so important to the hearts of the UIC community. I look forward to reading about everything you've done during the day and also seeing what impact we have over the next 3 years as we roll out the campaign, Close the Care Gap. Have a great day.
Welcome back to the World Cancer Day Facebook Live. I have the great pleasure, I'm Melanie Sampson, to host today a session about how uniting our voices through the creation of a song can make a difference to close the care gap. And I have the great pleasure and honor to welcome Chris Cheng from the Society on Cancer Advocacy and Awareness, SCAN, Kuching, Malaysia. Chris is the co-founder and secretary of SCAN and also a cancer survivor. And we know each other very well as Chris and SCAN are part of the patient group mentoring program in Asia Pacific. Welcome, Chris.
Good morning, Melanie. It's good to be here.
Thank you so much. And first of all, could you please tell us a few words about SCAN, as SCAN has been active for a few years now in Sarawak, in Malaysia, and SCAN is really a star in raising the voice of the patients, caregivers, and survivors in the region and beyond. Can you please let us know a bit more, please?
Yes, SCAN are actually still quite young. We were established in 2017, so this makes us our 5th year. We are an NGO with a mission to be the voice for cancer patients, and we believe that this is best done through advocacy and awareness. On the awareness side, we believe that education is of key importance in closing the care gap. In Sarawak, we have a high number of cancer patients that are presenting with late-stage cancer. So we hope through our awareness events like webinars, seminars, survivor sharing, we can help dispel myths that are preventing people from seeking earlier treatment. We are also advocating for better care in our state of Sarawak. We have 5 public oncologists serving a population of 3 million. And these 5 are actually in one city. And 50% of patients are outside that city. So not only that, the large percentage of them are low-income households. So even getting to treatment, we're talking about access to treatment. Distance is one issue, and you can see how these gaps are burdening them. So this is what we at SCAN are trying to close that gap.
Thank you so much, Chris. And I remember almost a year ago with SCAN, with the President Boon Wisu and you, we discussed just an idea that it would be great for World Cancer Day to create a song. And you and Boon were great in getting this idea into a reality this year. Can you please tell us a bit more about the song and that was launched yesterday and really where the idea came from?
Well, you were right. It did start off as an open discussion in UICC's Asia Pacific Patients Group. I think we were brainstorming about different ideas for World Cancer Day. And my president, Bunga, is a singer. And both of us were surprised to learn that in 20 years of World Cancer Day, there was never a song. So we both felt that music is useful as a medium to spread awareness and to help heal. Even during my time in chemo, songs did help me process my emotions and get me through the tough times. So we both hope that this song could serve as a memorable way to carry the message of closing the care gap while giving hope, joy, happiness in the world of cancer. And with this UICC small grant that we got, we had a way to bring this to fruition. Even the year before, we already had interest from a singer songwriter, Alina Murang, to help do this, but it wasn't financially feasible. But with the grant, we definitely had a way. As for, after discussions with the songwriter, she had the idea for the song. It was sparked from voices of people who face many barriers, and it comes from proper cancer care. It follows the notion that hope conjoined voices will fill the gaps in cancer care and treatment. So there is a part of the song that goes, "Stand on my shoulders, you see beyond the mountains. No one will be left forgotten, from village to the city to the highlands. My neighbor, my brother, my sister, we can build bridges together. Hope can erase our sorrows. We will see many tomorrows." That is kind of the main message behind the song. That is, no matter your walk of life, no one will be left behind. That is what equitable care is. That is what closing the care gap means.
Thank you so much, Chris. It's so inspiring, and it's so encouraging to see the song becoming a reality. And thank you also for inviting many UICC members to contribute videos, which are part of the video clip for this song. And as you say, really looking towards the future, the many tomorrows that we have to work on closing the care gap is extremely important. And also I wanted to mention that SCAN, Coaching is doing also other activities for World Cancer Day, as you are illuminating this year also the Den building, which is a wonderful occasion to celebrate World Cancer Day.
Yes, we are doing that lighting up in 2 hours.
Yeah, great. Thank you so much. So we'll be watching, and it's always like a very beautiful occasion to celebrate World Cancer Day. And before we watch the video of the song Many Tomorrows, I just wanted to really ask you for your personal personal views on how really we can, by our voices together, close the care gap.
I will keep it short, as I think people are dying to hear the song. My hope is that one day, every one of us can get the best healthcare possible without financial burden, without discrimination, and without fear. That is my hope.
Thank you so much, Chris. It was wonderful to have you today in the Facebook Live. So let's watch the video. Thank you so much.
Thank you, Melanie.
Young and old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and non, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.
Welcome back to the World Cancer Day Facebook Live. Now we have a session on a specific event that happened a few hours ago on intergenerational dialogue between two generations of cancer survivors. We have the pleasure to have with us Maria Fatima Garcia Lorenzo, who is the co-founder and the executive director of the KITE Foundation. And Fatima is a certified child life specialist as well as a psychologist. She has been caring for children with cancer as well as with other chronic diseases for about 30 years. As also the KITE Foundation just celebrated 2 days ago its 30th anniversary. Welcome, Fatima.
Thank you for having me, Melanie. It's nice to be here.
Thank you so much. So my first question would be about the KITE Foundation. And if you could please tell us more about all the KITE Foundation through its support to children with cancer and survivors is really making a difference to close the care gap.
Okay, thank you, Melanie. First, the meaning of kite. Kite is derived from a Scottish word, which means to manifest oneself through simple sharing and togetherness. And we have a flagship program called Child Life Services, and we provide psychosocial support to children and their families in 11 partner hospitals nationwide. And we also have a family support program wherein we are able to provide financial and medical support to children with cancer and chronic illness. So we serve about 8,000 in a year, and both for psychosocial. And we have adopted patients, we call them adopted patients, wherein we provide full financial support to children who are in need of help, of financial help, especially for medicines, transportation. Would you believe even water? We even provide money so that they can buy clean water when they go for treatment. So it's a whole package so that they will be able to have a greater chance to survive cancer.
Thank you so much, Fatima. And really the work of KITE Foundation is truly impressive in the sense that it's comprehensive. Close the care gap is all about social determinants of health, and through psychosocial support, but also the comprehensive support that you're offering to children with cancer and their caregivers is truly important. And as an illustration, so as you know, the first year of this new campaign for World Cancer Day on Close the Care Gap is all about realizing the problem, really reflecting on the different gaps, but also opportunities to tackle inequities in all contexts. So I think the webinar you held today on the discussion, the conversation between the two generations of cancer survivors is truly really a great occasion to reflect on what are the gaps, but also the opportunities to share hope. Can you please tell us a bit more about the conversation that happened this morning?
Yes, I'd like to give you the highlights. So it was a webinar for 2 hours, and we had 2 sets of speakers. We had a advance of age of cancer survivors and the young cancer survivors. And you know what was striking about the conversation was, first, what was common. I'm going to talk about first what was common among them. What made them survive was their will to live, their positive thinking, their faith in God, and family support. But also what was striking was Miss Malu and Sir Edwin, they were able to access treatment, diagnosis, medicines right away, whereas our younger survivors had to strive really line up to get financial help, line up, and even at first they were not even diagnosed right away. They had to go from one hospital to another to get their proper diagnosis. So you could see the disparity between the inequity really of the health system, of the haves and the have-nots. And this has to change. Regardless of age, regardless of socioeconomic status, everyone should have access to proper diagnosis, treatment, medicine, information. The fact that information, one of our survivors said that he did not know what cancer was about. That's why it caused him fear, greater fear, and it held back even for compliance. So these gaps have to be addressed. And on our end with KAI, this is what we're trying to address with our child life services and our family support program. And also on a larger scale, we're also supporting the coalition of cancer support groups so that we're pushing Congress, we're pushing DOH and PhilHealth, our insurance company, to provide really the needs, to provide for the needs of our cancer patients.
Thank you so much. I guess it was a really interesting conversation. It's also an occasion to build collective experience between cancer survivors. Did you have any other highlights about the testimonies, for example, between like older generations could share their experience about their personal, professional lives with younger generations of cancer survivors? Did you have like any testimony that's hope in this dialogue?
Yes, actually what was different was for the adult survivors, you know, they were able to express themselves right away. They were able to ask their doctors for information. They were very straightforward and open. Whereas our younger cancer survivors, they had a hard time talking to the medical team. They had a hard time talking to their doctors because sometimes they think that if you are young, you do not have a voice. And again, that is what we can put forth, that if you are a cancer patient, you must have a voice.
Totally. Thank you so much, Fatima, for this really inspirational aspect, because we can see that this dialogue can inspire and give confidence to younger generations of patients and survivors, but also their caregivers. And it's really a wonderful light of hope for cancer patients and survivors. And as a motto of KAI Foundation is really the hope, and how we can give hope to each other, but hope to change the system also, and to change, as you said, to close the care gap, and on the gaps we can still see today, and even compared to yesterday. And so what are your hopes to change, to make a difference for people living in cancer in the Philippines? You already mentioned like the efforts of the DOH. Do you have any other hopes for the future?
Yes, young or old, as a collective voice, we're able and we should really push, advocate really for more funding for cancer patients in the Philippines. And then because of the National Integrated Cancer Control Act, we need to really encourage the health leaders to implement the law, because it's such a beautiful law. And it covers all ages, all cancer types. So if they're just be able to implement it and really follow what is in the law, I think we will have more survivors in the Philippines. And also add more funding. It's essential. That is the key, because you may have a beautiful law, but if there is no funding to support the implementation of the law, then everything, it will not move forward.
Thank you so much, Fatima. And indeed, health financing is really at the core, and just to have the means to implement the NICA and such powerful laws. So thank you so much, and it will really change the life of cancer patients, their caregivers and survivors. So thank you so much for having been with us today, and we'll be in touch soon. Thank you so much, Fatima.
Thank you.
Thanks. Bye.
Hi, and welcome back to the World Cancer Day Live program. We started the day in New Zealand, we moved to Malaysia, then to the Philippines, and now we're going to make a jump to another continent. We're going to Africa, specifically to Morocco. And it is my pleasure to introduce you and to welcome Bahija. Hello, Bahija.
Hello.
Hi.
Good morning, Janine. Thank you for having me.
So let me introduce Bahija. Bahija is president and founder of Amal, an association dedicated to support patients living with leukemia. She is also a university teacher, an author, and she's a mom with 3 kids. So Bahija, can you tell us a little bit about your association Amal and why you brought it to life and what you're trying to achieve with it?
Thank you very much, Janine. Actually, Amal is a story of hope because Amal means literally hope in Arabic language. Amal is also my story because in 2002, I was pregnant of my 3rd child when I discovered that I had blood cancer, leukemia. And 20 years ago, treatment was not available in Morocco. No leukemia patient group created yet, and psychological support was far away to be a priority in the treatment process. In the meantime, I had to travel far to see my hematologist and bring my medicine. I was also working, which allowed me to cover transportation fees and my health insurance. But this made me think about other patients who are illiterate, in need, without any health insurance and living in rural areas. So I felt the responsibility to help and serve them. And all these reasons were motivating me to get involved in patient support and advocacy and create Amal. And I believe that Amal could provide assistance to patients and family and improve access to proper treatment and correct monitoring to all patients in Morocco. And these actions will help raise awareness. We need to raise awareness and prevention and education to fight cancer stigma and improve policies and decisions in favor of cancer patients in Morocco.
Thank you so much for sharing your inspiring story with us, Bahija. So, you experienced barriers to cancer care firsthand. Can you tell us, in your view, what the biggest challenge is in addressing cancer inequities in Morocco?
In fact, in Morocco, many things have improved in the last 20 years, but we still face challenges. And I think the first challenge remains access. I believe no cancer patient deserves to die due to the lack of cancer. We still need equal access because without access, nothing else matters. And the second challenge is centralization of care and long waiting list to have an appointment. People have to travel far to get help, see their doctors and bring their medication and do their examination, tests or chemotherapy. And most often those patients are the poor ones. And another challenge, the third one, is lack of collaboration and support from government to patient organization, to patients and families. For example, in our hospital, we need a dedicated space to patients and families to discuss and assemble, to organize maybe event, to support each other, share their stories, and so on. I believe that no one should face cancer alone. And psychological support is what patients are looking for when they first know about their cancers.
You know, this is the first year of the World Cancer Day Close the Care Gap campaign, and you addressed some of these barriers or these gaps that people experience in getting access to cancer care. Now, how are you going to celebrate today's World Cancer Day?
Janine, before talking about celebration, I want to share this good news with you. Our main project in Morocco is building a patient home called Dar Al Amal in Arabic, which means home of hope. And this home will be for 30 patients and parents. And we already fundraised and bought the land, and we built the patient home, and now we are finishing the construction, and we hope to inaugurate it very soon. We will certainly provide accommodation, food, psychological support, and transportation from and to the hospital. And the patient home is very important because cancer patients often discontinue their treatment because they can't afford transit fees, pay hotel, for example, and other expenses. This project certainly will reduce the financial burden of cancer and help patients and parents to overcome cancer together. They can, for example, cook and eat together. They can support each other, do activities, share stories, build friendships, and learn from each journey. I'm really confident that this patient home will play a big role in patient well-being and recovery. And regarding to your question about celebrating World Cancer Day, we are organizing a social media campaign about our patient home. We produced a video about the role and the importance of this structure in allowing patients and parents living far from the hospital to be treated with dignity. And we also produced a poster about equity in treating cancer that we already shared on our social media platforms. And we were also published in national newspaper articles.
We're certainly looking forward to seeing how it progresses, this House of Hope, and we're going to continue to follow your story, Bahija. It's very inspiring, and so we're really looking forward to that. Now, can you tell us why World Cancer Day is important to you personally?
Personally, World Cancer Day is important to continue to raise awareness about equity issues in cancer through engaging discussions and educational materials and resources with health insurance, physician, medical authorities, patients, patient advocates, and all stakeholders, and try seriously to find sustainable solutions. I think World Cancer Day is also a good opportunity to remember us that we should continue fighting to make this world better to cancer patients. We should stay certainly committed to our vision, to our goals, and to patients' need, and of course get involved and inspired of the practices of developed countries and adapt them to the Moroccan context. I think World Cancer Day is also a good opportunity to share best practices and learn from other patients' organizations in order to make meaningful and positive change in cancer patients' lives.
And what would you say are your hopes for the future for cancer care in Morocco?
I think my hope is to improve access to care and treatment to all patients in Morocco. I also aspire to a world free of inequities in treating cancer. Wherever you live, whatever is your gender, your salary, or your age, you deserve to be treated with dignity.
Thank you very much, Bahija, for your words of hope and of encouragement, and thank you for sharing your beautiful story with us and our viewers and the World Cancer Day community in general. You're definitely a source of inspiration for everyone, for all of us. So thank you so much, and I'm sure we'll see each other very soon again.
Thank you very much, and I hope successful and productive event to all patients organizations around the world in this occasion of the World Cancer Day. Thank you very much, Janine.
Shukran.
Shukran.
Hello everyone and welcome back to the World Cancer Day live stream. I'm Charles Refkin, I'm the Senior Digital Strategy Manager at UICC, and it's my great pleasure to welcome the next guest that we have, Nicole Grant. Hi Nicole.
Hello, how are you?
I'm fine. Thank you
Good
for
morning.
joining us. I know it's quite early for you. Nicole is a certified yoga therapist and teacher trainer, founder and manager of the Mandala Project. And she also happens to be related to my colleague, Eric Grant. How are you?
I am well this morning. Thank you. Thank you so much for having me on this very important day.
Thank you so much for joining us and for agreeing to do this yoga session with us. But before you start the session, I would like to ask you, if it's okay, how yoga helps you in your life.
The biggest thing that yoga has done for me in recent years, in sort of the last couple of years, especially in the sort of age of the pandemic, that I think affects everyone, is grounding. So it really helps to physically ground the nervous system.
Mm-hmm.
And then in general, it really is just a way of grounding the mind. The mind tells so many stories and so many narratives, and we can spin. And that actually begins to affect our physiology, literally, for anywhere from insomnia to digestive issues to heart, right, cardiorespiratory issues, anxiety, depression. So in this way, when you start to ground the nervous system, like literally, you start to ground we refer to it as the sympathetic and parasympathetic or autonomic nervous system. So we actually invite the body to start to slow down. All of our physiological processes begin to slow down. So for me, I actually started this journey because of my mother's diagnosis with non-Hodgkin's, T-cell non-Hodgkin's lymphoma back in 1993. And she's a survivor. She's still alive today. So I'm very grateful to my mother on so many levels for having brought me to this practice, and so grateful to the practice for allowing me to cope with, to build coping mechanisms with which to both ground my nervous system, to anchor myself, to get out of my head, and to be in my body a bit more.
Yes, it does sound the perfect thing for me right now. A bit nervous speaking live. Could you help us unwind right now and walk us through the yoga session? I'm not sure I have my yoga mat ready here, but maybe I can follow along later.
Yes, so I'm going to have everyone just start by sitting on their mat. I want to start the session by saying I do have a chair because I think some people get very scared off by yoga, thinking that they have to turn themselves into a pretzel. And really all it is for me, it's about grounding the nervous system. So we're actually going to start lying down on our back this morning, but I do want you to have access to the chair. And because, of course, I don't know everyone's bodies, I'm going to point out just variations of the different shapes that I put the body in. And the reason I'm having you start lying down is because it's the most restorative position for the cardiorespiratory system, so for the heart and the lungs. And most of the practice for me, actually all of the practice, is about the breathing. The breath is referred to in Sanskrit as the golden thread. It's that which connects consciousness, right, with the realm of the physical body, of what is anchored in reality. So we're going to just attend to our breathing as we kind of get into the body a little bit this morning. So I'm going to relocate to my mat. Yes?
Sounds great. I'll see you at the end, but thank you
Fantastic, so much. Fantastic. I want to sort of get a little bit in there for everyone. Okay. So we're just going to start lying down on our backs with the feet flat on the floor. Right. So just make sure that your head, right, your upper back and your hips and the heels of your feet are level. What I sometimes do is I take a pillow or a folded blanket or towel, and if you find that your head is falling back, a lot of times that's tension in the neck and shoulders. It could be a structural thing in the neck, right? So in that case, I just use your head, the other to place the towel or the rolled up blanket under the head and neck, not under the shoulders. And I'm just going to have you take your arms out to the sides. If you need to, just place the hands on your thighs. I'll just do this because of contrast, so you can sort of see where my hands are. And then again, I want my sacrum, which is the lower back, to be grounded. This is grounding our central nervous system, the brain and the spine. So I'm just going to have us start by resting for a moment. And again, you have the option of taking the arms out to the sides. For some of you, I'm going to actually have you bring your legs up. You might have the flexibility, right, to keep the legs. You want the legs to be extended and perpendicular. So they extend and fall, if you will, into the hip socket. So this is a posture we refer to as Urdhva Prasarita Padasana in Sanskrit, which just means that the legs are extending towards the sky. And it's a way of inviting vascular flow back to the heart. So where if you're on your feet a lot during the day, this is actually a really nice thing to do. But it does require some flexibility in the hamstrings, some extension, right, in the legs. So we're just going to start by attending to our breath. So I'm going to invite you to close your eyes, to feel the weight of your back body against the ground, to notice the points of contact of your body with the earth. The head, the back of the heart, the hands maybe, the hips, the heels of your feet, the toes. Just take a moment to notice if there is tension, if you're holding on somewhere. A lot of times it's the hips. And again, if your legs are extended towards the sky, just make sure you're not clenching with the hips, that there's a sensation of the skeleton, right? The bones of your legs falling into the hip socket, the femur. Relax the tongue. Soften the jaw, the space behind the eyes, between temples. And then just begin to notice your breathing. Just begin to watch the very gentle ebb and flow of your breath. And with an exhalation of the breath, I'm going to have everyone bring the knees into the chest. So if the legs are straight, you bend them and draw them in towards the sternum, in towards the breastbone. If they're on the floor, you might be working with one leg or both. So it depends on what feels appropriate for your body. You might United States. And then, you know, you can, if you have both legs folded in towards the chest, squat from side to side. Add in a little twist here. So from here, we're going to lower the knees over to the left. I'm going to show a couple of options. So I like to take the arms out because it helps to stabilize. You might take, I have blocks handy, but you can take a rolled up towel or a pillow, and I place that between my inner thighs, good, and the knees, and I'm going to lower the legs over to the left, good, with a nice little twist. Make sure you're not pulling on this right shoulder. So if the knees are falling to the left, I want to make sure that my rib cage, my abdomen are drawing back, that this top hip is falling back a little bit, and I'm going to open up. So this is rotating the torso to the right. You do not want to twist the lower back. There's no rotation in the sacrum, very little rotation in the lumbar spine. So we're focusing on the upper spine here, really inviting the chest to open. For those of you who may have scar tissue, for example, with lumpectomies, chest, pectoral tension, right? Holding tension in the upper body, in the chest. What I would recommend doing is just keeping the left leg straight and then taking that right leg, or just a little bent even, and taking the right leg across. And like that, I'm just going to hold my leg with my opposite hand, nice little twist. I do want to show an option if sitting down for some reason is uncomfortable. Sitting on the chair with the feet on the ground, and all we're going to do is take that gentle twist over to, so in this case, I'm twisting towards the camera, but again, just take a twist in one direction, because then we'll just move it in the other direction. So again, I'm just being very attentive to the breath, supporting the uplift of the heart. Good. Broadening the collarbones. So you get that opening across the upper chest and then a softening of the throat. If the throat and the neck are tight, the breath is going to be restricted, right, as it comes into the body. So I'm inviting the brain to drift back. Good. And then let's bring the knees up one at a time or both together. Good, as long as you're grounding your arms. Exhale, we'll come back to center. And just take a moment to ground. You can take your feet back down to the floor. Breathing in. Maybe the right leg extends this time, right? And that left knee comes into the chest. Maybe you've got the blanket, the towel, the block between your knees, and we're going to lower either the left leg or both legs over to the right, or take your twist if you're sitting, right, to the other side. So again, all I'm doing is inviting a little bit of rotation or turning of the pelvis, rotation of the belly, good, and then opening up of the chest, the sternum. Watch the head. I see a lot of heads being pulled forward. I think it's our devices, you know, computers, reading, cell phones. So be very conscious of inviting the brain to drift back. This is one of the biggest things that brings tension into the upper back, neck, and shoulders that comes from just an activity of daily living. Can the eyes drift back? And I'm always going to invite you. It's always an invitation, not an obligation, to close the eyes so you can really begin to drop in, to feel what's going on in your body. I'm just sort of setting us up for the day here. I like to start nice and slowly. And again, it's just a way of, where am I in my body? What does my body feel like this morning? Rainy days, cold days, you might feel a little tighter. Warm days, sunny days, right? We might feel a little looser, a little bit more joyful and uplifted. So it's just tuning in. What is the sensory, the sensate experience of your body this morning? Let's take one more deep breath in. With the exhalation of the breath, be very conscious of bringing the rib cage back into the body, if you will, right? So this is sort of a projection of the diaphragm of the rib cage. We're going to bring it back, bring the navel back, and then very gently come back to center. And take a deep breath in. Good. We're all going to come up to hands and knees here. So again, I'm going to offer you an option if being on your hands or your wrists is not okay. So from here, you can lower the feet to the floor so if you're lying down, and just windshield wipe the legs. Again, if that's an option, let your pelvis tip with the legs so you're not torquing your lower back. And I'm doing it slowly, right? I'm on my heels, lifting the ball of my foot, lifting my toes. And I'm just going to take the legs over to one side, roll over, right? Stack the legs, come onto the shoulder, use that top hand to ground and press up. So this is a little Feldenkrais method. And then the top leg is going to help to pull me up. And all I'm going to do is rotate. So you can either bring your legs around if that feels appropriate, or just rotate and make your way onto hands and knees. So here, again, use some padding for the knees. Those of you who need to come off the wrists, I really like this because it will help to strengthen the shoulders. You might have to come a little closer to the chair or the sofa or the bed, wherever you are at. This is a really appropriate pose. And some of you might want to tuck your toes. I like to do this with the toes tucked to get a stretch in the soles of the feet, especially in the winter. Again, you may not have a lot of movement in the toes, but if you can, you're going to really flex those toes, right? Just to get a little bit of action in the toes. You have 26 bones in each foot. We need to use and articulate those bones for the rest of the body. We're bipedal, right? We stand on our feet, which means that we want to work with all these articulations in the feet to support the movement, the mobility of the rest of our body. Take a deep breath in. So this is, again, we call this cow and cat. Cow, cat, or cat, cow pose. So all I'm going to do is work with the breath. It doesn't matter if you inhale here or exhale, but you're going to alternate. So I'm just moving up and down the spine, breathing in, breathing out, breathing in. Spread the collarbones as you arch the back, as the belly falls towards the floor. And then as you exhale, I'm going to push the earth away from me with the hands, with the shins, with the forearms, Exhale, and I'm going to hollow the belly, round or dome the back. So I'm really pulling the belly button all the way up into the body. And in this way, you start to articulate each joint of the spine. Watch the head and neck here. Just take the gaze out. Beautiful. And then flex or tuck your toes underneath. And here, again, options. You can walk your hands back towards your knees, keeping the weight on the hands, right? You might take the hips all the way back to your heels. This is going to give you a lot more stretch in the soles of the feet in the plantar fascia. You don't have to do this. You can keep the weight forward. You can also work with the chair. If you're sitting in the chair, just kind of bring the feet back a little bit. And then I just want to finish our practice this morning with a little downward dog. There's nothing like a downward dog just to kind of bring some energy into your day. So from your hands and knees, and again, I'm going to offer an option with the chair. Take those hips back towards your heels. So if you were sitting up, this is called thunderbolt pose, probably the thunderbolt sensation that goes from the feet all the way up the body. That's just a way to wake up. When you wake up the feet, you're starting to wake up the hips, and then you start to wake up the spine. So from here, I'm going to take my hands forward, my hips back, right? And then press, drive down through the feet. So keep the extension of the arms, watch the shoulders here, and then lift the hips to the sky, sacrum to the sky, not the tailbone, right? Think of the sacrum. If you put a tray on the back of your hips, you want it to slide towards your head. And then from here, I like to keep the knees bent, but if you have the ability, you can extend one leg and then the other. So I'm just kind of pedaling out the legs. Those of you who want to work with the chair, you actually bring your hands to the seat of the chair. Same thing, you'll take your hips back a little bit and then push down with the hands, push down with the feet and lift. And then stretch those hips back. So just a really nice way to come off of the hands, the wrists if you have shoulder issues. You can bring the feet even a little closer if you need more weight back on the feet, and then you just stretch your hips back. And I like to let my head fall. But again, some of you may find that you need to support your head, in which case I'm just coming into more of a forward bend. And I'm going to invite you to just kind of work with your breath here. Breathing in. Out. If you need to come out of your pose, or when you decide to come out of your pose, lower your knees, take your toes together, hips to heels. I'm going to have you finish in child's pose, balasana, where the arms can come back. I'm going to put a little blanket here just for a little contrast, right across the crease of my hips. I roll it up just a little bit, and that allows me to bring a little bit of a stretch into my lower back. Those of you who are not doing this because of knees, just lie on your belly, and you can take the hands one on top of each other under the forehead. And find a place to rest your head. You can also work with the seat of the chair. So just take a moment to settle, to ground, to complete your practice with me this morning. Thank you so much for coming.
Thank
for
you so
showing
much,
up.
Nicole. I saw we had an unexpected guest who wanted some camera time. Thanks so much. Actually, one of our technicians was participating in the yoga, so he's feeling much more relaxed now. Thank you so much for that session.
The day for you.
Thank you. Thank you so much for that session.
Thank you very much for having me. Have a wonderful rest of your day.
You too. Bye.
Thank you.
Hello, my name is Carey Adams and I'm the CEO of the Union for International Cancer Control based here in Geneva, Switzerland. And if you're watching this on February the 4th, it is of course World Cancer Day. A special day for the UIC team and cancer organisations around the world as we celebrate the challenge of addressing inequity through our new theme, Close the Care Gap. It's a new 3-year campaign in which we want to highlight the inequities around the world which prevent individuals getting to the right treatment and care at the right time. Over the last couple of years, we've seen the COVID-19 pandemic reveal those inequities, and of course they continue even as we progress out of the pandemic itself. I'd love you to go to the World Cancer Day website and look at the wealth of information that's available and draw down information that you need in order to learn about inequity. Take the quiz, try a 21-day challenge, but more importantly, if you are doing something today, put it on the map of events so we can see what you're doing around the world. We saw great things happening this morning in New Zealand and Australia, and it's going through the whole planet around to Hawaii. And I'll be following it as it progresses and we see more events put on the map and the social media takes off as well. If you are doing social media, then use the hashtags World Cancer Day and also hashtag Close the Care Gap. It's an important day for the cancer community to announce that we are committed to addressing inequities around the world. And there's so much that you can do as well as working with the rest of the community. So if you are doing anything, follow us on Facebook, follow us on Twitter, follow us on Instagram, post as much as you can so we can raise the temperature about an issue which is so important to the hearts of the UIC community. I look forward to reading about everything you've done during the day and also seeing what impact we have over the next 3 years as we roll out the campaign, Close the Care Gap. Have a great day. Hello again, Kerry Adams, the CEO of UICC, based here in Geneva in Switzerland. Going to our next part of the live broadcast with someone who I've admired for many, many years, Lawrence Elagio, who was the England captain for rugby, also in the Lions, I think, Lawrence, as well, and has done a tremendous amount for cancer. So it's an absolute pleasure to greet him, to talk to him for 10 to 15 minutes about what he's been doing today, but also what he's been doing with regard to cancer and raising funds for cancer research, etc. So Lawrence, I can see you're in your kit still. So you've just come off the Solidarity Challenge. How did it go? Did you win? How many people were competing with you?
Yeah, no, it's an amazing challenge. It's the second year that I've taken part, and obviously it raises much needed and enormous awareness for the World Cancer Day, which is something, as you said, I'm very passionate about. Without making too many excuses, I didn't win. I had a few technical difficulties, but I hope to compete a little bit later on again in the day. Obviously, there's thousands of riders all around the world that have joined us, and you know, I just think it's an amazing initiative, and it's something that we need to shine a light on, really. So the more people that can get involved, the better. But no, really, really, really good. Very competitive people up there on those challenges. And as you can tell, even though I have my cycling kit on, weighing in at a mere 120 kilos, I'm not really built for the bike. But maybe into a strong headwind, I'd have lots of people following me. But once you start climbing, things become a little bit more challenging for me.
Well, thank you anyway for participating. And as you said, there's loads of sports stars from around the world who've been part of that, not just doing the cycling, but also doing Runtastic and doing the running as well. So hopefully during the day, we'll get a load more awareness around that community on the challenges of cancer. Now, your journey in cancer has been, driven by obviously a family challenge with cancer. You've done an awful lot. Perhaps you could let me know, what is it that you've done over the last few years, and what are you proud of in your achievements working to raise the profile of cancer treatment, care, and also getting people engaged in the challenges that we face?
Well, obviously, we are all very much aware of the dreaded C word and cancer, and sadly, I don't know whether this is a worldwide statistic, but certainly in the UK, cancer affects 1 in 3 people, either directly or indirectly. You either have cancer and recover, you have cancer and don't manage to recover, or various family members. And for me, my mother, who was a real driving force throughout my life and my career, sadly passed back in 2008. She had cancer, lung cancer, lymphatic cancer, and fought and very bravely, as we all do. But sadly lost her battle. And I think when she was diagnosed with cancer, it really kind of made me sit up and take notice, obviously for the first time, to really understand the care that's available in the UK and very much across the world. And so it inspired me really to do a little bit more, to shine a light on it, to make sure that we, that no matter where you come from, whatever background, no matter where you're born, where you live, that you should all have access to the very best care and treatment available. And I think this campaign, Close the Care Gap, is a really, really important campaign, because it's, what I've learned over the years is that, that the quality of treatment is available in the world, but not available to everyone at the same time. And often, because you live in a certain location in the UK, you've got to travel hundreds of miles to go and receive the treatment that you need. And that doesn't, that shouldn't really be the case. We should have centres of excellence all around the country, put in the right geographical location so that people can receive the care and treatment that they deserve. So I partnered with Cancer Research UK, with Harpal Kumar, who was the CEO back in 2008, and we went on a number of initiatives to raise the awareness of treatment. Whether it was prostate cancer or a number of other, cancers, and hopefully things have improved, but they can continue to improve. We should ensure that everyone has the opportunity to get the best access to diagnosis, the best access to treatment, and also to aftercare as well, because as we all know, the fight against cancer is a tough one for anyone, and it's not something that you deal with in a couple of weeks, and it also affects not just the patient, the person diagnosed with cancer, but everyone around you as well. So yeah, it's something I'm very passionate about, and delighted to be involved in this wonderful initiative and closing the care gap.
Lawrence, it's great you mentioned Harpal there. Harpal was actually, although he was the CEO of CRUK, he was also on the board of UICC for a few years, and he certainly contributed to our global attempt to address cancer control in places around the world, which ironically do not even enjoy the standards of care and treatment that you have in the UK. So that's one of the things that we have raised this as a topic for the next 3 years for World Cancer Day, because every country, everywhere has their own challenges in addressing inequity in access to care. And I'm pleased to see that now the UK, perhaps today, is actually making some commitments to address some of those inequities. And I know you and I have got an interview at the BBC later to talk about that particular issue. But I was really interested in how you translated your frustration and annoyance about the situation and bring together the sporting community to do your things like your rugby works, your cycle slams and things like that, marrying sport with a cause like that. How did that come about?
Well, I just felt that obviously sport has played a huge part in my life right from a very early age. I lost my sister, not cancer related, but I lost my sister when I was very young, and I think I became quite driven to try and use that tragedy as a way of focusing on my career, which turned out to be rugby. Being part of a team was obviously a huge part of that, and really when you get to the end of your career, wanting to use a little bit of that success and recognition and awareness to try and shine a light on on things like cancer and various other charities. So yeah, that was really the driving force for me. And as you say, the inequality gap that exists, exists all over the world, but it certainly exists here in the UK. I don't believe that because of your income status or your education or where you live, or that there should be any discrimination really when we're dealing with something like cancer. And really, what the last couple of years has only exacerbated the issues that cancer patients suffer, because we've all been locked away with this global pandemic, and I think there's an opportunity now to do to shine the light back on it, because cancer hasn't gone away just because of coronavirus. If anything, it's probably become more of an issue. So now is the right time to, not just here in the UK but globally, recognise that we need to continue to take the fight to cancer and do something very powerful. And sport has always got the ability to grab people's attention. I think it's very emotional. It's about love. It's about hate. It's about every emotion in between. And I think when someone is diagnosed with cancer, that becomes very emotional as well. So there is a connection, and anything that we can do to help, I'm certainly willing to get behind.
Lawrence, I could not have summarised the reason that we have World Cancer Day better, and why we have equity as a theme. So thank you very much for your support. And all of your colleagues are involved in supporting the cancer cases, the cancer challenge in the UK. It's an inspiration to other people around the world. So thank you very much indeed. I'm glad you did the race. I'm glad I didn't do the race, because as slow as you may have been, Lawrence, you would have beaten me by miles, okay? So anyway, I'll talk to you later, but thank you very much for everything you're doing.
Thank you very much indeed, Kerry. Thank you.
See you soon.
Welcome back to our live program on World Cancer Day. My name is Nicole Engelbrecht and I'm the Head of Communications and Marketing for UICC. On World Cancer Day today, we're celebrating the remarkable progress that has been made in the fight against cancer in recent decades. And at the same time, we want to highlight the barriers that millions of people face at every turn, every day, when seeking life-saving cancer care. Joining me now is a passionate cancer advocate, Benda Kithaka from Kenya. Welcome, Benda.
Thank you. Thank you so much for having me, Nicole.
Benda is the Executive Director of Kilele Health Association, which is a patient advocacy organization and also a UICC member that focuses on improving the quality of life of cancer patients and their caregivers. Benda, Kenya has seen a big increase in cancer cases in recent years and also an increase in cancer mortality. What are the biggest challenges in facing that situation and also the biggest care gaps in Kenya?
Well, Nicole, as you rightly put, we do have quite a bit of challenges when it comes to cancer care in Kenya, but we've seen quite some bit of tremendous improvements in the recent past as well. So if you were to think about the increase in cancer cases, it's also because of the increase in the awareness, the increase in the investment in the technologies that we're using to make sure that we're getting more people as early as possible. But challenges abound. One of the biggest challenges being awareness at the community level, and therefore being able to engage people to come to access cancer care in the facilities. And this is further made even more serious by the case of where we get many people going to the facilities for screening or for early diagnosis, but they take very long to get their results back in because of issues with the lab network or issues with the number of people that they have to see before they are actually diagnosed for cancer. So you could find a woman comes to the facility early, but it takes about 6 visits before they get the diagnosis. And that delay is quite serious for people in Kenya. The distances people have to seek care, the time it takes for them to get from the periphery in the village to get to the town center where they'll get cancer screening or they'll get the treatment modalities. If you're familiar with Kenya, you would know that majority of our cancer centers are concentrated in Nairobi, the capital city, but also we have a few others in various other cities, but not necessarily at the periphery. So that's yet another challenge that we face in Kenya.
And what do you expect from the government to solve this problem? What are the policies that you would like to see changed?
Our government has been very responsive. I must give credit where it is due. Like even today, we have the government of Kenya is launching a cancer center in Mombasa, which will mean then the people in Mombasa County will not need to travel all the way to Nairobi, or as has been the case in the past. And this has been continuous improvements by the government of Kenya in embracing a decentralization of the treatment facilities to the different places that we have in the country. But what I would want to see more of, and what we are advocating for right now, is easier access to care. And I'll define that by government dedication of resources, both fiscal budgetary allocations, as well as allocation of human resource capacity to be able to meet the need for cancer screening, for cancer treatment, for diagnostics, and even when we talk about for post-treatment reintegration into the community, there needs to be enough resources dedicated to this. And secondly, in dedication of resources and allocation of budgets in the government annual budgets, we need to see more of dedicated resources for awareness and education. Remember, I mentioned one of the challenges we have is awareness and education. And we cannot rely on the NGO sector alone, or we cannot rely on one sector to be the one that's meeting the needs for education at the community level. We need higher level resource allocation for us to be able to make headway. Thank you.
And what is your organization doing to close the care gap and to make your services more equitable?
So Kilele Health is formed on the premise that we want to do as much as possible community engagement and a specific type of a community as well. We work very closely with cancer survivors and their caregivers. And this is deliberate because we want to engage survivors as a link to prevention. How so? If you think about cancer survivorship, people have gone through the cancer journey from finding out about the signs and symptoms or even getting diagnosed before they knew they had signs and symptoms to getting treated at the facility, to having all these barriers that we talk about as challenges for getting access to care. They've already experienced them. And then they've gone ahead and gotten treated. Majority of our cancer survivors are treated in Kenya, and they have the lived experience of where the system is serving them, where the healthcare system is working, where it is not working, what improvements need to be done. They also have the lived experience of the financial challenges that they face, and therefore they know already how to navigate this. So as Kilele, working with the survivors, we are harnessing that power of the survivor. We are equipping survivors with skills on storytelling so that they can tell their stories of impact to influence the community. We're equipping them with advocacy skills so that they learn how to talk to different target audiences, be it a policymaker when we are demanding for resource allocation, to the community level when they are asking that please go get screened because my life story should not be yours. Utilizing that powerful voice of the survivor is very critical to winning the fight against cancer in prevention. Thirdly, we are also focused on research because we know data informs decision making. If we're going to ask for data, for funds, for example, we ought to be able to say, this is the target audience that we ought to be reaching, this is how much it's going to cost. And utilizing research as a tool to inform decision-making means our government can plan longer term. And lastly, we look at it from a point of inspiring hope. And that's what UICC does as well. We look at Kilele as an opportunity to inspire others to realize you can do anything if you set your mind to it. We are the team that climbs Mount Kenya every year with cancer survivors. People who have already been told you cannot do it, and then they come and actually prove they can do things that others who have not gone through the disease can actually do. So far, we've done two cohorts of mountain climbing up Mount Kenya. The team challenged me that we should do Kilimanjaro this year. So we're doing Kilimanjaro and also doing Mount Kenya as well in September. And that's going to be quite an inspirational thing for us to show that beyond the cancer journey, beyond surviving cancer, cancer survivors are able and capable to be equal and able contributors to the economy and also to contribute to the prevention journey. That's what we're doing.
That is so inspiring, Benda, and I believe that's also where your name, the name of your organization Kilele comes from, which means in Kiswahili peak or summit. So I think it's a very great name for an association like yours. You mentioned harnessing the power of survivors. You mentioned the importance of collaboration and awareness raising. How can a global movement like World Cancer Day help with that?
Well, I'll tell you, the reason we were very delighted to join the World Cancer Day and we are part of the UICC network is because we recognize the power in numbers. Like today, we spent the whole day watching, listening from different parts of the world, hearing what innovations people are doing, what work different organizations and individuals are embarking on. We've also spent the whole day discussing what are the challenges, and we get to see that our challenges are not unique to ourselves alone. Others are also going through the same, and they're able to overcome this way. In cases where we see disparities, for example, where we start thinking about gaps in care, or we start thinking about distance and geographical location as a gap, we also have to reflect internally and start thinking, World Cancer Day is a global movement. We are on a global platform. People are talking about issues in northern Northern America, Southern America. We have people talking from Asia. We have people talking in Africa. All these gaps, if we brainstorm together, we're able to find solutions together. But secondly, the power in numbers comes in when we do advocacy. Sitting on a global platform like this, it's quite an honor, but it's also a call to action to all the others who are out there doing advocacy, that we are telling each other we can be able to do this. It is not above us. And the World Cancer Day gives us that opportunity. It also gives us the opportunity for a 3-year call to action to be able to track milestones so that it's not just a one-day affair. We're looking at longer-term improvements in closing the care gaps, but also in bridging the disparities that we see, learning best practice from each other across the globe. And that's what the power of UICC World Cancer Day is.
And looking even further into the future, what are your hopes for cancer care in Kenya, let's say in 10 years' time? Where would you like cancer care to be in Kenya?
Of course, the first thing for me is the HPV vaccination, that we reach the 90% target by WHO. That would be a brilliant, great milestone against cervical cancer. And that would also strengthen the system for further impact on the country in terms of even the screening programs, even the activities around strengthening healthcare and health access for women. But secondly, Kenya has amazing policies. We have great commitment, political will, goodwill. My hope is that as we go along, there will be increased budgetary allocations to match the need. Budgetary allocations to match the need, so that as we do advocacy, we're able to reach as many people as possible.
Are you working together with other organizations in Kenya, and do you collaborate on these objectives?
Seem to be losing you.
I believe we have
Can you
lost
hear me?
Benda. Can you still hear us? No, I think
Can you
Benda
hear me?
can not hear us anymore. So Benda, I will call you afterwards, but I would like to thank you so much for joining us today, and I would like you to, oh, I think you're back.
Yes, I'm
Are
back.
you back? Can you hear me? Okay, good. So I have time for one more question, Benda, but I was already about to thank you for all your inspiring work. I was going to ask you whether you collaborate with other organizations in Kenya, in Nairobi, and join forces with them on this work.
Yes, definitely. We are members of the NCD Alliance, and that is one of our key collaborators in Kenya. We are also collaborating with the government of Kenya, both sitting on technical working groups, as well as representing the voice of the community in different forums where we're able to give input, both technical as well as socio expertise in community outreach. We also collaborate with a university. We've just signed an MOU with a university to do research on stigma for cancer survivors. And this for us is a big milestone because it's part of the work, the mandate that we have to contribute scientific data into the longer term cancer management, cancer control, and survivorship reintegration into the community. We also collaborate with various other organizations, for example, Hope for Cancer Kids. Our role as Kilele, we see ourselves as being able to link with others who have different strengths. We do not believe in doing everything. And so working with both private sector as well as public sector and government sector as well, working with NGOs, we collaborate because we can't be everywhere at the same time. Our strength lies in networking, collaborating, both with patient organizations, as well as with the government policy-making agencies, and as well as with other key players such as the pharmaceutical industry. For as long as we have cancer as a burden in Kenya, all hands on deck, everybody has a role to play, and we are keen to collaborate and partner.
All hands on deck, you're saying, and I really enjoy your positive outlook, and there is so much to do, but a lot of progress has already been done, and your symbol, or the symbolic name that you have, Kilele, which is so powerful, is really encouraging, because we know that mountains can be climbed, mountains can be conquered, and so can the cancer burden. To finish off the interview, could you share a few encouraging words with people living with cancer and their caregivers who are watching us now?
Well, this is so coming from the name Kilele, which means reaching your peak or reaching your optimal. We are forever hiking. And when we go, one of the things that we say is your Kilele is your Kilele. Looking at what others are doing, it's easy to be discouraged, because then you would be saying, oh, I've spent so much on finances for cancer treatment. I have all these issues with acceptance of even personal body image, as well as personal challenges that come after the treatment. Or probably I'm facing this and that and the other problem coming from the treatments. For example, even lack of sleep, insomnia, because of some of the interventions that have been done, is real. But what we've realized with the Kilele team and as we are hiking is baby steps. You cannot climb a mountain by running up the mountain in one go. Like tomorrow we'll be on a mountain, it's called Elephant Hill, and it takes 7 hours to 10 hours of continuous walking. But in that continuous walking, we're able to conquer. The same with life. We cannot congregate everything in one go. We have to think about how do we take everything in baby steps, one piece at a time, break the goals, make them easily achievable. And before you know it, you've reached your Kilele. We wish you the very best. We know it is doable. And even when you have summited, use that knowledge to inspire others. I am daily inspired, daily encouraged by the people that I work with. They are amazing humans who have amazing compassion, amazing joy, and amazing appreciation of life, because once you've gone through a cancer journey, everything else makes sense in the sense of appreciating life more. So keep inspiring us, keep fighting, keep encouraging others to also overcome, because all of us together will win together. Thank you.
Thank you so much, Bender, for these powerful words. Thank you for joining us today, and good luck for all the great work you're doing.
Thank you so much for having me. And thank you to the UICC team and World Cancer Day team putting this together. This is all also great. We've learned so much. Thank you.
Welcome back. Thank you so much for joining us in this live stream that we have today all day, well, between 9 and 8 p.m. on World Cancer Day. And I'm very, very happy to be taking a little bit of time to look a little bit inside of the Eastern Mediterranean region to see how are they closing the care gap. And for this very special segment, and as a testament of the live event that we are conducting, we had a little bit of a technical issue. So one of my guests is joining us, and the other one, unfortunately, for these technical issues, is not yet been connected. So we are going to go ahead with introducing Hannah. Hannah Char-Chuaib. She's the General Manager of the Children Cancer Center of Lebanon. Well, she's an exceptional leader and advocate for childhood cancer. And well, she has been leading the Children Cancer Center for 10 years, making it one of the leading centers for treatment and support of children with cancer in the Middle East. So Hannah, welcome, and thank you so much for joining us today.
Hello, Laura. So exciting to be here today.
It is indeed. So just in case we have finally our second guest joining us, let me introduce him as well for everybody to know. His name is Dr. Saeed Mohsen Rasavi. He's a hematologist oncologist, member of the board of the Mohammad Hossein Rasavi Charity Institute from Iran. That is the only organization focusing professionally on young adults with cancer. And this organization has been founded in 2017. So Hannah, I'm going to start with you. And actually, Hannah is a member of the board of directors of UICC since 2020. And nobody better than you that give us perhaps this regional perspective on what are the gaps in cancer care in the Eastern Mediterranean region. So over to you, Hannah.
Allow me first to say a big congratulations to all the UICC World Cancer Day team for the new theme. Actually, it's a very beautiful one, and it just hits the right notes. The campaign had been going great so far, and I see lots of members are enjoying it. So congratulations again.
Thank you.
Actually, the recent statistics in the Eastern Mediterranean region, they indicate that it is witnessing a rise in cancer cases. And then due to crisis in several countries across the region, cancer care gaps widen and increase every time. We're facing different problems. And this is affecting this is affected basically by the limitation of resources, by inequitable distribution. And this is the importance of the theme because it highlights and it pinpoints these issues. Now we have several barriers and inaccessibilities for minority and refugee population. And we have as well limited capacities among healthcare professionals and workers. And this is also in addition to the absence of policies and national strategies implementation to ensure adequate cancer care. We have like the awareness and the cancer prevention campaigns are still very shy. And this is what we're trying hard to highlight on and to encourage everyone to focus on, as well as the access to screening services. And here COVID played an important role in also hindering most of the people to go to the regular screenings that they, and to the monitoring that they usually supposed to have. This is specifically in some low resource settings. And also we have the access to adequate treatment, which can be very difficult in several crisis zones. Nevertheless, the region always boosts with action, and there is too much momentum and cooperation across the countries to support each other. And I think by this, we can help to close the care gap.
That sounds very, very inspiring, and actually really is wonderful to hear. Is music to our ears to hear these comments about the campaign, Close the Care Gap, as you said, like hitting the spot. So this is always, this feedback is always really welcome, Hannah, so thank you for that.
Now that you gave us we set the scene a little bit on those barriers that you mentioned, can you perhaps tell us a little bit what are you doing to fill those gaps? Like what are the steps that you're doing to close those care gaps?
You see, Laura, it's very difficult here because the region is different from one country to another. And however, I'd like to acknowledge and highlight on the crucial role that the civil society organizations, as well as the NGOs across the region, they're playing a very important role in closing this care gap. Now, several governments like what we have in the United Arab Emirates, they are at the forefront of introducing new policies and strategies to enhance cancer controls. Now, other NGOs across the region have really pioneered in launching campaigns and mobilizing resources to promote awareness and ensure access to treatment and care for the most helpless patients. I think Dr.
We have a little bit of trying to join us from Iran, I think. Continue.
Hello, Hannah.
Hello, Doctor.
Yes. Hi, nice to meet you after some troubles.
Oh, hello, Dr. Rasavi. Nice to see you. Well, no, we don't see you yet, but
Thank
we hear you.
Glad to have you finally.
Glad to have you. Dr. Rasavi, if you don't mind, Hannah will finish with her intro. She was giving us a little bit of like some information, so we will continue right back on you, if that's okay. Hannah, please continue.
Yes, I was just highlighting the importance the NGOs are, the role of the NGOs that they are playing across the region and how they have pioneered in launching campaigns, mobilizing resources, all of that to promote awareness and to ensure access to treatment and care for the most helpless patients. A lot of regional collaboration and global reach is being done to empower healthcare workers with knowledge and capacities, and also to enhance services. We at the Children Cancer Center of Lebanon, we ensure access to adequate treatment and care to all patients with cancer in Lebanon, and are engaged with all national stakeholders to enhance our cancer control strategies and policies, despite all the challenges that the current ongoing crisis is posing on the country.
Excellent, Hannah. Thank you so much. Dr. Rasavi, I don't know if you're there with us. Thank you so much for joining us, and I understand that it's been difficult to get the connection going, but please perhaps give us briefly an introduction about what are the cancer gaps that you are finding in Iran. I don't know if we can. Can you hear me, Dr. Rasavi? I'm afraid that we are not connected. This is live. I'm really sorry. This is what happens when we are in a live program. So I'm really sorry, Dr. Rasavi, but it seems that we cannot connect with you at this on this occasion. Hannah, perhaps we can pick it up there. You were talking about lots of examples in the region. Can you perhaps expand a little bit more about what are you specifically doing in Lebanon and in the Children Cancer Center?
Yes, well, actually the past 3 years have been very, very difficult for all the Lebanese people, as well as for anyone residing in Lebanon, because many crises were happening one at a time, and like you have not even been done from the first one until you start with the second, and it's very difficult to cope with all of that. So with all the political uncertainties, we had the financial and the economic crisis, as well as the pandemic and the explosion that happened in August 2020. However, so this all had played the major role in having all the efforts on a national level are really very scarce. And the civil societies are taking initiatives to close this care gap. One of the main challenges we face is the financial burden and the out-of-pocket payments by patients, which is due to the devaluation of the Lebanese pound. This had been really very difficult and had deprived many of the families and many of the patients not to continue their treatment. So add to this, this crisis and the devaluation of the Lebanese pound, it played a big, it was a major factor in allowing most of the, in having all the immigration of most of the medical staff, which led to downsizing some of the hospitals and the absence of some expertise. To cope with that, the Children Cancer Center of Lebanon, we had launched its national fund program, which is to ensure access to and coverage of medical and psychosocial treatment to all childhood cancer patients in Lebanon. And this had happened while partnering with 10 hospitals across the country. And we helped, for the past 2 years, we had helped more than 700 patients to continue their treatment and to start treatment, the new cases to start treatment all over the country. In addition to that, something very, very important had happened is that CCCL had pioneered with the national HPV vaccine program. This was as a commitment to the WHO strategy to eliminate cervical cancer, where over 100 children, whose age were between 10 and 15 years, took the vaccine and they took it for free. And here I'd like to highlight a point because we had also some cases of this age bracket who had already started the vaccine, but due to the shortage in medication, they couldn't find it anywhere. And this is where CCCL had stepped in and supported in continuing to provide this vaccine. So here we'd like to have plans. We have plans to grow the HPV vaccine program. And by ensuring definitely this, we can't do it alone, but we need to ensure national and international partnership to provide more access to this vaccine and to create comprehensive data registry and interactive platforms.
Wonderful, Hannah. Thank you so much for that. So I think in what you're saying, there is obviously a lot of hope on overcoming these barriers and these gaps in the future. So I would like, if you don't mind, to share with us just as a brief section to finish your speech here. What are you doing to celebrate today, World Cancer Day at CCCL? What is the plan for today?
Well, the day started was so wonderful, and we at the CCL, we just finished the daily art activity with childhood cancer patients and their parents, and you can see behind me here all the samples of the beautiful work that had been done today. And also earlier today, we had done a healthy lifestyle session to our employees by a licensed dietitian and distributed healthy snacks. We are getting also ready to give awareness sessions about childhood cancer control in Lebanon at one of the most prominent universities in the country during the upcoming 2 weeks. Also, we will be visiting patients across different hospitals all through the month to spread the celebration and solidarity and to honor and thank the healthcare workers who are giving so much and are caring for our cancer patients. Yes, Laura, you had mentioned something is that we need to have hope, and definitely here in Lebanon and in most areas of the region. We face never-ending challenges, but we cannot lose hope. And I'd like here to thank the philanthropists and the contributors who continue to support populations in need. The region, there is a lot of will and determination in the region and in closing the cancer care gap. And we can always achieve success and overcome all the challenges when working together hand in hand. Many efforts here reflect these cooperation and collaboration. I'd like to highlight also that we are jointly with the King Hussein Cancer Foundation in Jordan releasing a statement highlighting the importance of addressing cancer care in for refugees in our region. And also members, I'd like really to congratulate organizers of the Gulf Cancer Week for their efforts and their activation, namely both members of the UICC who are FOCP and QCS. Now, I understand that members and I know that members across the region had done many activations, a lot revolving around raising awareness, education, lighting monuments, media, stakeholder engagement, and this is really a wonderful height. We cannot but have hope. And we cannot but also hope to have peace, because of this continued cooperation and collaboration, we will be able to serve and to enhance the lives of people with cancer in general.
Thank you, Hannah, and really a beautiful way to finish this segment. Of course, let's hope for peace, and inshallah, let's close the care gap in the Middle East. Right? It's really a nice way of closing. Thank you so much for being with us
today.
Thank
you, Laura, and thank you to all the team, especially on this day. I know how hard you work to have it happen and how early you plan to be able to have everything being set and organized and ready for the day.
Thank you, Hannah. So thank you so much, and to everyone watching, continue. We will be back after a short break. So enjoy the rest of the live program. Thank you.
Thank you.
Young and old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and none, everyone. Far more unites us than divides us. So let's all agree, the people, the powers that be, to make the world aware we need to close the gap in cancer care.
Next up we have Judith Gedimus joining us. Editor, novelist and poet, Judith Gedimus has lived in London for the past 25 years. She was born in Colorado and still misses the mountains. Her poetry book, The Swerve, published by Carnanet in 2012, was shortlisted for the Seamus Heaney Prize for Best First Collection. In 2019, Judith was diagnosed with anal cancer. Chemo, radiation, and 2 major operations followed. Poetry has been a route for understanding and coming to terms with her illness. Along the way, she has met some extraordinary people: doctors, nurses, technicians, and therapists. Rather than narrowing her world, cancer has broadened her life experiences. That's not to say it's been easy. Confronting prejudices against anal cancer has been a real challenge. Judith doesn't consider her work to be confessional, but she does hope that by describing her experiences, she can help others to understand and tolerate this rare condition. Judith is going to read 4 poems. In the first, she expresses her ambivalence about the word remission. The next 2 poems are about the extraordinary acts of kindness shown to her by 2 people involved in her treatment, a doctor and a night nurse. The last poem is set on the banks of the Thames. The title, Anemocry, means seeds dispersed by the wind. That poem, which was written in April of last year, is no longer quite accurate, she's glad to say. It looks as if she may now live to see another spring. Hi, Judith. It's great to have you with us.
Hi. Hello, Alex. It's so lovely to see you, and thank you for inviting me to this extraordinary event. I've really been looking forward to it. So I'll get started with the poems. The first is called Fear of Thresholds. She thought she'd welcome the word remission, given her fear of telltale flares on a scan. But she fears too the malign cells that escape detection, like planes that fly under the radar. They're present, yet absent. Below the threshold, rogue cells thrive, according to Darwinian principles. They evolve to fight their enemy, the body, to occupy it by stealth. Silently, they lie in wait, like infant crystals on the verge of precipitation, ready to dye her life with dangerous colors that nothing can wash out. So she rejects the word remission, which tempts her with improbable futures. Summers on the beach, turquoise water, a beloved body lying next to her, lashes bleached, lips cracked, skin caked with salt. Biopsy. The name's just a scrawl on the form, though I'm sure it was Arabic. Dark eyes above the mask, voice courteous, detached. I lie on the table, bare my groin, cold gel on the skin, probe searching for the inguinal node that shone bright on the PET scan. There, he says, pointing to the screen. That's what we're after. Cold swab, then a local, then the hollow needle driven in with great precision. A loud click each time a core of flesh is severed. The samples curl in glass tubes like the tails of miniature seahorses. Will they take out just this one or the whole string, I ask. He must have seen the worry in my eyes. He stripped off his blue gloves, washed his hands, pulled down his mask. I shouldn't do this, he said, as he held my hand and stroked my forehead. He's strong. He said it over and over, as if he knew what I was in for. To Magdalena, my Namibian night nurse. Tall, genial shadow lights my night, delivering cheer and morphine in equal measure. drops under the tongue, thick, dark as wine, bouquet of nettles, ash finish. I am her Lazarus, unwound from soiled sheets. She tends my wounds as dunes are smoothed by breezes, their touch light as her touch. I close my eyes, fan palms clack and rattle, tongues click. Bare feet cross rippled sand, tracks blend with other tracks. Dawn, lean as jackals, seeps through blinds. All day I miss her touch, those hands, briefly mine, that seal our temporary bond. This is the last one with that tricky word, anemocry. On the foreshore, 2 crows harass a heron. They're all bluster, flapping at the water's edge as the heron stalks away, mildly offended. No need to throw a stone or flap my arms. The drama's ended. In my mind, I dress the heron as a repressed Victorian, whalebone corseted, dangerously thin, secretly addicted to comfits and laudanum. My final spring is half gone. Heavy as snow on bent boughs, hawthorn blossom recalls other Mays carelessly spent, ignorant of endings, days building and vanishing like cumulus clouds. I hear that the stratosphere is thinning, that melting glaciers have shifted the Earth's axis, and I react with selfish detachment, thinking, this is not for me to see or solve. At high tide, the sailors appear, tacking from shore to shore, bobbing on wash, trying not to capsize or collide. A sudden shower knocks winged seeds from ash and sycamore, carries them far. The friend who walks beside me explains their anemocry. My magpie mind seizes the new word, plots to make it fit into a poem. To sail across high waters, to be dispersed like words or seeds, that's what I wish for. Thank you.
Thank you so much, Judith, for your beautiful words. I'm sure they'll stay with us long after this live stream. I have a few questions. The first is that talking about cancer and our experiences makes a huge difference in increasing understanding, overcoming stigma, and reducing fear. How do these poems help you cope with cancer?
For me, poems are like a direct line to the unconscious. They give you access to feelings that might not come to light in other ways. And by giving form to deep emotion, I think that poems can contain feelings that otherwise might be completely overwhelming. I think that whether you write prose or poetry depends in large part on temperament. And for me, I feel most stimulated and most alive when I'm writing in a form that's very dense and concise, and that uses figurative language to make leaps and connections between images and ideas.
Yeah, that makes a lot of sense, but obviously for some people it's difficult to begin expressing those feelings, those difficult feelings in words. So what words of advice would you have for someone who's maybe thinking of writing?
Sure. I think one thing I would say is that it's great if you can start keeping a journal and try to write every day, even if it's just for 5 minutes. Jot down random images, sensations, fears, dreams, and try not to be too critical. Don't worry too much about form. And then you may find that the journal will give you raw material that you can draw on later when you start writing poems. The other thing I would say is to write for yourself. Don't try to please anybody. Don't try to picture an audience. And if you find that impossible, try to write with just one other person in mind, almost as if you were writing a letter. I would say to try to be concrete and specific, to write about things that you can see, hear, taste, smell, or touch, and avoid abstractions, at least at first. And the other thing is just to read a lot and to listen. Try to read as much poetry as you can, and try to listen to recordings of poets reading their work. I will mention one good source in English, which is the archive published by the Poetry Foundation, which contains both biographies and recordings and words of people reading their work.
Okay, I'll be sure to check out that source. Thank you for the advice.
Yeah.
And finally, as you know, the theme of this World Cancer Day and the theme for the next 3 years is Close the Care Gap. Why do you want to close the care gap? Why is that important to you?
Well, I think that the first thing relative to my condition is that I would hope that we could reduce the stigma against kinds of cancer that involve intimate parts of the body, such as anal cancer. I can't tell you the number of times I wished I had cancer of the elbow or something that was very easy to talk about. I would also hope that we could encourage education and funding for HPV-related cancers, cervical, anal, oral, and sometimes types of throat cancers, because once these cancers were rare, and now they're very much on the rise, especially among young people. The last thing is that I hope that we can increase research and funding for so-called orphan conditions. And those are cancers that are so rare that research labs and drug companies have been reluctant to study and develop treatments for them. And this includes anal cancer, along with certain types of bone and pancreatic cancers, multiple myeloma, and some types of lymphoma.
Thank you so much, Judith, for your answers, for your poems, and for being with us today. It was really great to have you here.
Oh, such a pleasure for me as well. Thanks so much.
Bye.
Bye.
Hello, and welcome to the World Cancer Day live panel discussion on cancer and aging. I'm Susanna Deveceri. I'm the Global Oncology Medical Head at Sanofi. And we are preparing a very interesting session for you today. So why do we need to talk about cancer and aging? And why we are talking now when there is a new initiative, when Close the Cancer Gap starts, and it will last in the next 3 years. If you look at the world cancer population or overall world population, half of them don't have access to essential healthcare. And if we are looking elderly people and with cancer, it's even a bigger issue. If you look at the next 20 years, people being older than 60 years will double. And if you look at the cancer cases, where 37% happens already in the elderly population, in the next 20, 30 years, it's going to double as well. So this is a very important issue that we want to address today. And we want to also discuss what we can all do to close the cancer gap. So I'm very glad to have two brilliant panelists with me today, Dr. Niccolo Battisti and Dr. Rania Azmi. So Dr. Niccolo Matteo Luca Battisti is a medical oncologist working in the breast unit of the Royal Marsden NHS Foundation Trust in London, UK. He spent the last year of his specialist training working with Dr. Martin Exterman at the Senior Adult Oncology Program at the Moffitt Center of Tampa in Florida. Dr. Battisti's main areas of investigations are comorbidities, comprehensive geriatric assessment, quality of life, and prediction of treatment toxicity in older patients with cancer. And this is our pleasure to have Dr. Rania Azmi as well, who leads the FADIA Survive and Thrive Association in Kuwait that supports cancer awareness and is an advocating curing cancer. As a patient advocate for over 10 years, she actively participates in various international cancer conferences, advocates for patient perspective based on research, real-world cases, and publishes researches, abstracts, publication. So welcome, both of you. We are very glad to have you both. So I would like to start the discussion asking you both
awareness on the importance of addressing the needs of all the individuals with cancer at global level. I am the president-elect of SIOG, the International Society of Geriatric Oncology, which is a leading organization in this field. And within SIOG, we are addressing and tackling a number of gaps in this specific field. And you can essentially summarize them in three main aspects. One is clinical practice. Unfortunately, there is still a very big need in terms of improving the care of all the patients with cancer at global level, because they need more complex and more multidisciplinary input from a number of professions, including not only obviously doctors and nurses, but also a number of other professionals. I'm thinking about allied care professionals, but also pharmacists, really to meet their complex needs. Unfortunately, at the moment, especially in certain parts of the world, there are still a few geriatric oncology, as we call them, clinics, units, programs that are able to really provide comprehensive care to these patients. And this is what we are trying to advocate for within our society. The second aspect is education. The cancer workforce is not always that prepared to meet the complex needs of all the patients with cancer. And that's because, for example, myself as a medical oncologist, I had to proactively seek training in geriatrics and how to apply these principles into my daily practice. So again, within SIGO, we're trying to advocate for the inclusion of these principles in specialist training for a number of professions, including also obviously nurses and allied health. And third, research. Unfortunately, older people with cancer, they tend to be excluded more frequently from innovation, from clinical trials, and that's because clinical trials in oncology are very complex. Historically, they had exclusion criteria mandating the inclusion of people maybe below the age of 65. Now that's no longer longer the case, but they are still excluding many different older patients on the basis of other criteria. So there are substantial gaps also on the evidence of what should be the best management of cancer in the older age group. And bearing in mind that these represent most of the individuals with cancer, I think this is a very urgent need to address at global level.
Thank you, Nicola. You mentioned clinical practice, training, and research. How does it look like from the patient perspective, Rania?
Well, this is a great question. Thank you, first of all, for having me. It's what Dr. Nicolai and you mentioned are musical to my ears as a patient advocate. And the time couldn't be more relevant at FADIA Survive and Thrive to focus more on elderly patients with cancer, because thanks to the UICC, through a grant by the Patient Group Mentoring Program, we were able to dedicate some resources and dedicated time and efforts to have an initiative, basically. And we came up with 9 main pillars for this initiative for any meaningful discussion about elderly patients with cancer. In our mind, like patients focused, there cannot be this closing the care gap without paying attention to each of these pillars. So very quickly, I'd like to shed the light on them. Starts with accurate diagnosis with elderly patients, especially with cancer, is a huge issue. It takes tremendous time and multiple specialists to get it right. And also the issue of functional age as opposed to chronological age, it makes all the difference. And it's not just a number 60 or 70 or 80 that defines who's at risk from cancer patients when they are aging. It's the organs function. And the third pillar is about their vulnerabilities to treatments related to the immune system and the added risk of vulnerability from the aging process. Longer term adverse outcomes, it's a higher risk also in this specific group of patients. Comorbidities is very real and are very real, and they are mostly overlooked in I would say clinical trials, but this is changing over the last, I would say, 5 years. Complexity of the needs of the patients from psychological, financial, social, you name it. Even we discussed offline the nutrition part earlier and de-stressing. The last 3 pillars basically about how the aging group from cancer patients have different cognitive changes and pain. The pain is different in elderly patients compared to other groups, and the narrow margin between efficacy and toxicity of any anti-cancer agent. And lastly, to put everything in order, because to identify a problem or a gap, we need to understand what is the problem and what we currently know. So how basically we translate all the knowledge in cancer control, whether it is prevention, early detection, diagnosis, treatment, and even palliative care, how we translate all of this into actions on behalf of elderly patients with cancer, how this it can be translated into better quality of life in reality. And in FADIA Survive and Thrive last year or a year and a half, we focused on critically ill patients and the importance of preventing infection and sepsis, because these complications can take lives faster than the cancer itself. And we identified some areas, gray areas, where side effects can be confused for symptoms for sepsis, for example. So these are huge issues, and I don't like to go past the time, but I'll just stop here for now.
Thank you. And you mentioned, I think, 3 very important things that it's exactly in Nicola's specialty, like the toxicity of the treatment, the comorbidities, and biological age compared to chronological age, among just many of those. Nicola, is it a real thing that there is a difference between the biological age? How much we know about this, and how much does it impact patients' treatment?
Thank you, Susanna. This is a daily challenge for clinicians like me. When you work in clinical practice, you really get the sense that when you see patients, older people in the clinic, they're an incredibly diverse group of individuals. You cannot simply generalize that all the individuals are unfit or fit. As we age, obviously we live in many different places of the world. We have different level of access to healthcare. We have different lifestyle and so on. So we become increasingly diverse. And in the older age group, this really produces a big variation in what we call, from a clinical point of view, fitness. So there are patients that actually you can offer the same treatment that we would offer to younger individuals with no major safety concerns, whereas there are a number of patients who actually do need more personalized management in order to minimize, obviously, the risk of side effects or complications or anti-cancer treatment, but also allow them to benefit from those anti-cancer treatments. As we mentioned, obviously, these complex needs are not simply a matter of comorbidities, but also functional status, nutritional status, polypharmacy, social support, psychological needs, quality of life versus quantity of life concerns, impacts on impacts of anti-cancer treatments on functional status, for example, independence, which is very important in this age group. So there are extensive data showing that actually older people have, in general, a high risk of complication anti-cancer treatments, but when it comes to the field of geriatric oncology, you really need to understand what are the individual patient circumstances and really do not make assumptions also on what matters or not to each individual patient. And obviously this is a very common problem because as I mentioned, for example, here in the UK, by 2043, we are expecting 24% of the general population to be age over 65. In the States, according to some registry data, 73% of cancer survivors will be aged over 65 by 2040. So this is a massive aspect of the routine clinical practice of clinicians like me, and that's why, again, within SIAG, we are so committed to really improve those three aspects, because it's something that we would have to deal with increasingly in the near future.
You mentioned quality of life, and it is broadly used and a hot topic even in the medical community. But what does it mean for patients, Rania? What is your and the patient community perspective on quality of life?
Well, quality of life is a big thing, and what we look for is quality of life in action, in reality, and that involves higher energy level, not only because the patient is cancer-free, progression-free survival or overall survival. It's because they eat well, they de-stress, they have a sort of any sort of exercising and other aspects of the quality of life. So what quality of life means that at even for the older patients going, we don't assume that that's okay if they are immorbid or they have a lack of mobility. This is acceptable casualty with aging or with cancer. Oh, I cannot sleep, I have this insomnia. It's acceptable with the treatment you're taking. Or I have a lack of appetite, or etc., etc. All these side effects, they are not okay. I recognize that the main monster is the cancer itself, but the others can be very annoying and they can take life equally, like something like sepsis and other issues related to maintaining and engaging quality of life. Even as the psychological part and the cognitive changes for elderly patients with cancer is mostly overlooked. Like the symptom called chemo brain is in many countries, and I would say in the Middle East, maybe the lion's share, in being overlooked, and it can create some tension even with the caregivers or family members for reasons outside the control of the patient. So if they are not flagged and there's awareness put forward for them, there's no way that we can improve that aspect of quality of life. How the patients feel about themselves and the others and how they maintain their life. They were decent, lovely people before the cancer and before aging, and they deserve full respect and do what it takes to make their life a little bit easier or improve their quality of life. And that cannot be happen without integration of different disciplines. It's really beyond oncology as we know it. It has to be multidisciplinary.
Yeah, and I'm glad you mentioned, and the other thing that really needs to happen to achieve this is to hear patient voice and inclusion of patient decision in treatment. So when we talk about patient, what does it mean for SIOP? What does it mean for clinical oncologists, Nicola?
Thank you, Susanna. I think it's absolutely crucial to include patients in what we like to call shared decision making. So we need to ask them really what matters to them to understand how we can best direct cancer care. As we mentioned, sometimes for all the patients, it's not simply just about quantity of life, but it's really more about quality of life. It's more about impacts on function and so on. There was some beautiful data presented at the American Society of Clinical Oncology meeting a couple of years ago now, that actually showed that if you aim for what we've been saying, an integrated oncogeriatric approach, so involving also a number of additional professions in the care of these patients, and really based on what is important to them, you can actually make the treatments for breast cancer, for cancer in general, safer. You can improve quality of life. You can reduce admissions and so on. So really capturing the patient needs and addressing them, it's incredibly helpful. I mean, I assume that most of my colleagues would be very happy to give patients a treatment which is 26% safer compared with the previous standard of care. Well, this is what, for example, what we call comprehensive geriatric assessment does. And that's, again, focus on patients. So within SIOC, we obviously have a number of patient representatives as well. There is a research group, which is called Cancer and Aging Research Group, that has been driving lots of the clinical trials that I mentioned. And they have a wonderful patient advisory group as well. Within my hospital, we are now setting up a specific geriatric oncology service. We're getting also ongoing input from patients and care. And this is because it's what counts the most. It's all about patients. So we need to get their ongoing input on all these aspects.
Thank you. As we have 2 minutes left, I have a very quick question for both of you, starting with Rania and Nicolo. And this is the Close the Care Gap. It's a 3 years program. What would be one key outcome or achievement that you would expect we achieve by 2024? Rania?
That's a huge question, but I would say 2 gaps need to be closed: communication and education gap, both ways. Patients, oncologists. We really need to know more. We need to communicate more effectively.
Great.
From my point of view, Susanna, thank you. When I see challenges, I see opportunities. So I would say I fully agree with Rania. Education, training in geriatrics for cancer workforce, and fostering the implementation of geriatric oncology principles in routine care for older people with cancer.
Thank you so very much, Rania, Asmi, Nicolo, Battisti, being with us today and discussing even just the surface of cancer and aging, and opening up the discussion how we can close the cancer gap together, including clinicians, including patients and patient advocates, and we will add everything else from the industry what we can as well. Thank you again, and have a very good day, all of you.
Thank you too.
Thank you.
Thanks.
Thank you so much, Dr. Adams. It's such a great pleasure to be here. And I first of all want to congratulate the UICC on the huge success of the World Cancer Day. And I want to wish everybody in the United States happy Black History Month as well. Mayo Clinic Cancer Center is truly excited to partner with UICC for the World Cancer Day, especially given the theme of the next 3 years, which is dear to us, closing the cancer gap. So as you said, I'm a prostate cancer scientist, and my research focuses on understanding disparities and addressing disparities in Black men globally. It's such a great pleasure to be here.
Excellent. It says here that I should ask you about the care gaps that you've been addressing through your career. I know there are lots of issues with equity around the world in men's cancers, women's cancers, and also in low-income, high-income countries. But you've had specific areas of interest over your career. So perhaps you could talk us about the areas of inequities or disparities where you've spent your time.
Yes, absolutely. For me, I have been in academia now for almost 30 years, and the cancer care gap that has really touched me the most is the disparity in the cancer care for Black men globally, especially when it comes to prostate cancer. Black men are disproportionately affected by prostate cancer across the cancer care continuum, from prevention to screening to diagnosis, treatment, and survivorship. You know, whether you are in Africa, the Americas, or Europe, or anywhere across the globe, Black men are more likely to develop prostate cancer. They are more likely to get the aggressive form of prostate cancer. They are more likely to get it at a younger age, more likely to get it at a late stage, and more likely to die from prostate cancer. Closing the cancer care gap for Black men is really personal to me, as we have lost a significant number of Black men who have been part of our fight against prostate cancer. So, you know, unfortunately, Black men are less likely to also seek timely care, and they tend to have lower life expectancy when they're compared to women and other racial groups. So this is an urgent care gap that we really need to close.
You mentioned there that there's, throughout the cancer control spectrum, there are issues and problems with Black men and prostate cancer. I'd like you to drill down a bit more about that issue you raised about men not being overly enthusiastic to go to a doctor or go to the hospital. And how big of a problem is that? And what have you been doing to try and overcome that?
Yes, you know, happy to share. First of all, you know, I want to let you know that when we are addressing health disparities, we need to address all the root causes of health disparities. And I don't want to take away from the fact that we have healthcare system factors, for example, access to screening, diagnostic, and therapeutic services. We also have provider level factors such as provider bias, including discrimination and marginalization of Blacks across the globe, and that has really impacted health disparities. But, you know, for me, you know, as I've worked in different communities globally, the biggest challenge that we have has to do with individual level factors. And that includes the fact that men are not seeking care. So we have to ask ourselves, why do we have such a struggle with men being able to seek care in a timely way so that they can have timely diagnosis and timely therapy? It goes back to some of the things that they have on the personal level, social determinants of health factors, including the issue of unemployment, poverty, homelessness, you know, lack of access to care, finances, economic difficulties, social and community factors, as well as neighborhood and environmental factors. But in addition to that, and I'm talking to our Black men all over the globe, and I'm married to one of them, you know, there's this challenge that they do not seek care in time. There's this idea of being macho. There's this idea that if it's not falling off, right, everything is okay. But the problem is that when it concerns diseases such as prostate cancer, by the time you have the signs and symptoms, it's already at a late stage. So we really need to be very careful. We need to think about prevention. We need to think about informed, timely diagnosis. And our Black men should not wait until they feel the pain or they feel the symptoms before they seek care. We really want you to be to be around for a long, long time. And so it's very important for us that they seek care very timely.
I think your point's well made there. and there are loads of issues that we have to address in order to improve the situation. But one of the reasons we have World Cancer Day is to celebrate successes where we've made progress, where we can highlight something that's worked in one country or even one city and say, look, this can be achieved elsewhere. So what have been, what you say, the successes that you've seen in the environment where you operate, where you think there's some real learning here that could be deployed around the world? What are those things that, you know, you got home one evening and thought, my God, I'm so glad that's happened. That's really made a difference. What have they been?
Outstanding question, because we really do need to celebrate when we have successes, and we need to share the successes that we have so that we can learn from each other. First of all, I want to say closing the care gap requires partnership with the communities that are affected and using the framework that we use at Mayo Clinic Cancer Center, which is precision community health. You have to work very closely with the communities that are affected. And we use data and evidence to tailor the interventions to those communities so that we know that we are addressing it effectively. I'm going to give 2 examples of what really has worked very well that I feel can immediately be adopted or looked at to modify across the globe. First, I'm really proud of the Mayo Clinic Wellness RX program. So what is the Wellness RX program? The Wellness RX program actually focuses on addressing social determinants of health, and it focuses on food insecurity as well as wellness education in neighborhoods that have very high rates of disease and lack access to healthy food. That is predominantly one of the key issues why we have, cancer. So we partnered with neighborhood residents and community stakeholders to develop programs that addresses the needs of the community. And one of the things that they tell us is the fact that there is lack of healthy foods in their communities. And what Mayo Clinic did was partnered with Feeding the Northeast Florida to provide monthly grocery distribution to communities. Since 2017, we have had about 80 wellness events, across our catchment areas. We have been able to reach over 3,000 people at wellness events. We have distributed over 290,000 pounds of food within the neighborhood. About 90% of our participants now have easy access to fresh foods, and about 90% said that they now eat 1 to 3 servings daily. One of the things that I'm most proud of about this program is it has evolved into what we call community gardens. So within this neighborhood that we are working in, we are developing community gardens so that people can have fresh food within their neighborhoods. And we are now expanding it to mobile health units so that we can even do much more and decentralize care and clinical trials to these communities. The second one I want to highlight is what we are doing globally, because we do realize that for us to be able to close the gaps, we really need to understand what are the issues that are responsible for the gaps, whether it's biology, whether it's environmental factors, whether it's lifestyle, or whether it's behavioral factors. One of the things that we have found in Black populations across the globe is that there is lack of evidence-based research that will allow us to be able to tailor therapies and tailor interventions to the Black communities. So another way that we are closing the gap is to facilitate biomedical research, especially health disparities research, focused on Black men globally, especially in Africa. So one of the critical efforts of my consortium, which is called the Prostate Cancer Transatlantic Consortium, is to close the gap by opening biomedical studies and clinical trials in Africa. We currently have multiple prostate cancer studies open across multiple countries in Africa, funded by the U.S. National Cancer Institute, Mayo Clinic, Prostate Cancer Clinical Trials Consortium, November Foundation, and other agencies with over $5 million. I really am proud to share that 2 days ago, we learned that the Mayo Clinic Cancer Center led care grant, which is called the I Care for Black Men Consortium, received funding recommendation from the U.S. Department of Defense. With this fund, phase 1 is $3 million for us to effectively study what is going on in Black prostate cancer patients across the world, including Africa. We have 5 countries in Africa that are part of this. And phase 2 is going to be a competitive renewal that is almost 10 million. So you can ask me, what are the impact of this kind of translating biomedical research specifically to address disparities and close the gap in these communities? In Africa, we have touched the lives of over 50,000 Black men. We have trained over 3,000 investigators who are really able to go back and work on closing the gap research. We have trained over 500 prostate cancer survivors who can advocate for manpower and advocate for policies to close the gap. We have unique biomedical discoveries that are now being tailored to train Black men. So these are just a couple of examples that I would like to give, and they are very critical to us to close the gap.
Well, Akemi, I wish I could capture your energy and enthusiasm and just transfer that around the world, which is why we're here, and that's why you're on this broadcast today, because World Cancer Day is an important platform for people like yourself and others to share that great news, to share what can be achieved, and to run away from the negativity of cancer and say, look, we can deal with it if we work together across country boundaries. So how important is World Cancer Day to you, and particularly the theme, which seems to resonate with everything you've said, which is about closing that care gap?
You know, let me just say, World Cancer Day has been really important to me for years. But when I got to know that the UICC is going to focus on closing the gap for the next 3 years, I am telling you, it was like Christmas came early for me. World Cancer Day is really a unique day that allows us across the world to come together and raise awareness about cancer. This is really very important for us, especially very important for us at Mayo Clinic. And we have lined up several activities. I'm sure a lot of people have seen our unique videos online. But at Mayo Clinic Cancer Center, we are participating in the UICC social media campaign. We have all our cancer center members who are joining in. We are using your social media toolkit to help bring awareness, you know, within our backyard and globally. We are sharing graphics on our Mayo Clinic Cancer Center social media channels and website. We are doing blog posts. We are doing, you know, different events on TV, on radio, and on YouTube as well. So this is really very critical for us because we have to bring awareness into what we are doing, and that passes on the information, and that empowers the community that we are working with.
I'm in a fortunate position that I can actually see everything that's happening around the world through my team. We're monitoring social media and we're picking up what's been announced around the world, governments launching new plans and things like that. So I'm glad you make the most of it, because this is the one time, I think, during the year when the whole of the cancer community, those who are passionate about prostate cancer, breast cancer, childhood cancer, the risk factors like tobacco control, we can actually come together and say, look, no, we are working in a concerted way to make the most of the opportunity we have to lower the cancer burden in the future and hopefully save more lives. I'd like to say thank you to the Mayo Clinic as well. So I know your colleagues also do a tremendous job, so thank you very much for that. If we look a little bit forward, we've got a couple of minutes. What would be your dream solution for prostate cancer in Black men? What would be a great result for you over the next few years?
You know, that is just a great question. I want to start by first of all saying that when we look at the statistics that we all quote, you know, they are linked to the pain, the agonies and tears of families across the world. Cancer does not only affect one person, it affects the family, it affects the community. And I have seen it firsthand. As I shared earlier on, you know, we have lost so many people to prostate cancer. Last year, one of the people that we lost to cancer was a research coordinator who worked very closely with me in fighting the fight for prostate cancer, you know, not only within the United States, but globally. You know, this is really tearing us apart. So we have to see cancer health disparity as a problem for all of us. It's not a problem for the few. It's not a problem for just a small number. We have to personalize it. And another thing that I would like to say is that health injustice for one is health injustice for all. And we all have to be committed to achieving health equity in our backyard and across the globe globally. So when you ask me, what would I like to see? What is my hope? My hope for the future is really not asking for much. I just have 3 things that I want to mention, right? One, we have to focus on addressing healthcare system barriers by ensuring that we are able to provide affordable and access to screening, diagnostic, and therapeutic health services, as well as survivorship and end-of-life care services for all globally. That is very important. We have to address provider levels barriers by eliminating bias, prejudice, and discrimination to provide better services. There is a lot of discrimination and bias going on in the healthcare system, and we really do not have time for that, because it is inhumane for you to do this when people are at their lowest point of health. Finally, I want to say we have to remove individual level barriers by improving social determinants of health. I want to say that one way for us to do this is I want us to get to a point that at every clinic, at every provider services in every community, that we have a screening tool to identify social determinants of health barriers faced by cancer patients. And we use that tool to connect them or navigate them to useful resources within their community, like transportation, food, free care, employment, housing, financial resources, education. Can you imagine, Dr. Adams, just think about this, if every clinic and every provider and every NGO have a platform that every cancer patient or anybody who is at risk for cancer can provide social determinants of health barriers, and almost immediately we tell them within your community, these are the resources that are going to help you out. Can you imagine how better off we will be? I mean, that would be my hope. That is my dream. If that can happen, I would retire happy.
Well, I'm sure there are many people in our community who would not like you to retire, because your energy is enthusiasm is incredible. I would say that, maybe from that I could just say that on behalf of all men, the work you do is amazing. And also, as you mentioned, it's not just the men, it's their wives, their husbands, their partners, their children, their brothers, their sisters, their mothers and their fathers. So the impact you have is greater than the men that you help and who guide to hopefully get to the treatment early and they survive their prostate cancer. So thank you very much for all the great work you do. Enjoy the rest of World Cancer Day, and hopefully we'll meet up post-COVID when I can get over to your part of the world and say hello.
Absolutely. I look forward to doing that. Thank you very much. Thanks.
Thank you. Bye-bye.
Hi everyone, thank you for joining us. My name is Fanny Bauer and I'm a capacity building manager at UICC. I'm very much excited to welcome today such a great speaker as Biba Dodeva. So Biba is the founder and the CEO of Borka, and it's a great honor to have her today and to listen from her experience. So Borka is a North Macedonian organization, cancer organization, which is specialized in cancer education and access to treatment, and works across the country to counter all types of cancers. But I will let Biba tell you more about that. So Biba, behind every organization there is a story. And I'm sure that our listeners are curious to hear about your story and what were the motivation behind the creation of Borka.
Well, the health system has always been challenged in Eastern European countries, but especially in the Republic of Macedonia even more so. So there was a need for some changes and reforms in the country healthcare system. Unfortunately, at the beginning of the 2000s, my mother was diagnosed with melanoma. So I'm a singer, producer and composer in Macedonia over almost 30 years. And in that time, I didn't know anything about cancer at all. But unfortunately, two of my closest friends became cancer patients, one from lymphoma and one from with breast cancer. And after that, my mother was diagnosed, and I saw that there is a huge need. There was a demand in the area of assistance, support these people who are fighting the battle with cancer. So, somehow the citizens of our country needed an organization where they can turn for support and to have someone who is going to be the voice of all those people. So I use my celebrity status and established Borka to fill this gap in the health sector in the civil society, to cooperate with all involved stakeholders, ministers, governments, and citizens. And since July 2007, we are organized as a non-profit organization, Borka for Reaching a Day. And the mission was one of the main tasks actually was to be partner and to support health sector in all efforts for establishing a strong and functional health system, but also to supply all the requirements of the citizens and providing adequate support and psychosocial support, because I personally see there is a huge need where to find information, where to call, or who to get involved and to get some informations, because the cancer is a disease for all family, not only for the patient. So that is my short story.
Thank you, Biba. So as you said, you're from Macedonia, and I know that you're also an expert in the region, in the Balkans regions. And maybe you could tell us more about the gap in cancer care in Macedonia and Southeast Europe in general. I mean, we can imagine that the region shares pretty much similar health systems as a result of the historical legacy. But the different political and economic direction that the Balkan countries have taken in the recent year have created gap in the health systems. So maybe what are your key observations in terms of access to new treatments, in terms of therapy and universal coverage, health coverage in the Balkans?
Well, yes, I must say that, as 30 years ago, we were one federation. So all of these East European systems are somehow similar. Some of those countries are now the members of EU, but some of them are not, as Macedonia. And since 2007, we as Borka are firmly committed to actively participate in the promotion and contribution contribution to all these reforms in healthcare system and to raise awareness, to overcome the stigma and changing the negative perception, attitude of the disease, to empower patients to be proactive, and to inform patients that cancer is potentially curable disease. So I think that all of these countries are working on creation. We must work on creation of the new healthcare system to identify the gaps, the problems in the health system, to lobby for implementation of screening programs and make improvements in the quality of life of cancer patients, make improvements in access to new therapies, to on-time diagnosis services, and et cetera. So I think that generally all the East European countries are facing this, and especially the low budget resources in the healthcare system. So that is one of the things that I think that there is a huge gap, and only by if we want to see the real changes due to all this mentioned above, I think that we need to approach systematically. So the implementation on national strategy of national cancer control plan, long-term plan, will give the best results.
Thank you. That's, I mean, we had the opportunity to collaborate together, and I've been always very impressed by your willingness to influence and shape cancer care in Macedonia and the Balkan regions. And I would be curious to know, what are your hopes for the future, and what is your message today for the World Cancer Day?
Well, you know, as a patient advocates, we have a huge, and the biggest challenge is in to change something. So what we did as a Borca, you know, to close, to tackle improving this gap was, first we lobby for increasing expenditure for drugs and centralized procurement. And now in Macedonia we have 30 new moleculars, but they're not on the reimbursement or the positive list, we call that reimbursement process. So we map stakeholders, we map decision makers, you know, because we think that proper mapping of stakeholders is crucial, and we approach to policymakers. They saw us as a real partner in this, not only to complain and to criticize their work, but to offer the solutions, because, you know, we must be aware that nothing happened overnight. So and even during all this battle, my closest friends died, my mom died, but we never stopped in our mission. So I think that that is one of the main reasons a lot of NGOs who are fighting with cancer and who are leading the organization like this are personally involved. Majority of them are personally involved. Maybe they're patients or they are caregivers as myself. So we must improve the control and monitoring, I mean, for all EU, East European countries, and synchronize the law of the drugs issued from European agency, EMA, to follow the recommendation of all WHO and to prove access maybe to clinical trials, and in general to create a condition for access to contemporary and adequate treatments and new therapies for all these people.
Thanks. Yeah, and we need people like you and your team. You're doing such an amazing work in the Balkan regions and Macedonia especially. What about today? What will you do to celebrate World Cancer Day today?
Well, I'm very proud that today we organize our press conference with the new Minister of Health. And I must say that sometimes in the Balkans, we are facing the very fast changing of the minister and government. So, you know, like Sisyphus, you come to the one point and then again you must work and again to reach some point. But we are fortunately with this, now this new minister was open to be part of our press conference. And we create an action to unite all the stakeholders. So the managers and directors of all the clinic that are treating cancer, so pediatric hematology and oncology center were there on the press conference. And we unite all of them. And we agree that there is a huge need in investment in our health system regarding cancer. So we lobby and encourage the creation of new, better condition, only with the long-term plan and implementation of national cancer control strategy. So I think that now we are going to work together and we see the results in a few years.
Viva, many thanks for your positive energy and for your time. There's still a lot to do to close the cancer gap in the region and especially in Macedonia. But you and your team are clearly making a huge difference, and we are very proud to collaborate with you and to support you as a very committed organization. Well, I would like to thank you again and thank you all of our listeners and wish you all a happy World Cancer Day. Thank you.
Thank you. You know, the health has no price, it's an investment, but no matter how big or small we are, in which country we are, we must take an action to close this gap and to save lives.
Thank you, Viva. It's been a pleasure. Thanks.
Pleasure too. Bye-bye.
Bye.
Hello, my name is Carey Adams and I'm the CEO of the Union for International Cancer Control based here in Geneva, Switzerland. And if you're watching this on February the 4th, it is of course World Cancer Day. A special day for the UIC team and cancer organisations around the world as we celebrate the challenge of addressing inequity through our new theme, Close the Care Gap. It's a new 3-year campaign in which we want to highlight the inequities around the world which prevent individuals getting to the right treatment and care at the right time. Over the last couple of years, we've seen the COVID-19 pandemic reveal those inequities, and of course they continue even as we progress out of the pandemic itself. I'd love you to go to the World Cancer Day website and look at the wealth of information that's available and draw down information that you need in order to learn about inequity. Take the quiz, try a 21-day challenge, but more importantly, if you are doing something today, put it on the map of events so we can see what you're doing around the world. We saw great things happening this morning in New Zealand and Australia, and it's going through the whole planet around to Hawaii. And I'll be following it as it progresses and we see more events put on the map and the social media takes off as well. If you are doing social media, then use the hashtags World Cancer Day and also hashtag Close the Care Gap. It's an important day for the cancer community to announce that we are committed to addressing inequities around the world. And there's so much that you can do as well as working with the rest of the community. So if you are doing anything, follow us on Facebook, follow us on Twitter, follow us on Instagram, post as much as you can so we can raise the temperature about an issue which is so important to the hearts of the UIC community. I look forward to reading about everything you've done during the day and also seeing what impact we have over the next 3 years as we roll out the campaign, Close the Care Gap. Have a great day.
Welcome back to our broadcast live program today on World Cancer Day. My name is Nicole Engelbrecht and I'm the Head of Communications and Marketing for the Union of International Cancer Control, UICC. Our next guest today is Kieran Nicol, who is the Head of the Health and Society Unit at the Joint Research Centre of the European Commission, and we will be talking about the importance of data and research today. Welcome, Kieran.
Thank you very much, Nicole, and thank you also to the Union for International Cancer Control for the invitation. Great to be here.
Kieran, the European Commission has made the fight against cancer a priority. What is the role of the Joint Research Centre in this fight?
Well, first of all, the European Commission's Joint Research Centre specialises in providing independent evidence for EU policies. So, and our role in cancer, well, that stems back to, it all began in 2013 when we started building what we call the pillars of the Knowledge Centre on Cancer. So the first pillar we could say is we have developed and we take care of the European Cancer Information System. This is a system in Europe containing over 30 million cancer cases covering 34 cancer sites. And it is used for monitoring and projecting the burden of cancer in Europe. Now, that system is going to grow and expand in the coming months and years to include linkages to cancer determinants, really providing evidence. We're going to include staging data, treatment data, making it more timely, etc. So that's pillar number one, the data. Pillar number two, we also developed the European guidelines for screening and diagnosis, and provide European guidelines on a quality assurance scheme covering the whole cancer healthcare pathway. That means from prevention to screening, diagnosis, treatment, post-treatment, psychosocial care, pain management, palliative care, the whole way through. So these guidelines ensure that minimum essential standards are fulfilled, because unfortunately, even today, the patients are falling between the stools of the healthcare pathway. A third pillar is, of course, focused on prevention. We know that estimates tell us that about 40% of cancers are preventable, and we need to do more in that area, and we have a knowledge gateway. This is a reference point for policymakers in what to do to improve, or let's say to reduce your risk of getting cancer, basically on nutrition and lifestyle. And then we also have a facility, an information system called the EU Platform, for rare diseases to treat rare cancers, including childhood cancers, which has recently been published on the European Cancer Information System. So basically, these are all together. And then finally, the new kid on the block, when it comes to tackling cancer, was launched on the 2nd of February by our president, Ursula von der Leyen. And that is the new European Cancer Inequalities Registry. So all of these fit together under a knowledge centre on cancer, whose mission it is to provide scientific and technical alignment of all Commission and European activities on cancer, bringing everything together, because we know what to do, we know how to do it, and this will leverage the impact. Back to you, Nicole.
That is a very important work. I know that you have over 40 staff members that help you with that, and we'll get back to how this data can be used for the fight against cancer. Our campaign today, the campaign that we launched globally on World Cancer Day, is about highlighting disparities and barriers that people hit at every turn when they seek cancer care. And it's very important to understand that these barriers and disparities not only occur in low and middle income countries, but also in high income countries and in the heart of Europe. So can you highlight some of these cancer gaps, cancer care gaps and barriers that you've observed in Europe?
Well, to be honest, Nicole, it's difficult to know where to begin. The situation is that bad. North to south, east to west, from prevention to diagnosis to treatment and post-treatment, all the way to palliative care, there are disparities everywhere. And this is where I think it'll be very important to communicate them. If we want to close gaps, inequality gaps, the first thing we need to do is identify them, display them, and communicate them. That is a first step. Now, to give two little examples, now take breast cancer, the most common cancer among women, and screening for the evidence-based recommended age group is known to increase, let's say, the results and positive outcomes for those patients, unfortunate enough to go through that pathway. But then if you look at the various member states in the European Union, and you see what percentage of women are attending these screening programs. In one member state, you will see 89%, but in another member state, you will see 8%. So that's an unacceptable disparity that I think has to be addressed. If you take the national cancer plans and the importance of psychosocial care, all of our national cancer plans express the importance and the need for psychosocial care. However, if it comes to having the correct indicators, recommendations, criteria in place to implement it, only one national cancer plan can do so properly. So again, we know what to do and we know how to do it. And this is going to be the key to addressing those disparities. So yeah, we hope that the disparities aspect and the inequalities will be a leverage, a power to finally make the change that we need. Back to you, Nick.
And as you rightly said, before we can tackle these disparities, we need to recognize them. And what you just said is so striking, because we know that all these gaps and barriers and disparities, they cost lives. They cost lives every day. So it is so important to address them. You mentioned the new European Cancer Plan that was launched last year, that was amended this year. And you also mentioned the Cancer Inequality Registry as one of these points of the European Cancer Plan. To come back to that, can you explain to us why data is so important and what the Cancer Inequality Registry can contribute to the fight against cancer?
Well, the European Cancer Inequalities Registry is a very interesting one, because the European Union is built on very strong values. So when it comes to equity, fairness, equality, everyone should be treated the same. Everyone, no exception. So, and then secondly, if and when we often do this, when we sit around the table with the member states, okay, lately it has been more virtual than physical. What's amazing is the member states of the European Union and all over the world, for that matter, want to help each other. They all want to help each other. So where there's a will, there's a way. Now, equalities, like I mentioned before, if we display them and communicate them, we get them out there. Then we're kind of going, oh, this is not acceptable. Take, for example, lung cancer incidence. If you look at the percentage of people or number of people getting lung cancer is called incidence in the European Union. In one member state, the incidence is double the EU average, very unfortunate. And in another member state, it is half. Good, there's a good practice. So we have all these excellent practices that we have, and we know that we now need to implement and to leverage that. So basically, in a way, the European Cancer Inequalities Registry will be a political arm to bring the pieces of the cancer jigsaw together. It will act as a kind of a social fabric, exposing our passion and our more heartfelt ideas to do something about this, to start taking action on the ground where it matters. Thank you.
Do you have the commitment of all member states to contribute to that?
Good question. The European Union and the Commission does not have a legal mandate to impose cancer prevention, control and care strategies within its member states. That has been decided, and with total respect to that. So in a way, it makes it a bit more challenging. However, good news is that for the first time in the Union and in the Commission, we have the pillars of the Knowledge Centre on Cancer in place that I mentioned before. European Cancer Information System, European guidelines, quality assurance schemes for cancer care, prevention all the way to end-of-life care. And we have the Knowledge Gateway on prevention. So all these places, or all these entities are in places. We have the systems, the platforms, the portals, and the gateways. We also have the Europe's Beating Cancer Plan. On one hand, 4 billion euros, which is going to do excellent work. On the other hand, we have the Mission on Cancer. So these three entities together make a formidable force where nothing should be multiplied by 27 member states. We can do this together. The differences and the inequalities and all the aspects, they can be addressed in a central way most or almost all of the time, because mostly we're talking about essential standards, bringing up the level of prevention, care, etc. So it is challenging, but I think now we are positioned in a very good place to make this happen. And I think we need to make it happen. Thank you.
It's a very ambitious plan. It's great to see that all these objectives have been included. By when will people in the European Union see a difference?
Well, for example, now we are basically doing a feasibility study for the new European guidelines on quality assurance scheme for breast cancer. These evidence-based guidelines are state of the art. You will see many continents and countries throughout the world already beginning to use them in some shape or form or the other, like China to the Americas, etc., etc. So these feasibility and pilot studies will demonstrate that, and we are very confident that it will improve the cancer care. So basically, I think it has begun, but we need to be faster. I think we need to coordinate more together. Absolutely no room for duplication. And that's why, in a way, we have the Knowledge Centre to align and coordinate. And we're working very closely with our colleagues in the political directorates general, DG Santé and RTD to do that. That's the DG Research. By the way, with the Knowledge Centre on Cancer, we've made links to so many other aspects. In the future, we'll soon be geographically positioning, in fact, with the next call for data, the cancer data. That means we can start linking it to other geo-positioned data sources, like take lung cancer and exposure to radon or exposure to particulate matter 2.5 microns. Take socioeconomic indicators, take behavioral indicators, etc., etc., exposure to carcinogens. So it is beginning. The knowledge is going to be generated. The dots are going to be joined. And this is going to be coming very quickly now, and with the new priority that is on cancer, and that will start leveraging impact. And at the end of the day, it's all about leveraging impact on the ground, in the setting, for the cancer patient, for the citizen, etc. So that will be coming soon. Challenging as it may be, it is time to work together on this. And I think everybody will want to put their shoulder behind the wheel to drive this forward. Thank you.
The dots will be connected is a very powerful message, because by sharing knowledge, we will become stronger in the fight against cancer in the cancer community, together with organizations, governments, individuals. So I wish you all the best for that very important work. I would like to thank you once again for joining us today, and all the best. Goodbye.
Thank you very much, Nicole. Thank you, everybody, and to everybody out there, take care. Take care of your health and well-being. We have the guidelines, we have the recommendations, so let's do this all together. Thank you very much, and all the best.
Thank you.
Hello and welcome back to the live broadcast. I'm Kerry Adams, the CEO of UICC. A wonderful day to close the care gap. Now, it's my great pleasure to introduce someone that I've known for many years and whose company I've enjoyed immensely, who's achieved a lot within the company Bristol Myers Squibb. Amadou Diarra has been committed to helping UICC and other NGOs around the world for many years. And if I had to describe him without naming his title, which is called Global Policy, Advocacy and Government Affairs, actually if you read his CV and see where he's been around the world, there have been some common themes addressing inequity, inclusion, making sure there's no reductions in disparities. This has been a theme right through the whole of his career, and certainly whilst I've known him, he's been a great ambassador for the role of the private sector in addressing some of the major cancer challenges we face around the world. So Amadou, it's a delight to welcome you. Thank you very much for your time. I would love it if you could start off by telling us, through your career, where do you think the cancer care gaps are? And once again, thanks for joining me.
Thank you, Carrie, and thanks for having me on an important day such as this one, the World Cancer Day. And I want to take this opportunity to congratulate you and UICC for all you're doing for patients around the world. So the most concerning gaps for me continue to be what you mentioned. It is the divide about health equity. And in fact, this touches on the social determinants of health, which prevents some populations from attaining their full potential. And this divide results in gaps from prevention to diagnosis to care and treatment. And it's about, the lack of availability of information, but also the lack of trained healthcare professionals, and this goes on and on to facilities, equipment, and of course everything which relates to distribution channels, availability of treatments, and also funding, which is a nerve of any sustained action that we want to have.
Amadou, I mean, you've covered a lot of ground there, and I think we've seen progress in some of those areas, but what are the ones which you feel are the biggest challenges to overcome in terms of the gaps in getting medicines and treatment to people in parts of the world where it's actually very difficult? What do you think are the key things that we have to do? What would you say that the characteristics of a program or project that actually will work? What are those challenges?
So it is a key question, Carrie, and in fact, I think the key word is complexity. Complexity of the challenges. First of all, cancer is not one disease, but many diseases. And in terms of complexity, as I mentioned, the availability of information, trained, healthcare personnel, facilities, and so forth, gives a perspective about complications. When we look at the numbers, because the numbers speak for themselves, speaking about cancer itself, it's about, for 2020, 10 million people worldwide died from cancer, and 70% of them being in low middle income countries. And if we fast forward, unfortunately, to 2040, the expectation is to have 16 million people dying from cancer, and 2/3 of them being in the developing world. I think having that in mind, and also the limitations of access to care and treatment, this is really giving a lay of the land in terms of the difficulties. There's one complicating factor that I wanted to mention, which is COVID-19. As we know, COVID-19 has diverted resources and has delayed diagnosis, delayed access to care and treatment, and therefore it is layering on top of the complexities that we had already mentioned.
No, I think you're absolutely right, Amadou. The COVID 2 years has sort of brought to life a lot of the challenges that we face in health systems, full stop, let alone dealing with the cancer challenges, which exist in every country. One of the values of World Cancer Day is that we're able to celebrate the great work done by organizations and individuals around the world, and actually step back from the problems and look at the successes, the things that have worked, because we are making progress around the world. We do have more medicines, we have better technology, more diagnostics, you know, and in some parts of the world where they have all that in place, we're seeing reductions in the number of people who die from cancer. So what do you think are the real successes that you've seen from your position, where you can say that was a success, and that's something that's going to make a difference to lots of people over time, because it can be reused, it can be redeployed around the world? Where are the key successes that you see at the moment?
So clearly, Carrie, I like your optimism, although much remains to be done. I think we can celebrate some of the successes, and for me, there's no standard, you know, one-size-fits-all response in terms of overcoming the access barriers. I think as a pharmaceutical company, a major biopharmaceutical company, Bristol Myers Squibb, we recognize that we need to partner with governments and other stakeholders, such as UICC. Basically, one of the examples that you are no stranger to is the collaboration between Access Accelerated and UICC, which has given way to City Cancer Challenge, you know, by providing seed funding. And, you know, it's really pleasant to see that among the accomplishments, there are already 11 cities around the world in low middle income countries where we have, you know, already observed that there are improvements in terms of access to equitable quality cancer care. But if we look forward, the perspective is even better, because, you know, up to 54 million people will benefit from increased access to quality cancer care. So I think this is one of the accomplishments, and it is also illustrating the perspective that I was mentioning, which is collaboration, partnership, you know, will be essential. If we stay within the Access Accelerated arena, you know, everything that has been generated as evidence from various countries, China, Colombia, Salvador, Ghana, Kenya, has helped secure up to $355 million of new investment in non-communicable diseases. And this is really supporting national policy changes in a variety of countries, 14 countries so far. Now, turning to the more BMS perspective, there are a variety of successes which has been achieved or are in progress with partners. One of these is to try and bridge the information gap that I mentioned, the advocacy exchange. And this is a program that was launched by BMS and Greek Health back in 2020. It is the first of its kind platform created to unite advocacy organizations, patients, caregivers, industry, and healthcare representatives in the exchange of information. In terms of you know, the numbers, more than 31,000 people so far in 150 countries about, you know, have visited the exchange. And it is pleasant to see that 53% of the website users are in low and middle income countries. So this is, you know, a pleasant milestone in terms of trying to bridge the divide from an information standpoint. I'll talk briefly about the accomplishments from BMS Medical Department, which set up a global health equity platform. Just a few metrics here. We've launched Cancer Links programs in a variety of countries, and we've worked in collaboration with academics, but also various experts, cancer centers, and society. And so far, you know, 150 healthcare professionals, 200 patients, 200 patient programs actually, and 4,000 patients have received care through this program. Now, the ambition doesn't stop there. We have initiated a partnership with the eCancer Global Foundation, and the aim is to reach throughout Africa, Asia, but also Latin America, about 100,000 healthcare professionals So these are some of the accomplishments. And just to close on this platform, we shouldn't forget one of the vulnerable populations, which is the pediatric population. And there is a partnership going on with World Child Cancer UK to try and close the gap in pediatric oncology. And so here, the program that we have initiated is aiming to reach over 1,000 healthcare professionals in Ghana and Cameroon. And this is a promising start. Now, just to finish, I want to talk about the BMS Foundation, which you are familiar, Carrie. And the programs that have been funded by the foundation have trained over 4,000 pediatric cancer healthcare professionals. 10,000 patients, pediatric cancer patients, were treated. And from a lung cancer perspective, the foundation is also training up to 4,000 healthcare professionals. I know it is a lot of numbers, but all the more reasons to be optimistic and positive about what we can do together. And once again, partnership is key.
No, and maybe I can re-emphasize some of the points you made there, Amadou. I, as you recall, I think I spoke to you many years ago about the City Cancer Challenge when it was purely a concept, an idea. And certainly your support and the support of Access Accelerated have really helped establish that foundation, which is now celebrating, I think it must be its 3rd year of operation, and it's growing, which is really good news, and one of our sister organisations. And also, I had the privilege of being on the Advocacy Exchange, and the work you've done with Grit Health and Dave and his amazing team, and all the work there has touched so many patients' lives around the world. It's extraordinary. And as you know, I'm also on one of the advisory groups of one of the recipients of the support from the BMS Foundation, being Global Hope, which does tremendous work on children's cancer in Africa and really is having an impact on young people's lives and saving their lives. So, a lot of the things that you've invested in have been very wise investments where your approach has been to seed it and get it going and then crowd in other support and then crowd in partners. So I think you should take a lot of thank yous from me and from those who've actually received your support over those years. Now, another thing that you support is, of course, World Cancer Day. And without your support and the support of others, we wouldn't be able to put on such an incredible event around the globe, trending on Twitter as we're speaking. I think it's trending 1 in the UK now, it's trending 3 in the USA. It's raising the profile of cancer, it's creating an opportunity to talk about the subject of inequities and to really engage the media and social media. So why do you invest in World Cancer Day? And please don't stop, but why do you invest in World Cancer Day? I mean, it's clearly, it ticks something which you think is worthwhile doing.
Thank you, Kerry. And I keep in mind your instruction not to stop. I think the simple answer is really because there's clearly more to do. And, it's better done if we join hands to do it. And so we're very proud to partner with UICC, as you know. I believe it is a shared responsibility that we all have, and it requires really a broad range of partners. So we cannot just talk about disparities and the gaps. We need to act, and we need to focus our actions and coordinate them so that we avoid duplication, and we need to really leverage expertise. I think one example of partnership that you also know about is the partnership with Olucan. And this collaboration is an example of how driving efficiency in cancer care can support a sustainable health system. So we're very proud to be associated with UICC, but we're not the only ones, obviously, and this is the greatness of what you're doing.
No, well, I mean, it takes collective action in everything that we do because it's such a big, as you said, complex subject. It needs multiple organisations with different experience, knowledge, background and resources to make a difference. So what's BMS doing in around your business today for World Cancer Day?
So first of all, there's not one single BMS employee that doesn't know that there's a celebration of World Cancer Day with UICC, and in some countries like Japan, I know that there are specific, events organized. But it is a day for a profound, reflection. As I said, we have reasons to be proud. We have reasons to be hopeful but we have reasons to, do more all collectively. And for BMS as a single company, looking at the innovation aspects, but also educational aspects and everything that we can do from an access perspective. One aspect that I did not mention from an access perspective is an initiative which, we can certainly talk about in the future, which is partnering with the Parker Institute for Cancer Immunotherapy and the Clinton Health Access Foundation, try and do a demonstration project for advanced therapies such as immuno-oncology agents in a low resource setting. We are building on the learnings that we have with another partnership that we have with the Max Foundation, and this is more on leukemia, but the learnings are really positive, and there are more than 1,000 patients that have been treated, most of them in Africa, with this program. So this is the boiled down version of what we're thinking about, and we're thinking of building on what we've already done. Again, it's not going to be just us alone. You've heard many names about the partners that we're either working with or considering doing.
Yeah, I know Pat from the Max Foundation speaks very highly about the partnership she has with you, and I'm sure she would say thank you. We're running out of time, Amadou, so I'm going to combine the last two questions. So, in terms of the future, what do you think is, where do you think we can close the gap effectively? Do we have the ambition? Do we have the tools to actually make a difference? And if so, what's your hope for the future? And I don't know whether we go 3, 5 or 10 years time, you choose, but what's your hope for the future when it comes to cancer care and closing that cancer care gap in low middle income countries, for example?
I'm going to use a sentence that you know all too well, Carrie. The question is, how do you eat an elephant? And it's one bit at a time. I think we just need to focus, all of us, on the priorities, the key priorities. Clearly, not a single group can solve the challenges that we've talked about alone. And therefore, I'm really enthusiastic that we have the opportunity to do this all together. So it's going to be about inclusive research, diversity in clinical trials, equity in access, education, access to innovation, and the opportunity really to get all of us focused on the same thing.
Okay, well, thank you very much, Amadou. So pass my regards to Kathy and John and the rest of the team. You do a terrific job, and we appreciate your support for World Cancer Day. I'm now going to shoot off to the local elephant restaurant and see if I can have something to eat, because you've made me hungry. Anyway, Amadou, as ever, it's great to talk to you. Have a great World Cancer Day, and we'll catch up soon, okay?
Thank you, Gary.
Cheers, then. Bye-bye.
Bye-bye.
Hi everyone, happy World Cancer Day. My name is Nina Kalefi and I'm the brand specialist at UICC. Today, I'm here to talk about a very important topic with a very special guest. So we're going to talk about the importance of nutrition during and after cancer. I'm going to call Alda Daniela Garcia Guzman. How are you, Daniela? How are you?
Hi, Nina. How are you? I'm fine, and you?
I'm good. So we're gonna get started. Just so I introduce her very briefly, she lives in Mexico City. Alda is a nutritionist and she works in the oncology department at the National Pediatric Institute. So let's get started. So Alda, can you tell us a bit about the importance of nutrition for those living with cancer?
Sure, Nina. First of all, I think it's important to say that nutrition should be part of the treatment of a patient with cancer. Most of the times we're just like, they just need chemotherapy, they just need radiotherapy, but no, they need nutrition because in some part, the cancer is a metabolic disease. And this metabolic disease is a lot of changes on how the body gets energy and how the body gets a lot of their functions about this energy they're giving. So when we have cancer, the tumor is working because he needs to survive. And when he needs to survive, he needs to get energy. So if we don't get a correct nutrition, the tumor is going to be the responsible to make the patient get weight loss, to have a muscle loss. So that's important for nutrition in a patient with cancer. So we should be able to maintain a patient with a correct weight, and we should maintain specifically the muscle, because there's like a lot of studies that says that a patient with a good muscle mass has better chances of surviving the disease. And the most important, they get like a lot of more positive results of the treatment. So that's one of the most important things. And another thing that I think it's like really important to say is that most of the time we listen to a lot like, oh, you have cancer, you can eat this, you can't eat this, you should be drinking like juices and all that stuff. And that's not true. A patient with cancer can eat everything he wants. But what we have to be careful about is the preparation of the food and how we are going to clean, for example, the fruits, the vegetables. Some of the times in restaurants, like the cleaning is not like really like important, or they don't put like their best effort. So that's one of the recommendations, to try not to eat in restaurants where they don't have like this cleaning focus. But at this, we can eat whatever they want, or they can be, imagine you have cancer and then they tell you you can't eat your favorite food, you can't eat I don't know, you can go to a party because you can't eat the food they're going to get there. So that's the most important thing. A patient with cancer can eat whatever they want. And that's why our work as a nutritionist is important, because we are going to guide them of how they're going to eat the food that they like, but taking care of some of the stuff that the treatment can take as consequences.
Thank you, Alda. That's very good to know. And as you know, this World Cancer Day is all about putting a spotlight on equity in cancer care. You work in a public hospital in Mexico City. So what are some of the challenges you witness when it comes to equity?
There are a lot of challenges. We have a lot of patients that come from rural part from the country, that comes from the high mountains, and they're like no equity in the economic part. They do like about 5 to 7 hours to get to the hospital. Sometimes they don't have the amount of money that we wished, so that they could eat all the food that we want. And I think that's one of the worst things we do as nutritionists, because some of the times we're like, yes, you have to eat fruit, you have to eat vegetables, and if you can eat salmon, you should eat salmon. But most of the times our patient does not have the money to buy this food. So what we should do is to get and made a meal plan so that our patients we take the cost of it, and they're not going to get in problems to buy them, for example, salmon. No. So, and most of the time the patients are like, I have never eaten salmon in my life, and you're putting it on the meal plan. So I think that's the most important. For example, these patients that come from rural parts, I try to put in their meal tortilla, beans, like if they have like vegetables in their house, trying to put it into the meal so that it's easier for them to catch it. So I think that's the most important thing. And the other most important thing is that working in a public hospital, some of the times all the food that we receive here in the hospital comes from the government. So most of the time we don't have like a lot of variety. So every single day of the week we send chicken, and there is a moment that the kids are like, oh, no, I don't want chicken anymore. So that's one of the most trouble I'm here in the hospital, because some of the times we just have to make like magic so that the patients eat the food that we receive here in the hospital. So we try, I don't know, to put like seasoning, or to put, I don't know, like combine it with another stuff, or with tortilla. Here in Mexico, we love tortilla. So tortilla most of the time is saving me from the kids to eat. So that's what I think. It's the worst thing of in Mexico, and specifically in a public hospital.
I know this is a reality for many, many countries in the world. So if you could give us 1 or 2 recommendations for nutritionists all over the world, how they can work on these problems and challenges on their reality.
Well, I think that the most important thing that we should get in is that we as a nutritionist should be adapted to our patient. Every single day when we make a meal plan, we should take care of all the things and all the characteristics of our patients. So if they have access to food, if they do not, what access to food do they have? And that's how it's going to be easier that the patient gets to the meal plan, and it's easier for him to take it. Another stuff is that some of the time as a nutritionist, we just think about weight, and we should not think only about weight. We should think about how many muscle mass this patient has, how many this patient is eating, and something that is important is the physical activity. A lot of patients, when they're diagnosed with cancer, they just put themselves in a wheelchair, they just put themselves all the whole day in a bed, like resting because I have cancer. That's not excuse. If you have cancer, you can do whatever you want. You can do your things about like everything you do in your daily life. You should do it normally. Obviously, when there's treatment and you feel like a little bit tired and you feel like weak, okay, it's okay that you feel weak 2 or 3 days a week. But if you don't, do the things you need. If you want to go exercise, go and do exercise. And that thing that I think is one of the most important things about nutrition, because most of the time we say, oh yes, we have to do a plan with a lot of protein. But if the patient is not moving and the patient is not like taking advantage of this meal high in protein because he's not moving, this is not going to work the way we want to work. So it is important to always recommend our patients to do exercise, to have physical activity. Only a walking of 20 minutes is enough for a patient cancer. So I think it is one of the most important. And the other one, obviously, that we should make the meal plan according to the characteristic of our patients, and we should always do it individualized. We have a lot of patients and everybody is different, so every meal plan should be individualized.
It's really so important to analyze the needs of that patient and really give a tailored meal plan, and with exercise, with water. It's a very comprehensive plan that we need for them. So we've been talking about nutrition and how this can improve their lives. Can you give one very tangible example of how following a meal plan, following exercise, how can this improve the life of a patient?
Well, first of all, they're going to have enough energy to do their activities as they normally do. The other one is that we are going to have the energy to fight the disease. And the most important, that we're going to have the energy so that the chemotherapy, like all the treatment that the medicals are going to use, to work better. It has been seen that a patient that has a good nutritional status has better results about the treatment. That's one. And about the exercise, most of the time when they do not do exercise or they lose muscle mass, what is like the most important is they got weak, they forgot like sometimes how to walk, and they become dependent of their families. No, so this part of nutrition and this part of exercise make the patients have like independence of do whatever they want. And most of the time I see, and my patients is like, I want to go to the bathroom, and the mom is like, oh yeah, okay, I'll take you to the bathroom. He's walking perfect, right? Where he can go to the bathroom alone. No, so that's the most important. I think independence, and I think like the results from the treatment is one of the most important targets of nutrition. And there's like a lot of symptoms associated to the chemotherapy and the radiotherapy, and we can help them with food to diminish these symptoms. So for example, I don't know, nausea, okay, with pop cycles or with fruit, with frozen food, we can diminish the symptom. Or for example, there are a lot of chemotherapies that can reduce the lactose tolerance. So we can use like a different dairy product so that they could still eat dairy products, but with taking care of this lactose intolerance. So there's a lot of things we can do with food, and I love food because of that, because the food could be preventive, could be helping to the medical treatment. So I think that's the most important thing about nutrition in a patient with cancer.
Thanks, Alda. Well, we've been talking about this, but I would like you to summarize like the main message here. What would you like people to remember in a month, 2 months, 3 months, this World Cancer Day, about nutrition and cancer?
Okay, so the first one, and I think that's the most important, you can eat whatever you want. If you're going to a nutritionist, take like a lot of communication with him and with her, and you should be eating what you want. You should not be taking food from your meals, and we just have to take like a lot of communication with the nutritionist so that she could help you to go like, yes, you can eat this or you can eat it this way, but there is important that you can eat and you can still be pleased about eating. The other thing is that nutrition is part of the cancer treatment. So if you're at a cancer treatment, you should go and find a nutritionist that can help you to maintain your nutritional status and to help you to diminish the symptoms that you have about the treatment, specifically some of the chemotherapies surely you're receiving. And the other thing is exercise. Exercise is basic for a patient with cancer. You can live your life wherever you want and how you were living before the cancer. So I think that's the 3 most important things.
Thank you. And finally, you know, what are you doing this World Cancer Day to celebrate it?
Well, it's early here in Mexico. It's only 10:15 here in Mexico, so it's early, and I'm here at the hospital where I work. So I'm going to celebrate with my patients, and that's like the I love the most, to see them and to talk to them. And I think that's the way I'm going to celebrate these days, and obviously fight cancer with food. I think that's the most important thing.
Thank you so much, Alda. It was lovely, and I hope we can be in touch. And I hope this was helpful to all the nutritionists and cancer patients all around the world. Thank you so much.
Thank you, Nina. Have a great day. Bye. Greetings from Mexico.
And old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and none, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.
Welcome back to our live streaming for World Cancer Day today, all day. Well, again, between 9 and 8 p.m. But this is a special session and I'm going to be conducting it in Spanish. So I'm changing now into mi lengua materna. Hola, bienvenidos y bienvenidas a todos que nos están viendo desde América Latina, desde España, desde cualquier sitio, desde cualquier parte que habléis español. Tengo el inmenso placer de estar hoy con una gran tenista, una gran persona que es Carla Suárez Navarro. Bienvenida, Carla, muchas gracias por unirte a nuestro live streaming. Hablar de un poquito de presentaros a Carla, quien, bueno, si es necesario, que creo que no lo es, pero deciros que, bueno, que es una campeona de tenis a nivel mundial, que fue número 6 de la WTA, que tiene 2 títulos de campeonatos. Además, ganó recientemente, digamos, la batalla más importante, el partido más importante de su vida, que fue su batalla contra el linfoma de Hodgkin, del que salió triunfante. Ahora ya superado, Carla se retiró del circuito por la puerta grande y hoy tenemos el inmenso placer de que haya participado con otros campeones y campeonas en el World Cancer Day Solidarity Challenge. Así que antes de nada, Carla, muchísimas gracias y no sé cómo quedaste en el challenge, no sé cómo fue, si nos puedes decir a lo mejor un poquito.
No, para mí es un placer estar aquí hoy contigo, con todas las personas que nos están viendo y escuchando. Y bueno, el evento fue bien, evidentemente que también lo hacía a la misma vez que atletas profesionales que normalmente van en bici o son triatletas y entonces, bueno, yo creo que en mi grupo quedé la última, pero bueno, lo importante es participar y poder ayudar.
Exacto, exacto. No quería yo ponerte en el on the spot, como decimos, porque bueno, lo importante del Solidarity Challenge, como tú dices, es participar y que hayas motivado a mucha gente a seguirte y a participar contigo. Carla, bueno, hoy es el Día Mundial contra el Cáncer y quería preguntarte para empezar, ¿no? ¿Por qué es importante este día para ti? Y que nos cuentes un poquito tu historia.
Bueno, yo creo que no solo es importante para mí, sino es importante para toda la sociedad, ¿no? Porque, bueno, el cáncer es algo muy agresivo, es una enfermedad que por desgracia está muy en el día a día de muchas personas, de muchas familias y se sufre mucho, ¿no? Evidentemente que hay muchos pacientes que consiguen salir adelante, que consiguen superarlo, como por ejemplo en mi caso, pero también es cierto que hay muchas personas que no pueden porque, bueno, ha sido muy agresivo en su caso y bueno, por eso creo que es importante, ¿no? Pues dar visibilidad a todo este tema, el seguir ayudando, el seguir aportando, el poder investigar un poquito más sobre todo este tipo de enfermedades para que a la larga, pues, poco a poco intentemos que vayan desapareciendo.
Exacto, tienes toda la razón y es muy cierto lo que dices, ¿no? Es un día que es para hacer reflexión para todos, para los que lo superan y para los que no, y sus familias, y tienes toda la razón en ese sentido. Tu vida, bueno, ha sido una historia de superación con el tenis, con todo lo que conseguiste en tu carrera. ¿Crees que el hecho de ser atleta, de ser una tenista profesional, te ayudó quizás en tu proceso con el cáncer en concreto?
Sí, yo creo que sí, porque el tenis sobre todo es un deporte individual y cuando una persona está sola, pues quieras o no, en muchos aspectos, muchas veces tiene que ser fuerte, tomar sus propias decisiones, aprender de sus propios errores y bueno, siempre estás contigo misma, ¿no? Con tus pensamientos, con las decisiones que tomas. El estado anímico y los pensamientos son muy importantes y eso me ayudó mucho con la enfermedad porque, bueno, tenía que intentar afrontarlo de la mejor manera posible, de una forma muy natural, confiando sobre todo en los médicos. Es cierto que desde el primer momento, pues, el tratamiento en mi cuerpo, pues, funcionó muy bien, eso también me fue dando confianza, me fue dando ánimo, yo me sentía bien, el deporte me ayudó también mucho a estar activa y bueno, creo que lo supe manejar, lo supe afrontar y por suerte, como te digo, el tratamiento pues terminó bien, ¿no?
Claro que sí. Además, bueno, una de las cosas que observamos siempre los que vemos los partidos de tenis y seguimos vuestras carreras es ese trabajo que hacéis a nivel mental, ¿no? De cómo os preparáis, toda esa preparación que hacéis, tanto física como mental. Quizás esa combinación de factores haya sido una de las cosas que te ayudaron, bueno, como nos estás contando. ¿Tú crees que es algo que a lo mejor se puede trasladar a otra gente que a lo mejor pueden imitar o seguir un sistema similar, por así decirlo?
Sí, yo creo que la parte mental es muy importante, ¿no? No solo a la hora de afrontar una enfermedad, sino yo creo que en el día a día, que en la vida diaria. Pero bueno, sí que es verdad que cuando uno está enfermo, pues lo que tiene que intentar es tratar de poner los 5 sentidos en intentar recuperarse, y yo creo que la mentalidad es muy importante, el estado anímico, el intentar ser fuerte o el seguir luchando. Evidentemente que van a haber momentos muy difíciles, momentos muy complicados, y en ese sentido pues también tienes que saber escuchar tu cuerpo, ¿no? Si tu cuerpo ese día te pide descansar o tu cuerpo ese día te pide estar en la cama, pues también tienes que hacerle caso y quedarte en la cama, ¿no? Porque para recuperarte un poquito mejor, un poquito más rápido, si lo necesitas, pues creo que también es importante. Pero el resto de días que tú te sientas bien o que no estés cansada o así, tienes que obligarte un poquito a hacer cosas, a estar activa, a hacer deporte, y yo creo que esto le puede servir a mucha gente porque a mí me funcionó muy bien.
Muy bien. Gracias, Carla. Cuéntanos un poquito qué experiencias de vida, qué lecciones de vida sacaste de esta experiencia en concreto.
Bueno, sobre todo el intentar disfrutar día a día, el vivir mucho más el presente, el olvidar el pasado, evidentemente el aceptar que tenía una enfermedad, el aceptar que iba a tener que estar unos meses cuidándome, un poquito más pendiente de mí y no haciendo tantos planes de futuro, ¿no? Creo que la lección que más me valió, a la que yo más me aferré, fue eso, el disfrutar día a día, el vivir día a día y estar rodeado de familia y amigos.
Claro que sí, la familia, los amigos son siempre un apoyo tan importante. Y bueno, hoy en día sabemos que hay miles de personas, tanto en España como en el mundo, que están enfrentándose al cáncer y luchando por salir adelante y conseguir avances. ¿Qué mensaje les mandarías a lo mejor a la comunidad, tanto a la comunidad oncológica con la que estamos impulsando, ¿no? en el Día Mundial del Cáncer, y además de los y las pacientes y personas que se están enfrentando a lo mejor a un diagnóstico similar al tuyo? ¿Qué mensajes les darías de tu corazón, ¿no? Un poco.
Bueno, sobre todo que intenten no perder la fe, que intenten no perder la esperanza, que intenten seguir hacia adelante aunque las cosas se pongan difíciles, que confíen mucho en los médicos, en las personas que saben, que bueno, por suerte la investigación cada año ha ido avanzando un poquito más y los tratamientos parece que van funcionando, y bueno, el dejarse querer también, y bueno, que ojalá a la larga pues todo salga bien, ¿no? Sobre todo mandarles un mensaje pues de apoyo y de fuerza que es muy importante.
Y seguro que viniendo de ti creo que es un mensaje muy importante y te lo agradezco, porque sé que hay mucha gente, quien no conoce a alguien que está pasando por un proceso
Exacto.
similar, y desde luego yo creo que es súper importante que gente como tú salgan a dar ese mensaje de ánimo y esa experiencia de ganadora, ¿no? En este caso, y bueno, apoyar así a la gente y a las familias que están pasando por un proceso similar. Además, Carla, te quería comentar, bueno, este año es el primer año de nuestra campaña, que se llama Close the Care Gap, que significa, bueno, lo tradujimos al español como por unos cuidados más justos, que se trata de enfrentarse un poco y señalar las inequidades que hay en los sistemas sanitarios, en el acceso a tratamientos del cáncer, que como sabemos no es igual en todas partes y no es igual para todo el mundo, ¿no? Hoy hacemos ese llamamiento desde aquí, en el Día Mundial del Cáncer, de intentar cerrar esa brecha asistencial, y quería preguntarte por tu parte y basándote en tus experiencias, ¿por qué quieres cerrar tú la brecha asistencial? Why would you close the care gap? En inglés. No lo digas en inglés, pero lo digo para que quede repetido el nombre de la campaña. Adelante, Carla.
Bueno, cuando se trata de salud, creo que es lo más importante para todos, ¿no? Para todas las personas, independientemente del sitio donde sea, del sitio donde viva, el intentar tener esa sanidad, ese acceso a la sanidad, que sea público, que sea abierto, que bueno, que no cueste tanto, ¿no? Porque se trata de una vida, de salvar a una persona, que esa persona pues pueda tener todas las facilidades del mundo para, si en algún momento pues tiene un problema, que se lo puedan solucionar. Y bueno, también nos hemos dado cuenta, ¿no? Durante toda esta pandemia que la salud es lo más importante, y muchas veces en casos concretos de cáncer pues se iban retrasando las visitas o se iban retrasando los tratamientos porque se creía que no era importante, y yo creo que en ese sentido estamos equivocados, ¿no? Porque al final la salud de cada uno es lo más importante, y yo creo que todo el mundo tiene que tener derecho a poder tenerla al alcance de la mano, y bueno, creo que ese sería un poquito mi mensaje, y sobre todo también pues que siguiéramos involucrados en la investigación, en la visibilidad, que bueno, que son enfermedades que afectan a millones y millones de personas, y bueno, que ojalá con el paso de los años pues sea un problema que se haya podido resolver, aunque yo sé que es muy difícil, pero bueno, con días como hoy, en involucrar a la gente, en darle visibilidad, yo creo que es importante para que la salud de las personas pues sea muy importante, y a la larga pues se puedan curar.
Muchas gracias, Carla. La última pregunta, un poco estamos hablando mucho a nivel individual, a nivel personal. Siendo tenista, además, es como que siempre tienes esa lucha como personal contra la enfermedad. Pero sé por experiencia también que muchas veces hay todo lo que es todo lo que circula alrededor de este diagnóstico, que va desde los hospitales, los tratamientos, las organizaciones. ¿Tienes algún mensaje para ellos también, las organizaciones que trabajan detrás, sobre todo bueno, en España, porque en tu caso es allí? Un mensaje para estas organizaciones sobre un poco el apoyo que necesitan y lo importantes que son para cerrar esas barreras de los cuidados, ¿no? ¿Cuál es tu experiencia en este sentido? Y si les quieres a lo mejor enviar también un mensaje
Sí, sobre todo un mensaje de agradecimiento, ¿no? Porque sin esas personas que se dedican a la sanidad, no sería posible que nosotros pues nos sintiéramos tan a gusto o tan confiados, ¿no? Porque hay gente que se entrega al 100% en su trabajo. Los hospitales yo creo que son realmente importantes en nuestras vidas, y hacen una labor tremenda. Y la verdad que yo solo tengo palabras de agradecimiento para todos los médicos, en este caso enfermeras, hematólogos, oncólogos, bueno, que se dedican a ello, que se dedican a ayudarnos, a salvarnos, y la verdad que yo he tenido una experiencia positiva con todos ellos, y desde aquí la verdad que darles las gracias de todo corazón por haber cuidado de mí y por ayudarme a curarme.
Bueno, no podíamos acabar con un broche más bonito, Carla. Muchísimas gracias. Creo que ha sido, bueno, una maravilla, una delicia hablar contigo. Muchísimas gracias de nuevo por haber cambiado tus planes para poder estar aquí con nosotros y espero que lo hayáis disfrutado los que nos estáis viendo, igual que lo he disfrutado yo. Te lo agradezco muchísimo, Carla. Lo mejor para ti en lo que te espera en el futuro, que será apasionante. Y bueno, gracias de nuevo y que tengas un feliz resto del Día Mundial contra el Cáncer. Gracias.
Que vaya muy bien, muchas gracias.
Hasta luego.
Adiós.
Hi everyone, and welcome back to the World Cancer Day live event. I'm Janine Huguenot, and I am campaign manager here at UICC. And joining me now is Raquel Banham. She is cancer survivor and author of the book Sense of Tumor. And she now currently lives in Toronto. Welcome, Raquel. How are you?
Hi, Janine. Thank you so much for having me. I'm fine. How are you?
Oh, we're good here. It's been a long day and we're going to keep going strong. World Cancer Day is not over, especially in the Americas. So
Yes.
we're excited.
It's still starting here. It's almost noon and I can't wait. I can't wait to watch everyone after me also. I've been just busy preparing for this, but after this, I want to watch everyone and I'm super excited.
Excellent. Now, Raquel, you are originally from Lebanon, and as you know, the theme of this year's World Cancer Day campaign is Close the Care Gap, and it's about addressing the inequities in cancer care that exist around the world. And I was just wondering, what was your experience like in Lebanon when you had to go undergo treatment?
Well, my personal experience was amazing, honestly. It's just not to be compared with the situation in Lebanon right now, because we're all aware of the medical shortages and stuff like that. But yeah, when I was there, like honestly, there are pros and cons everywhere. Pros and cons in Lebanon, pros and cons in Canada. But let's start with Lebanon. There are only 3 centers that do bone marrow transplants in Lebanon. In fact, my own transplant oncologist, Dr. Ahmed Ibrahim, is the one who brought the transplant to Lebanon in 1997. So I'm really grateful to have been under his care. And yeah, but my mind goes to the people before him. Like before he brought the transplant, people either did it abroad if they had the privilege to travel, or they let the disease take over them, which falls under the inequity and inequality in cancer care that we've been discussing for this campaign. So yeah, there are only 3 institutions that do it. One of the 3 that I will not mention the name advertises its BMT offer as a package deal where you pay like $120,000 no matter what complications you suffer from after the transplant or during, which is ridiculous. It's as if we're ordering a burger. Like, yeah, you get a package deal. So I think this is really ridiculous. Whereas the place I had my transplant, that institution, it cost around $80,000 as a start, and then you pay whatever complications you suffer from, if you suffer from any. So it's fair, I think. But yeah, the thing is, in Lebanon, we rely on private insurance or Social Security. But Social Security is only for the working people whose employers actually put them on it. Which brings me to talk about an incident that really marked me throughout my journey. I was once signing my books at the hospital where I took my treatment, and this woman comes to me and asks me, "So where are you now? Where are you in the procedure?" And I said, "I'm about to have my bone marrow transplant." So she said, "Oh, are you rich? Is that why you're able to have a transplant?" Because like my uncle needed to have a transplant and he didn't have private insurance, so he died. And that just really marked me, and it was an eye-opener for me in terms of, wow, like there is no equality, this is unfair, it's so unfair. And it really endorsed my survivor's guilt. As you may know, it's something that we sometimes experience, but things like this really, really just make me feel more and more guilty. Yeah, so like I feel like, let alone the discrepancies that happen amongst countries, there are also within one single country so many discrepancies. So I would say I was lucky to have had my treatment in Lebanon, the time that I had it, and I was lucky enough to have private insurance, but yeah, when I look at the situation in Lebanon right now, I can't say it's the same. I don't even know how they're managing to do transplants. If they're doing it, I don't know.
Yeah, thank you so much for sharing that. You really witnessed what we're trying to change in cancer care. The fact that no matter where you live and who you are, you should have access to cancer care. So this is really the essence of the campaign and of what we're trying to do here at UICC. Yeah. So thank you so much for sharing that. How would you, now that you have recently moved, or I don't know, not that recently, but you have moved to Canada and you have to continue your care. So how is that compared to your experience in Lebanon?
Yeah, so first I've been here for 1.5 years almost. Canada has a public healthcare system, which means every single person here has access to treatment and healthcare services. The idea of that is great. It's known to be one of the best healthcare systems in the world. In fact, the US is very jealous, but I'm grateful for it and I can't complain. But from a more realistic point of view, like on the ground, I've met people who have been looking for a family doctor for like 20 years and they still didn't find one because doctors are just not taking new patients. I just happened to be lucky. And since I got here, I've been followed up by an amazing oncologist. But yeah, I noticed the difference here. I noticed it to be different here as for like the wait times, for example. I personally have waited 7 months to get an MRI. And that's very different from back home because it used to be super personal, super immediate care. Like I would call a rheumatologist and they'd see me the same day if I needed it. And then they'd give me the results on the spot and they'd take their time explaining it to me. I mean, yeah, I'd say both systems obviously have pros and cons, but the gap is unreal. Especially with what's happening right now in Lebanon. Like there's a serious shortage of medications. Some patients are forced to discontinue their treatments or sell their cars, sell their houses in order to afford buying their treatment from abroad. While in Canada, there are actually bone marrow transplant services for the pets. Pets, yes, you heard it right. And this is truly unfair, not because pets are not, they don't deserve to have treatments, but I wish all humans on the planet could have access to basic access to treatment first. So I would say pretty different. It's just a different mindset, different everything, really.
Thank you so much, Raquel. Moving on slightly to a different topic. This is not the first time that you're joining us on a live event on World Cancer Day. You joined us last year to talk about your book, Sense of Tumor. And I just wanted to talk about a little bit how writing about this, how it has helped you cope with your cancer experience, and how you think it might help others do the same.
Oh, thank you so much, Janine. Yes, it's my second time being on World Cancer Day, second year in a row live event. So I'm really grateful to be here. And I really admire everything that you guys have been doing, the hard work. I've witnessed it and really keep going. I'm rooting for you. And yeah, of course, I mean, sharing my experience really made it so much easier than keeping all the worries and suffering to myself. To be honest, when I first started writing my first blog entry about my diagnosis, I thought I was the only 21-year-old on the planet who had cancer. Cancer was like that illness that older people kind of suffer from. So I was really weirded out by the thought or fact that I had cancer at 21 back then. But when I was still writing, the act of writing in itself was very therapeutic for me. And then when I posted the article, thousands of people came forward with similar experiences, and I felt no longer alone. I no longer felt like I was the only person suffering from this or that complication or whatever. Like I actually had people talk to me about their experiences and how they've been through the same thing at an earlier age, at 16 or 14. And that was a game changer, really. My goal with sharing my story was to deconstruct the taboo related to cancer, basically. And I can see how it impacted the society around me and myself in a way where I am more empowered. I'm less fearful. I feel well supported, and I'm looking at society and all these women around me who no longer go out wearing wigs or feeling the need to hide their illness. I just feel like people are generally less ashamed of naming their cancer even. Like instead of saying the C word, they say, I have acute lymphoblastic leukemia or sarcoma or whatever. And I truly hope that all patients could find the power to share, because sharing is powerful in itself.
I couldn't say that better than you, Raquel. You know, you really encapsulated what World Cancer Day is all about. It's about joining, you know, our voices. It's about fighting the stigma, and it's, you know, all of us will be unfortunately touched by cancer in one way or another at some point in our lifetime. So this is something that concerns all of us, and this is a day that we can take the opportunity to really rally ourselves behind a common cause and to make sure that we can prevent instead of cure, ideally.
Absolutely, absolutely, yes.
And now moving on to the future, what are your hopes for cancer care in general, but also for your home country, Lebanon, and your adopted country, Canada?
Every patient in the world should have the right to excellent treatment. This is a basic human right, and it's sad and strange to be still saying this in the 21st century. Cancer patients all over the world need so much reassurance and support on every level. But my heart breaks for Lebanon, my home country, where I was once given a chance at life. I know how hard it is to receive a cancer diagnosis, let alone a cancer diagnosis in a country where everything that you've been hearing for the past year or two is that there is no medication and that cancer patients are discontinuing their treatments. So I just wish it wasn't the case. I wish there was equality and equity. If you don't know the difference between these two words, really look it up, because it's so important. It's not the same. Last year on World Cancer Day, I made a wish, and I would like to renew it this year. Here is a cake. And I would like for us to just close our eyes for a second and make a wish to everyone going through it or about to go through it or surviving it and still experiencing some worries. To all the cancer patients in Lebanon and Canada and on every point of the map, I wish you strength, recovery, and a peace of mind.
Thank you, Raquel. That is beautiful. And
thank you so much, Janine.
I join your wishes for everyone.
Thank you so much once again.
Thank you so much, and good luck. Please keep us updated, and we definitely want to know if there is a second book on the way. We want to hear all about it.
There is a second book.
Maybe well, tell us about it.
Sense of Tumor 2 was launched amidst of COVID. This is why the in-person events were not as exciting as the first one, but I definitely hope to make it big and reach the same success as Sense of Tumor 1, because it's very important. It's mostly about my my journey after the transplant and throughout, which is very important, I would say.
Absolutely. Well, thank you so much, and thank you so much for coming on our show today. And we'll be in touch.
Thank you so much, Janine. Looking forward.
Bye.
Bye.
Hi to everyone tuning in from wherever you are around the world. My name's Eric Grant and I'm the Communications and Media Manager for the Union for International Cancer Control. Welcome back to the World Cancer Day live broadcast program. I'm joined today by Kirsty Pomeranski of the Life with Cancer program in Fairfax, Virginia in the United States, who will be taking us through the importance of physical activity for people living with cancer. Kirsty, thanks so much for joining us. How are you doing today?
I'm doing great. Thanks to be here.
Great. Well, I think it's a really important topic, but just before we get to the importance of physical activity, perhaps you can tell us a little bit about the Life with Cancer program and what you do to support people with cancer and their families.
Absolutely. So after having my own cancer diagnosis 7 years ago, I jumped at the opportunity to become part of a health system that helps support people that are impacted with cancer. So I joined Life with Cancer. They're a nonprofit organization based out of the Washington, D.C. area. And we provide free psychosocial emotional support to individuals and their family members that have been diagnosed. And so that can look like counseling, it can look like nurse navigation, fitness and nutrition, oncology, massage, acupuncture, and art therapy.
Great. Well, thank you so much. Now, as you said, you yourself have firsthand experience with cancer. Can you tell us why it's important for people with cancer to engage in physical activity? I mean, I can imagine that may be the last thing you want to do if you're going through treatment.
Yeah, absolutely. I mean, I know firsthand the trauma of this diagnosis, and so using exercise as a way to mitigate that stress and really get through this challenging part of your time is one of the best things that I could recommend. Evidence also is pouring in over the last decade, and it shows that our quality of life improves because of continued exercise during treatment. It helps improve outcomes, meaning you're retaining your muscle mass. You're able to stay on course with your treatment protocols like chemotherapy and radiation more consistently. So that's going to definitely improve your odds of survivorship. And it's also going to help actually reduce fatigue, which is one of the most common complaints that we receive for people that are going through treatment like chemotherapy and radiation.
Great. That's very important to understand. And just, feel free now to start on the routine you want to show people, because I know people might have questions about what they can do, what they can do at home. Is there anything they can't do? So, please.
Okay, so I will just start by prefacing that, we're going to be wanting to look at 150 to 300 minutes of moderate activity during the week. So that would translate to about 30 minutes of aerobic-based activities. So walking, biking on a flat surface, it could look like dancing or even housework. Also making sure that you're strength training 2 times a week. That has really, studies have indicated that this is really important. And so using your body weight to begin with, you need to take into consideration your current health history. If you've been exercising prior to this diagnosis, you also want to take into consideration your treatment protocol, where you are in your treatment. If you're getting ready to have surgery, you can certainly use exercise as a way to channel that anxiety and get ready for that surgery so that you'll have a faster recovery time. You'll want to make sure that you're following your doctor's advice post-surgery, and usually we're going to wait 4 to 6 weeks to recover, but that doesn't mean that you should avoid activity. You should actually be moving and moving often. So that would look like walking, gentle stretches, obviously taking into consideration your doctor's recommendations first and foremost, but continuing to move during this time is really important. On the days that you're receiving, your treatments, you will probably have a cumulative effect for chemotherapy, so you might start to feel fatigued, and you'll want to ease back and honor those limitations for the day. So I'm going to show you a quick no equipment circuit that you can do at home anywhere, and really all you need is a sturdy chair and some space to move freely. So let's begin. I'm going to have you anchor yourselves in a chair, and if you're watching, you can certainly observe or follow along. Like any exercise program, you know your body best, and so you're going to want to take that into consideration as you move through this program. So if there's something that doesn't feel right to you, honor that and move to something that you can do. Always look to the what you can do versus what you can't. That's a good way to frame that thinking. So let's anchor through our feet on the floor. Let's make sure that we're evenly placed in our chair. So just rocking back and forth, taking notice how we feel prior to this routine. And I want you to place your hand on your navel. So sitting up nice and tall, this is a great activity for creating mindful awareness of our posture and also using breathing techniques to help interrupt our stress mechanisms. So let's breathe in for 4 breaths, hold for 4 seconds, and exhale, beginning now. So breathing in, down, expanding into our navel region, hold and exhale out through the mouth. Breathing in, hold, and exhale. We'll finish with one last final breath before we transition to our next movement. Breathing in, hold, and exhale. Let's begin to just warm up our soft tissue, and we're going to roll those shoulders down and back. So just taking notice of how we feel. How is our posture? Are we sitting nice and tall? Are we continuing to breathe? We'll roll our shoulders to the front and begin to take those hands and place them on top of your shoulders. I'm going to have you just bring those elbows, open them, and then stretch. So if you've had a surgery where you might have expanders placed in your chest, you're going to notice that this might feel tight and uncomfortable. So you're going to want to ease back in this stretch. But this is a great way to help increase circulation and promote lymphatic drainage. So sitting nice and tall, continuing to breathe, noticing the muscles that you're using to make this happen. Just ever so gently, we're opening and stretching the chest, but we're also contracting the chest muscles. So we're going to move on to our next exercise, which is great for helping to stabilize the shoulder. I'm going to have you raise that arm. And as you raise, we're going to give ourselves a little squeeze in the fist. Nice and slow, ever so gentle. Continuing to breathe and sitting nice and tall in our chairs. So this is great for promoting circulation, creating shoulder stabilization, and you're going to want to work in a range of motion that feels comfortable for you and where you are in your treatment plan. Excellent. Let's go 3, 2, and then the last one. Crossing the hands over our chest. I'm going to show you guys a quick workaround for squats. I get so much feedback that people hate to do those squats because it hurts their knees. Well, guess what? We have to do this when we stand up out of a chair. So I'm going to have you focus on this for the next 30 seconds or so. I want you to hinge forward in that hip, lowering slowly till you feel that chair. I'm going to have you stand, squeeze the muscles on your backside, and actually activate that pelvic floor. Continuing to breathe, working at a pace that feels right for you, and working on this lower body endurance. So just cross those hands, trying to avoid using your hands to get up out of the chair if possible. This exercise can significantly reduce the risk of falls, and this is something we have to do for life. So we're going to move on in about 3 seconds here and get ready for our next exercise, which will be the cross body punch. I love this because you can really tune into your breath here, and you can also work your obliques, your abdominals. So I'm going to have you ball your fists. We're going to reach across the midline of the body, sitting nice and tall, and I want you to make a ch sound. So you're really forcing air out through the teeth and engaging your abs as you punch out in front. So continuing to breathe, going at a pace that feels good for you. Remember, you should be able to say your name, have a conversation, but not necessarily sing. So this would be considered moderate depending on your current fitness levels. Let's go for 3, 2, and then last one. Let's reset that posture, bringing those legs together. I'm gonna have you place your hands between your chin and your chest. And I want you to press those palms together as if we were gonna squish a pancake. So this is an isometric chest hold, excellent for building endurance after chest surgeries. And then I'm gonna have you interlace those fingers and pull them apart. Try to pull them apart, and we're gonna stabilize the shoulder with this activity. So sitting nice and tall, we're continuing to breathe. Notice how we're feeling. Are we feeling warm yet? All right, excellent. Drop those hands to the side of your hips, and we're gonna begin to lift those knees. This is a great activity that you can use to fill 3 times. So if you're watching TV with your family or friends and you want to get more physical activity, all you have to do is lift those knees and pump those arms. So this is all inspiration that you can use to apply in your everyday life. Smile on the face helps with air intake. And we're going to transition to our next movement in 5, 4, 3, 2, 1. Excellent. Placing those hands on the hips, I'm going to have you extend the leg out in front, and taking notice of squeezing the muscles on the front part of the thigh. For extra credit, you can certainly add some arms. So lifting your arms up, you're working more muscle groups and being more efficient with your time. We'll move on in 5, 4, 3, 2, and then last one. So we're going to begin to pull those heels to our glutes and adding a bicep curl. So this is a way to work the back sides of our legs and our arms. Notice I'm not using any weight, but I'm using the power of my intentions and thoughts to create resistance. So I'm imagining that I'm lifting 20-pound dumbbells right now, but I'm not. I'm just activating those muscles with my mind. Keep going. We've got 3, 2, and then the last one. Excellent job. Let's bring our feet over to the sides of our chairs. We're sitting nice and tall. I'm going to have you raise those legs up as if we were stepping over an imaginary gate. So this is really going to help work those hip flexors and help with fall prevention. We really want to make sure we're doing this because one of the side effects of chemotherapy can be a little bit of neuropathy, which makes it challenging to feel the bottom of our feet. So making sure that you have strong hips, strong lower bodies can help prevent falls. So let's go 3 more, 2, and last one. Remember, continue to check in with yourself. Am I working at a pace that I can still have a conversation, but not necessarily sing? That's the goal. So leaning back in your chair, legs are extended. We're gonna throw out those arms and then bring them back into the midline. This is our star jack, okay? This is a great way to get that heart rate up. We're gonna challenge our right and left brain. You can work opposite arm to leg. See how I wanna throw both legs out? Excellent. Just reach, try to avoid sitting back in that chair and really engaging those abdominals. Excellent job. All right, so we're moving on. I'm gonna have you hinge forward in your chair. Make sure your bottom is planted flatly. We are going to make sure our spine is straight. We're gonna drop the hands to the side of the ankles, pull back and squeeze. So this is a great exercise to help combat our modern living, using computers a lot. That tends to pull our bodies forward. And this is just gonna help strengthen those muscles on the backside that help hold us upright. So transitioning to our last and final movement, drop those hands, come right on back up. Let's square ourselves and check in with our posture. We've got heel to toe raises. So we're lifting those heels, lifting those toes, and just rocking back and forth. This is great for promoting circulation in the lower extremities, helping to avoid lymphedema if possible. And it's also an exercise that you can do to combat sitting a lot. So continuing to notice how you feel, continuing to sit nice and tall, and continuing to breathe. So let's check back in with ourselves, noticing how we feel. It's been about 10 minutes, you guys. Let's place that hand on the belly. Let's breathe in through the nose, holding for 4, and exhale for 4. Let's repeat this 2 more times. Breathe in, hold, and exhale. One last final time. Breathing in, hold, exhale. And let's think of one thing that we're grateful for, and that's me being here with you today.
Thank you so much, Kirsty. That's fantastic. And I just want to remind everyone, this will be available on the World Count Today YouTube channel if you want to come back. Obviously, a lot to remember, but those are fantastic exercises anyone can do at home. And I also just want to come back to one thing you said, which I think is really important on World Count Today, the mindset. When you said let's focus on what we can do, not what we can't do. I think that's a really important message. And just to finish up, if you could let us know what World Count Today and the Close Care Gap campaign mean for you, Kirsty?
Absolutely. I think as humans, we are all connected. And it's my personal belief that we have a moral obligation to one another to empower and to inspire others to take care of themselves. This has a ripple effect so that when we do this, our communities get healthier and it spreads around the globe. So that's really what closing the gap means to me.
So true. Thank you so much, and you have a great day.
Thank you. Have a great day.
Hello, my name is Carey Adams and I'm the CEO of the Union for International Cancer Control based here in Geneva, Switzerland. And if you're watching this on February the 4th, it is of course World Cancer Day. A special day for the UIC team and cancer organisations around the world as we celebrate the challenge of addressing inequity through our new theme, Close the Care Gap. It's a new 3-year campaign in which we want to highlight the inequities around the world which prevent individuals getting to the right treatment and care at the right time. Over the last couple of years, we've seen the COVID-19 pandemic reveal those inequities, and of course they continue even as we progress out of the pandemic itself. I'd love you to go to the World Cancer Day website and look at the wealth of information that's available and draw down information that you need in order to learn about inequity. Take the quiz, try a 21-day challenge, but more importantly, if you are doing something today, put it on the map of events so we can see what you're doing around the world. We saw great things happening this morning in New Zealand and Australia, and it's going through the whole planet around to Hawaii. And I'll be following it as it progresses and we see more events put on the map and the social media takes off as well. If you are doing social media, then use the hashtags World Cancer Day and also hashtag Close the Care Gap. It's an important day for the cancer community to announce that we are committed to addressing inequities around the world. And there's so much that you can do as well as working with the rest of the community. So if you are doing anything, follow us on Facebook, follow us on Twitter, follow us on Instagram, post as much as you can so we can raise the temperature about an issue which is so important to the hearts of the UIC community. I look forward to reading about everything you've done during the day and also seeing what impact we have over the next 3 years as we roll out the campaign, Close the Care Gap. Have a great day.
we are delighted to have Shannon Miller joining us today. 7-time Olympic medalist, Shannon is the only female athlete to be inducted into the US Olympic Hall of Fame twice. She has broken many records and has won an astounding 59 international and 49 national competition medals. Over half have been gold. But Shannon's accomplishments go beyond the field of sports. After retiring from Olympic competition, Shannon studied marketing and entrepreneurship at the University of Houston and then law at Boston College. In 2010, she launched her company which seeks to empower women to make their health a priority through education and awareness. In 2011, Shannon was diagnosed with a rare form of ovarian cancer. She had the baseball-sized tumor removed successfully and followed up with an aggressive chemotherapy regimen. She has remained open and public about her diagnosis and treatment. Shannon is currently cancer-free and continues to be a strong advocate for early detection. It's great to have you with us, Shannon.
Thank you so much for having me.
We have so many things to talk about today, but I'd be remiss if I didn't ask about the Olympics. Many of us remember you as part of the Magnificent Seven, the first women's Olympic team to win Olympic gold for the USA, and of course, your gold medal on the balance beam, the first for a US gymnast. What stands out most for you from your time at the Olympics?
Oh my goodness, that's a long list. It's been such an incredible journey for me with my competitive career in gymnastics. And I look back, and certainly the Olympics were a highlight in Barcelona in 1992, and of course the Olympics in Atlanta in 96. And of course the gold medal moments, those always will stand out. But I would say the thing that I look back and I treasure the most are the friendships that I made along the way, not only with my team, where I grew up, but my World Championships teams, Olympic teams, but also athletes around the world that are still good friends today. So it's lovely to have that bond that you can kind of carry with you 25 years later. We just celebrated the 25th anniversary of the 96 Olympics last summer, and it was fun, but I think it's starting to make us feel a little bit old now.
Well, so great to hear about your friendships from the Olympics. You went from being Olympian to going through a very difficult cancer diagnosis just years later. Can you share about how you were diagnosed?
Absolutely. I think it's important to try and share our stories. For me, as you mentioned, I launched my company devoted to women's health in the summer of 2010. Not to leave the men out, I just don't know as much about you. But that fall, I was doing a lot with regard to the importance of cancer prevention, getting to your regular exams, getting any tests and scans that were available, all of those good things. And I was feeling really kind of overwhelmed in a positive way, but I had called up and almost skipped my own doctor's appointment. But I thought better of it because I felt like I needed to walk the walk as an advocate for health. And I went in that morning to my doctor's appointment, and it changed my life. In about a 10-minute span, my doctor found a baseball-sized cyst on my left ovary. And that sent me into this whirlwind of tests and scans. And by January of 2011, I was waking up to find out that yes, the mass was cancer. It was a rare form of ovarian cancer, but they had caught it early. And it wasn't until a couple of weeks later I found out that it was a higher malignancy than they originally thought. And I would need to go through this pretty aggressive chemotherapy regimen. And I think at that point, something in my mind kind of shifted. You go from this wait and observe period that many of you know about, and it's horrific to wait to find out what's going on in your body. Here I was, this athlete. I had been this athlete for much of my life. My job was to know exactly what was going on in my body at all times, and there was such a loss of control at that point. And I think after the diagnosis and learning that I would need to take on this chemotherapy, I think I reverted back to some of that competitive mentality I knew through sport. I didn't necessarily know where I was going to end up, but I knew I could get up and I could focus on something each day. And it just really started to feel a little bit more empowered in what would come next.
That must have been really difficult. Thank you for sharing. And luckily you went in for that first appointment and you didn't miss it. Is there anything else you would have done differently at the beginning?
I think there's definitely one very important thing I would have done is I would have listened to my body more.
So did you have symptoms?
I think as an athlete, and I'm sorry if the picture's frozen a little bit, but I think as an athlete, I really understood how to listen to my body. And I think that's what I would have done differently prior to the diagnosis. I would have listened to my body. You mentioned symptoms. I went in and told my doctor I felt fine, but what I didn't realize that I had been experiencing 3 of the 4 primary symptoms of ovarian cancer, but I had brushed them off as if they were no big deal. I had really bad stomach aches that I just kind of felt like I needed to power through and keep going. I had people depending on me. I had to get things done. I had bloating, which any woman deals with on a regular basis. And then I had sudden weight loss, which for me, I thought that I was just still losing baby weight. So I didn't feel like it was a concerning thing.
So listen to your body is the underlying message. How did your experience as a competitor?
I think so. I think we have to listen to our body.
Yeah.
And really be our own best health advocate.
Definitely. How did your experience as a competitive athlete help you in your battle against ovarian cancer?
I think the lessons I learned through sport were so important. Things like a positive mental attitude, which isn't always easy, but it's definitely helpful in the journey. Goal setting, some of my goals were not that big, but for me, my goal was usually during chemotherapy to walk 2 times around the dining room table. That was a really good day. I think teamwork is really important. Many of us feel like we have to do this by ourselves. We don't want to burden anyone else. We don't want to complain. But it's really important to surround yourself with a positive team, not just the medical, but friends, family, neighbors that are willing to help out.
Yeah, it's really interesting to hear you talk about your body so openly, talk about your symptoms. I know that a lot of people struggle to do that. Did you ever struggle to talk about those symptoms with your doctor, to talk about your body with your doctor, and do you have any words of advice to offer those who might struggle?
I don't think it's easy for anyone. It's not fun going to the doctor, waiting in the waiting room, putting on the paper gown, sitting on the cold table. It is intimidating. And many of us have a zillion other things that we need to be accomplishing. And so you're trying to get in and out quickly. And I fight that urge even now, but I also now take steps to ensure that I make every doctor's visit really count. So I do things like, if I have an issue that's lasting more than 2 weeks, I write it down. I write down the dates and I write down kind of what's going on so that when I see my doctor, I'll be able to give specific information. I write down any health questions with me, and I make sure that I get them answered before I leave, because I know as soon as I leave the doctor's office, I'm going to have 5 questions that I totally forgot to ask him.
That's really good advice. Writing down symptoms, remembering what's wrong, and not ignoring what's happening in your body when you feel like something's not the way it usually is. And you've shared so much about how you felt when you were diagnosed, the period waiting to know your results. But after the diagnosis, how did that change your outlook on life?
I think my outlook, I've always been very goal oriented. So every time I hit a goal, I would be on to the next one almost immediately. After I won 5 Olympic medals at the 1992 Games, I was in the gym 3 days later because I wanted to set that next goal and go after it. I think my cancer journey has showed me the importance of stopping and smelling the roses and really appreciating every moment that I have.
Thank you so much, Shannon, for joining us today. It was really great to hear about this. And I think your words have been inspiring, not just in this live stream, but will stay with us long after and give us lots to think about. So thank you for spending your time with us this World Cancer Day.
Thank you so much.
Hello again, welcome back to our World Cancer Day live stream. I am so happy that we are now shining a light on a region that has been embracing this campaign wholeheartedly, and that is Latin America. Although this segment will be conducted in English, I want to take a moment to welcome our viewers from Latin America in Spanish. So, bienvenidos y bienvenidas a todos los que nos estáis viendo desde América Latina. Muchas gracias por estar ahí. Tenemos un panel de lujo, así que me voy a permitir presentarlos y continuamos en inglés. Let me introduce you all to our guests. We have Sandra Aquino, that is an accountant by profession, mother of 3, cancer survivor and patient advocate, most importantly. After being diagnosed with breast cancer in 2010, she became involved with volunteer work, and now she's the president of the Asociación de Pacientes con Cáncer Fe y Esperanza de Honduras. They provide support to those living with cancer in Honduras. So welcome, Sandra. Very nice to see you today.
Thank you, Laura.
And let me also introduce you to El Maestro Kenji Lopez Cuevas. He's the founder and president of Cancer Warriors Mexico. He is also a member of the board of directors of UICC since 2020. Kenji is a Mexican lawyer. He has a master's degree in public policy, and after cancer touched his family personally, he decided to formalize this NGO focusing on prompting legal initiatives and public policies on behalf of children and adults diagnosed with cancer in his country. Thank you very much, Kenji, for joining us today. It's always a pleasure.
Thank you, Laura. It's a pleasure for us.
So now that we have introduced you to everyone, I think it's a good time to set the scene a little bit in the region, in Latin America and Central America. So Sandra, why don't we start with you perhaps? No, actually, sorry, Kenji, we are going to start with you and set a little bit that scene in Latin America and what basically are the gaps in cancer control in LATAM.
Thank you very much, Laura. It's a pleasure. And I would like to take this time to congratulate you and all the wonderful team of the UICC for the organization and all this powerful and inspirational job you are doing to commemorate the World Cancer Day. Of course, we have taken these past months to organize as NGOs part of the UICC membership and to discuss and to talk about the different gaps we have here in the region. This helped us to construct the actions that we have conducted during these months. The first one is a gap that we have confidential in the region as countries, is the lack of medical treatments, the oncological medical treatments for our minors and adults. It is conducted because of the pandemic, the COVID-19, but also because of different administration initiatives conducted by our governments in different countries. But also we have focused our efforts in have more public economic resources in order to focus on the fight against cancer and also the control of this disease. We also are asking in different forums, in different spaces, the necessity to put economic resources in order to execute our law that it is a mechanism to fight against this disease. We as NGOs of the Latin America region consider that legal mechanisms are resources to which we must bet on this fight against cancers, since they can be solutions that have permanent impact on the control and prevention of cancer. And I would like to talk later about what we are doing on this behalf, because, for example, Chile established the national cancer law on last year, on 2020, with objective is to establish regulatory framework for the planning and development and execution of public policies, programs, and actions aimed to establish the causes and preventing the increases in the incidence of cancer. Other good example is Peru. Peru published a national cancer law on last year. This law aims to guarantee universal, free, and priority coverage of health services. And another one is El Salvador, which published this year the special law for the prevention, cancer control, and care for cancer patients. And also in Mexico, we have adopted last January 2021 the general law for the timely or early prevention of cancer for children and adolescents. Thank you, Laura.
Thank you so much, Kenji. It's incredible all the work that is being done in the region. Let me go now to you, Sandra. Perhaps give us a little bit of perspective as well on what are those cancer gaps that you're finding from your experience in Central America and perhaps in the region. Thank you.
Yes, thank you, Laura. I'm honored to be addressing important facts and issues today related to cancer in Latin America. And in Latin America, cancer is a major public health issue. The gap affects everyone, perhaps not you, but someone you know. And as a fact, let me tell you that every minute across the world, 37 people are diagnosed with cancer, and more than 19 people die from the disease. So that I could mention some of the major cancer care gaps, such as the lack of timely diagnosis. Screening is not reached to most of the population in Latin America. There are major problems with service quality, infrastructure, follow-ups, and inadequate facilities. Also, there are variations between countries, either in Central America or South America, in terms of cancer control effort. Not all countries have a national plan control for cancer. Moreover, understanding of what an effective plan needs to contain is often lacking, and frequently lack of resources is an issue for our countries. Another major gap that we find is that our country faces what we call very little money on health budgets. They're very small compared to developed countries. Cancer is now a priority for the limited funds, and also the results in most of these countries is that they have insufficient resources for cancer needs, and also we don't have enough resources for prevention, early detection, treatment, and that's a problem that most of our countries faces.
Absolutely, Sandra. It really is a great summary of lots of those gaps that we are finding, and it's really something that resonates not just in the Latin America region, but I think globally. So you are really mentioning some of those really important gaps. Kenji, I would like to go back to you now. You are based in Mexico. That's kind of where your organization is based. Can you tell us a little? Can you tell us a little bit more about how the situation is in Mexico, and what are you already doing to try to fill those gaps?
Yes, of course, Laura. Well, our situation is very similar in contrast with different countries in the same region in Latin America. That's the reason why we are taking this opportunity of the commemoration of this great day to raise our voices, to ask our authorities to execute our laws, to execute our national cancer programs, and to defend. The most important thing is to defend the rights of patients diagnosed with cancer. We have facing here from 2.5 years a lack of treatments, which of course affects the health of minors and adults with this disease. And what we are doing, taking this opportunity, is that we have organized together 45 civil organizations, members of the UICC, and we are executing a number of activities in the framework of this great day, World Cancer Day 2022. And one very important I would like to share with all the audience is that we have executed an exhortation with a call, this is the exhortation, with a call to action to address to the decision makers, to share on social networks and supported by the NGOs members of the UICC Latin America region to urgently address as a matter of priority a certain number of points. One of them is the early diagnosis and equitable treatment of cancer in the region. Another one is the correct and adequate implementation of national plans and programs, as my colleague Sandra just mentioned. And another one is the allocation of sufficient and necessary public resources for the prompt and expeditious care of this condition. And we also have a video that you already saw, and I know that we will broadcast in this forum. It is a video shared on our social media with the participation of all the organizations that we are members of the UICC, and we are expressing a call to action to the decision makers. We have a lot of faith in this day and a lot of faith that we are representing in a good way what our patients need in our region.
Absolutely, Kenji. It's wonderful. It's, as you said, 45 organizations from, I think, at least 14 countries, which is something truly remarkable. And I think it bears mentioning that this is something quite unique that the Latin American region is able to convey and mobilize. So I really want to congratulate you all, because I know that there has been a lot of work put into this document that you just shared, as well as on all the activities that you have put together, and the video that we will see at the end of this section. I would like to go back to you, Sandra. Perhaps you want to tell us, like, you are based in Honduras, and perhaps going a little bit closer to your relationship, like to your day-to-day life with cancer patients in Honduras. Can you perhaps share with us a little bit of that experience, and also maybe a message of hope as well for the future?
Of course. Just to give you an idea, in 2020, an estimated of 10,628 new cases of cancer were diagnosed. And this is really a reason for what we really are always fighting for. In Honduras, we lack cancer registries, which provide essential information for an effective cancer control. And healthcare, you receive healthcare cancer control depending on your health system. You could be either for the kind of cancer you are being detected, either prevention, for treatment, for palliative care services, and that's not all included. There are areas are the poorest in Honduras with no access to a specialist. We don't have enough human resources. The equipment for cancer control are sometimes obsolete, since it remains in urban areas. Making diagnosis is less likely, adding the travel expenses that most people have to make, and this adds to the cost of the treatment. Also, since you asked, we have pronounced all these differences to the policymakers. We have expressed to our new government that cancer has to be considered a priority. To update the cancer control plan, we need to have all those technologies available, such as radiotherapy, mammography, and to extend prevention with appropriate screening programs and early detection, as Kenji has mentioned. The provision, again, of financial support is very important for our region, especially in our country. Investment in cancer healthcare is a must. It's not something that they need to discuss. It's something that needs to be as part of part of the government plan.
Thank you, Sandra. I mean, you couldn't be more clear about it. This is a clear call for action, and this is what this campaign is all about, to making those important requests to governments, to decision makers, and there is a need to prioritize cancer and to close those gaps. Kenji, perhaps you want to leave us with some comments as well, and a message of hope. I think that if anybody can convey that strength and passion is you. So I will leave you to say like the last message, perhaps for the public around this campaign, Kenji.
Thank you, Laura. It is a huge responsibility to provide with this message, but yes, the battle against cancer needs all of us. You and us, we all know that we live in different countries. We speak different languages. And yes, we have different gastronomy, but the enemy, Laura, is the same. The enemy is one, and is cancer. The advantage we have right now is that we have a huge power together, because cancer is only one, and we are many and many from time to time, and together we are stronger. Let's keep this battle to close the care gap.
Excellent. Muchísimas gracias to both of you. I think it's really been wonderful to have you. I think we will leave our viewers with the amazing video that these 45 organizations have been working towards, and I think there is no better way to show how passionate and incredibly engaging is the work that the Latin American region has been doing on this campaign. So I leave you to watch the video for yourself. Thank you.
Y desafortunadamente, en esa misma hora, más de 150 pierden la vida a causa de esta enfermedad.
La detección tardía, la carencia de recursos públicos suficientes y la falta de implementación de políticas públicas en el control de esta enfermedad
generan brechas que ocasionan desigualdades en el acceso a una mejor expectativa de vida para niñas, niños, adolescentes, mujeres y hombres diagnosticados con cáncer.
Hoy, 4 de febrero, es Día Mundial contra el Cáncer, una iniciativa liderada por la Unión Internacional para el Control del Cáncer desde hace 22 años.
Cuyo objetivo es sensibilizar y movilizar la comunidad mundial para realizar un progreso sustantivo en la lucha contra el cáncer.
Por unos cuidados más justos es el lema para este 2022.
Cuyo propósito es reconocer y entender las inequidades del sector oncológico.
Y así lograremos en cáncer una atención más justa y equitativa en todo el mundo.
Hoy, los países de la región de América Latina, miembros de la UICC, nos unimos en una sola voz.
Porque aunque mantengamos diferentes culturas, luchamos contra un mismo enemigo en común, el cáncer.
En el marco de esta fecha tan importante, hacemos un llamado público a las autoridades de nuestra región con la facultad de incidir en esta batalla.
A impulsar acciones para solucionar las problemáticas presentes en la región.
Acciones que garanticen el abasto de medicamentos oncológicos en tiempo y forma.
Acciones que aseguren una detección temprana, un tratamiento integral y de calidad y una investigación eficiente del cáncer.
Acciones que impulsen la publicación de normas y reglamentos para instrumentar nuevas leyes y programas nacionales de cáncer.
Y principalmente acciones que reflejen su compromiso para luchar por unos cuidados más justos en esta batalla.
Recuperar la salud no debe estar condicionado al nivel de ingresos,
al lugar de residencia, al género, edad u origen étnico.
Cada persona con cáncer debe de tener la garantía de que cuenta con las armas para ganar esta batalla.
Hoy contamos contigo.
Contamos contigo.
Welcome back to the last World Cancer Day stream of the day. We made it. It's been a long day of streaming, and here we are, Laura. We have arrived.
We have arrived. We made it, as you say. We've been streaming all day long. I kept doing this thing that I've been saying. We've been streaming all day long. This is the end of the road for us. Obviously, we know it's not the end of the road for the World Cancer Day campaign. As it continues unfolding, especially now in the Americas, that they are waking up to this amazing day of activities everywhere.
Laura, speaking of activities, there have been so many. And also, we highlighted some of them during our program today. What was your highlight? What's your personal highlight you want to tell us?
You know what? Instead of a highlight specifically, because I loved absolutely every segment and everything we heard. I'm gonna say that to me, those stories from cancer survivors, like cancer patients or cancer survivors that they joined us today and told us their stories literally from their heart, and it was I think it's such an inspiration for people that are actually in their shoes right now, like starting their journey. And to me, that's always incredible. So that was wonderful. I loved it.
Well, it's not really fair, Laura, because I wanted to tell everyone what my highlight is, and you took what I wanted to say. But
well,
of course,
because that's everyone's highlight, obviously.
What stuck out to me was really the song by our member in Malaysia, Scan, Many Tomorrows. I mean, the fact that you went out of your way to produce a whole song, get a songwriter, to come up with this. It just really moved my heart. And it's not just for World Cancer Day, but it is for Close the Care Gap. So thank you so much. It really warmed my heart. It was really great.
Yeah. No, I couldn't agree more. It was the production of that song is wonderful.
Amazing.
So, yeah.
And also our Solidarity Challenge, athletes that came and took their time to speak to us for World Cancer Day. Carla Suarez, Paula Ratcliffe, and Lawrence Alaglio. Thank you so much for coming on the show earlier today. We really enjoyed having you.
I mean,
amazing highlight.
Incredible. Like, those are absolutely amazing. I think, the whole day has been such a big celebration. And as I said, like, we are continuing unfolding events, and our map of activities is still buzzing. We have everything. I can't wait to hear how are we trending topic. Like, what can you tell us on that sense, Janine?
World Cancer Day and Close the Care Gap was trending and is trending on Twitter today, so that is great news.
That's amazing.
We were also mentioned by the British royal family and Jill Biden, the First Lady of the United States. So we are really excited, and of course it's not going to stop here. We're going to keep watching our social media channels. We're going to keep looking out for your posts, so please don't stop. It's not over.
And let's not forget that the world has been turning orange everywhere. And one of these amazing activities that we see every year, and every year we are most astonished, is the turning the world in orange, the lighting of the landmarks. This year, we started the day with Australia, obviously our day. It started with Australia and New Zealand turning orange in a way that is just incredible. We are, like, kind of for the first time, I think, ever, thanks to one of our members in Brazil, Femama, we have the Cristo Redentor, Christ, as it's so known, orange and blue. Like, this is incredible. It never happened before. This is a first for World Cancer Day. We also have to thank our dear Princess Dina Mired of Jordan. She's the immediate past president of UICC, that she managed to get Petra in Jordan lit in orange as every year. The Bosphorus Bridge in Turkey, also thanks to a member organization from Turkey. Latin America turning orange from Buenos Aires to Costa Rica, San Jose. Romania, like, having several landmarks. Like, I can't. I could continue. I could continue forever, basically. And basically, now that we are in Geneva, the Jet d'Eau, our personal, our own landmark is orange. So what else can we ask?
The whole world is orange.
The whole world is orange. We have orange here, orange there, orange everywhere, and we love it. So thank you for that commitment. It's wonderful.
We've also been seeing a lot of your videos, Close the Care Gap. So thank you so much for joining us in this challenge. We're really thrilled to see all those videos, and we're going to continue to look out for them.
Yes, I mean, I couldn't even tell you a personal favorite. They are so funny, interesting. I've been learning new things like all day. Like,
and creative.
So creative,
yes.
So creative, and some really interesting, like with music and production as well. Like really, it's always amazing. I would like also to say, you know, the way that we are always so supported by our community or our members. I mean, I can only say, send us such a big thank you to our member organizations that make our community of UICC. And just as a testament, these masks that we are wearing today, like these lovely white masks, they come from our members from UICC Japan. So thank you so much, arigato, for this wonderful gesture of having us wearing this excellent, because Janine and I, even though all day we have been able to be talking in an individual basis, because we are together, we have to be wearing a mask.
We abide by the rules, of course.
Yes, we do. So that's just to say, you know, again, like such a way of embracing the campaign, our members and our community, that I want to send an immense thank you for your engagement. Thank you.
And I would like to take this opportunity to, of course, also thank our partners who have been supporting World Cancer Day. A special shout out to Novartis, Roche, BI, Gilead, MSD, Amgen, BMS, Genmab, Sanofi, and Seagen. And also a special shout out to Dr. Tedros at the World Health Organization, Dr. Vaidapas at IARC, and Rafael Grossi at the IAEA. Thank you so much for supporting us.
It's absolutely wonderful to see as well people from, you know, from our literally cancer patients organization, small groups of you know, like from the individuals to all these big organizations that they are behind. I think this is a really important date for global health, and World Cancer Day is a testament that is for everyone, and we just really want to make sure that everyone has access to the resources that we have on the website, that everything that they can do and contribute to making sure that we speak about those gaps and make sure that we do something about it.
Yes, exactly. Thank you.
Yes. So
yes, it's been great, Laura. And with this, we're going to just say bye. We are coming to an end of our live stream. So thank you so much for following us and joining us.
Yes.
And
yes.
I think there's only one last thing to say.
I wanted to say before, I wanted to say thank you to you, Janine. I think it's your first year as campaign manager for this, for World Cancer Day, and I feel we owe you as well a big thank you for your dedication to this day and for everything that you've done to make this happen. So.
Don't make me cry. It's been an honor. Thank you.
All right. So
Let's close the care gap.
Let's close the care
gap.
Let's close it. Yay!